Has everybody got their headphones on? Can you hear me? Yeah? We're starting. Hello, everybody, and welcome to the WHO Pavilion here at COP26. Congratulations to all of you who made it through the huge queues in security and are here in person, but also an incredibly warm welcome to everybody who's joining us online. We're hoping to bring your voices into the heart of COP today and to our panel. My name's Nikki Philpott. I'm one of the Greener NHS team here at COP and delighted to be here. And I wanted to tell you a little bit about the NHS to start with, because it's really quite an extraordinary tale. And then I'm going to ask the panel to introduce themselves. So back in 2020, the NHS made a commitment to get to net zero. It was the first healthcare system in the world to do so by 2040. And it also pledged to do that with everything that it could influence, its supply chain, procurement, etc., by 2045. And we're delighted that has happened, but it's absolutely meaningless unless we work with everybody in the system. And that's why I'm delighted that we have an amazing panel here today, because they represent lots of different parts of that system. We have people who work in industry, people who represent medicine, people who represent journals, and big systems, big hospitals. So without further ado, I'm going to ask them to introduce themselves, and what I hope will be a very interactive, very relaxed session. I think we're amongst friends. And they're certainly all lovely. So let's go to our panel and ask them to tell us who they are and where they're from, and maybe something about why they're passionate about this subject. So James, can I come to you first?
Can you hear me okay? Yes, great. Hi everyone, my name is James Dixon. I'm the Associate Director of Sustainability at Newcastle Hospitals in the northeast of England. So I lead the sustainability team in Newcastle. And I'm a chartered environmentalist. So why is this interesting to me? I'm a professional in this space, trying to reduce the environmental impact of organisations, and I'm a tree hugger at heart. So that's why I'm passionate about it.
Self-confessed tree hugger, wonderful. And Fiona, you.
Thank you very much, Nikki. I don't know what a chartered environmentalist is, James, but you'll tell us, won't you? Because I'd like to be one. Is it hard to do?
Yeah.
Okay. Okay, so I'm Fiona Godley. I'm editor-in-chief of the BMJ, the British Medical Journal. I'm a physician by background, and I think I've been passionate about environment most of my life, but I think being a doctor and going to the Earth Summit in Rio in 1992 for the BMJ to cover that very first of these big international meetings about climate change, I think really did change my life, really, and it made me want to be part of getting doctors, nurses, other healthcare professionals to really see climate change and tackling environmental damage as part of their role and to make it mainstream. And that's been a big part of what the BMJ has been trying to do over the past 20 years.
Thank you. And Claire.
Hi, can you hear me okay? Good. Learning a new system of hybrid meetings again. I'm Claire Lund, so I'm the Vice President of Sustainability for GlaxoSmithKline, which is a global healthcare company. And why am I passionate about sustainability? Well, I think I've had a very long journey going through, if you think about like a river meandering between public and private sector organisations, but always with the flow of environmental science and economics, which is my core background, and really understanding the interconnection between systems and ecosystems and nature. And we know, obviously now, climate change and nature loss are interconnected, and it's great to hear all the pledges and the interconnections here with nature and climate change. But we also know it's interconnected with the impact on human health. So actually that systems approach, that understanding, for me, is extremely inspiring, motivating, probably driven by being dragged around as a small child through country parks and forests every Sunday when it was raining, sunny, doesn't matter what, and just understanding how the ecosystems work and just finding that really fascinating. So I'm extremely actually proud to be working for a healthcare company. So it's not just looking at how we can build solutions for improving people's health, but now with our ambitions around net zero and net nature positive by 2030, really taking some action on the planet's health as well.
Thank you, Claire. And last but definitely not least, Jacob.
Thanks, Nikki. So yeah, I'm Jacob Krzyzanowski, and I primarily here as a clinician, but then secondarily I represent the Royal College of Psychiatry. I'm one of two registrars for planetary health and sustainability at the college. And in brief, the college basically is a professional body which represents the specialty of psychiatry in the UK. In addition, I'm also an associate at the Centre of Sustainable Healthcare, which I'm very grateful for having really brought me into the space of sustainability. I think sort of mirroring what Claire's just been saying about her weekends, I think also, if I was to be honest, I probably would say that my upbringing had a lot to do in sort of a roundabout way. I remember Fiona and I mentioned this to Fiona in appreciation that I had the opportunity to be outdoors quite a lot. My parents sort of showed me the value of that. And so I think in the background that's been ticking away. But I think primarily how I came into this space 3 or 4 years ago was sort of a mix of excitement and frustration, working in clinical health services and just wanting to make a change. And I think sustainability, beyond everything else, is an opportunity to I guess, build back better. And so there's a lot of passion and excitement inside this space at the moment. And I think that alongside also what you mentioned, Claire, about sort of systems. Mental health is hugely complicated, and I think a lot of us are trying to understand what's going on. So there's a lot of interface between the thinking that goes on in mental health, but also I think in sustainability. So there's quite a lot in common.
Thank you. That's really interesting. You keep the mic, because we're going to come to you for the first question. And
Sure.
I'm delighted that you're representing mental health, because it's something that we sometimes overlook in that kind of health debate. I wondered, Jacob, if you could tell us a bit about a time when you or your college have collaborated with another organisation, because this is all about collaboration and partnership and how we work together. And it would be great to hear an example of that. And I'm going to ask each of our panellists that question.
Sure. So I think the first thing to point out to me is that the more I know about the Royal College of Psychiatry, the more I get a sense that it's an incredible microcosm of collaboration within itself. So you've got people with backgrounds in journalism, within finance, and then of course the clinicians. And so within our committee is quite an interesting, again, sort of prototype, where on our committee we have people representing finance, representing comms, and also the clinicians, as well as advocates for the sustainability and climate change. Specifically, I would say that more recently, members of our committee have been collaborating with the Royal College of GPs, so reaching out and looking to basically do some thinking around what would sustainable prescribing in mental health practice look like, and recognizing that a lot of prescribing for mental health actually happens at the primary care level. And so bridging those gaps and seeing them. So I think there's a combination of seeing what the problem is, but then actually reaching over the table and making that connection is really valuable. A final sort of bit is that I think within my own work on the Green Walking Initiative, which looked to promote access to green spaces, I saw my primary role as reaching out to occupational therapists, knowing that I think as a medical clinician I had more leverage within the system. And so I think it's really important about recognizing all the different players that are happening within a healthcare context, because it's a fundamentally quite interdisciplinary and people have different levels of power that they can activate. And so I think it's really important that you recognize that the team has different abilities, but that you also need to reach out and help others.
I think this theme about people having to work together, but also people being on different parts of the journey, will really come out, and how we bring people with us. And I know James will probably talk at some point about the staff in his hospital and about how that works. Thank you so much. Fiona, same to you. BMJ, obviously, you know, an amazing company. How have you worked with collaboration with other organisations?
Well, I mean, the first thing to say, and Nikki, you've been a big part of this, is that we, together with others, established the UK Health Alliance on Climate Change, which is a collaboration with the Lancet, the BMA, most of the major medical royal colleges, and the Royal College of Nursing, and other societies in medicine in the UK, healthcare. And that's been a kind of evolved over time through a previous sort of less elaborate collaboration. And the purpose of the UK Health Alliance is to really try to get the health voice into the debate about climate change, and to really help health professionals across the UK, and also working with international partners to arm health professionals with the information they need so that they can confidently talk about this and do so as part of their everyday lives. So it's not something that is sort of over on the side. It's really saying, this is actually your responsibility, and here are some tools to make you feel like you really can talk to your colleagues, to your patients, to healthcare managers, and see what you can do within your healthcare system. I see people in the audience from the Centre for Sustainable Healthcare also, which is a wonderful organisation doing at the very clinical level, looking within specialties, what each specialty can do. And Jacob's just talked about greener prescribing, which is a huge part of trying to bring healthcare to be more sustainable. And then the other part of this is collaborating. Well, I mean, I don't know if it's collaborating, but campaigning. So it's a slight extension of your question, Nikki, on the issue around prevention and real prevention, not medicalised prevention, because unless we do less in healthcare, we're not going to be sustainable. So part of the thing, and it's a bit of a challenge in a way to the pharmaceutical companies to say, how does it feel for pharmaceutical companies to be asked to prescribe less instead of simply, differently and less? And it'd be quite interesting to get your thoughts on that, because I recognise that is a major part of this. Unless we do everything greener, but also a lot less, we're not going to get there.
Yeah, there was someone here today who was talking about how we have to deal with this issue, like our resources are limited. So perhaps then it's a good time to come to you, Claire, and to find out how GSK has worked in partnership with other organisations.
Brilliant, thank you. And I will take that sort of question point, but I think just in terms of, I think the theme is we cannot do this on our own, whether it's a pharma company, a healthcare sector, system. If you peel back the layers of where everybody's emissions are, you start to quickly realise it. It's like an onion. Take the layers off the first tier of the NHS, then you go into the suppliers, then you go through our supply chain, and so on and so on and so on. So frankly, if we don't collaborate, we won't get anywhere. So I think the challenge is real. But I think there are two things when you think about collaboration. There's the sort of internal one. I think your example of working, across functions is really powerful. So in GSK, for example, we're a large company. So we've got, how do we break down the silos in the functions and work collectively? And what we found works really well is we've integrated it frankly, across the business. So every leader has sustainability as part of their objectives, as part of their core objectives. So they're incentivized in the same way that they are to deliver business performance, to deliver the and of sustainability as well. So that's working really well and breaking down a lot of functional silos within the organization. And again, examples of working with R&D, manufacturing, supply chain, procurement, just internally to really drive innovation on looking for lower carbon propellant, for example, for the meter-dose inhalers, looking at how we optimize packaging, how we optimize the product design using green chemistry, because again, you recognize reduction of resources for us is also a benefit for our environmental footprint, and so it really does build by looking at breaking down those silos and working collectively. And that's just internally. And then you've got the external sort of collaboration with working with innovative partners, with regulators, with peers. So we're really working on solutions that are cross our peers, because actually, again, you're recognizing we've got the same suppliers, the same supply chain, and actually all tackling the same issues. So if we go together, go aligned, we will have far greater impact. And there's some more information hopefully coming out tomorrow on some of those objectives. But I do, Fiona, to your point, it was resource reduction and sort of sustainable use of resources, whether that's medicines or whether that's products or services, is the only way we'll meet, the balancing of the environmental ecosystems, frankly. So it's sensible because it's also a cost reduction piece. So this is where the and of sustainability can start to really come in. So in terms of looking at the cost effectiveness of reducing resources, whether that's prescriptions, whether that's the actual use of chemicals, the use of energy and water to make products, and they're all actually beneficial together. So I think actually it's not actually a difficult decision. It's more about how do we do it and do it fast collectively.
Absolutely. And James, finally, from your experience, how have you worked collaboratively? What's been the kind of situation?
Well, Newcastle Hospital is one of the reasons I'm here today. Is we've got a long history of working on sustainable healthcare, and that started at the beginning when we worked with energy providers to provide on-site energy generation at the turn of the century. We were the first in the UK to bring reusable sharps boxes into the UK, and that was a collaboration with an industry innovator. And then probably more recently, some practical examples. So one challenge we had of getting staff between hospital sites we wanted to get an electric bus to provide that service. Electric buses are very expensive. This a few years ago. The capital expenditure required for that is going to mean the revenue hit on us for that service is far too much. So talking to the providers and how we could potentially do that, we came about with some innovative procurement. So we agreed to have a longer contract, which would reduce the impact on the revenue hit for the trust, but it allowed the providers to soften the blow of that big capex. So that was one innovation. And then probably an example of collaboration clinically, some of you might have heard more recently, nitrous oxide, very effective analgesia, particularly in labour, pain relief, used for over a century in the UK, 300 times worse greenhouse gas impact than carbon. So trying to provide solutions that still provide that clinical benefit, but reduce that environmental impact. So we sought out working with UK partners in anaesthesia, sustainable anaesthesia, Centre for Sustainable Healthcare colleagues here as well with the Sustainable Fellow, and found a Scandinavian company that were doing this really well, and worked with them to deliver the first baby that had cracked that nitrous and oxygen into harmless nitrogen and oxygen.
It was a wonderful moment to see that, and you did a great job telling the world about that baby. It felt like one of those proud moments, like the NHS gave the first vaccine and the NHS did the first baby with nitrous that was more sustainable. It was wonderful. And that's reminded me, it's really good idea for me now to do a shout out. When you can get back into the negotiating space later on today, seek out some photos that we have there. We have an exhibition of NHS staff doing things sustainably. It's beautiful portraits. You can also see them on our Twitter feed at Greener NHS. And do see that, because we have a photo from Newcastle actually highlighting what James has just spoken about, so that's good. And while I'm shouting out, two other things. It's also a great opportunity to see some innovation here at COP on the car park. We have the world's first electric hydrogen ambulance. It's designed to go 300 miles. It's a huge piece of innovation that we've been working with partners across the kind of UK on. So please go and have a look at that and hear about how that ambulance is better for people's health and really great technology and not polluting our air as it goes around doing its business, and talk to the paramedics out there, because I know they'd love to see you. Just a reminder to everybody watching online, we really want to hear your voices right here in the heart of COP. Please put some questions in the chat. We'll make sure we try and come to you in a minute. We will definitely try and take some questions from the floor. So before we do that, I wondered if we could talk a bit about global situation. We at the NHS are asked all the time to give advice, to tell people how to do it. If you were looking at your counterpart in another country or in another health system, what advice would you give them? Claire, if I come to you first, it's actually, you're a global company anyway. So what advice do you give people, or what kind of inspiration do you give them to start on this journey?
Great question. I think the first thing I would say is start. It's great we're hearing pledges, commitments. My job is all about designing how we're going to get there, but actually the bigger part of my job is delivering how we're going to actually achieve that. So start would be my first piece of advice. And when I say start, there's three things I think about how to start. So first of all, leadership, commitment and support is essential. It sets the tone, sets the direction. And if you're making some difficult decisions, or you're starting to have to change the behaviour and the culture, you've got that leadership support. So leadership support is the first thing. The second one is there are solutions available today. They are possibly the less sexy, energy efficiency, renewable electricity, reducing waste, reducing water use. They're all available. This is not novel technology. These are cost-effective ways of delivering resource optimization today. So start, that comes back to that second point. And then the third one is share and collaborate. I mean, what you're finding is there is a wealth of people that have started on this journey already. This is not new. I know it's not new for the NHS as well, but there's opportunities to really learn. Don't reinvent the wheel. Share, collaborate, understand what others have done, how they've done it well, the lessons they've learned from that. So I think those are my three key points. Get the leadership, commitment and support. Start on the stuff that is already able to be implemented now, and then share, because actually there's others people that are driving this agenda as well. So those would be my tips.
Great tips, thank you. James, Do you have anything to build on that? I imagine leadership is one that you're also very interested in Newcastle, having been the first sort of trust to announce a climate emergency, to have that leadership. But what advice would you give to other hospitals? And indeed, have you done much kind of conversations with hospitals around the world to sort of help them on their journey?
Yeah, there's what comes to mind with that, Nikki, is Healthcare Without Harm Global, a great NGO that pulls together healthcare systems across the world to collaborate on the main themes of climate action and environmental impact reduction. So I would definitely advise anyone across the world in the healthcare system to reach out with them. There's local local organisations representing the US, Europe, and other parts of the country. So that would be the main driver. Also, there's always opportunity. So just building on Claire's point, if you find there's a door closed on one project you're trying to work on, there'll undoubtedly be plenty more. Sustainability is so vast, it's not just about carbon. It is about greening our estates, working with our supply chain, working with clinicians to reduce the environmental impact of their care. So anybody wanting to adopt this, I would follow the passion. So you will find that there's green champions, as we call them, climate champions, who want to work with you. Follow that passion, work with them. The successes we've had in Newcastle hospitals are based on clinician-led projects. So anaesthesia is a really good one. We've also done great stuff in nephrology and kidney care. So you will find that there's clinicians that want to do this, and they often just need a bit of help on the practical sides around sustainability to get it done. And on leadership, yes, so I've been, environmentalist at the Trust for 11 years now. So it's not an overnight success. It's a lot of hard work. There's been doors closed and as many opportunities there are open. But it was securing that top level buy-in that we've seen the transformational change. So it was a dark winter for me in 2018-19 when the IPCC report came out. I've been in this game for a long time, thinking that incremental change was the way forward. And it was a real soul-searching moment for me that I thought, this is nothing. The future for my kids is terrifying. So that was really, really difficult. But luckily, my wife's a psychologist. Shout out to Jacob's crew. And she saw where I was going and made me focus on the act of hope that I could have influence. And that led to us, me kind of barraging my board to say this is a health priority and needs to be as such. And thankfully they listened, and I didn't know what it was going to lead to. I just wanted them to understand the science and the pain that I had. And now we've lifted a lid of it. Dame Jackie's at a session tomorrow, and it's been transformational. The investment that we're having in buildings and services is with climate emergency in mind. So I'd really encourage anyone to try all you can do to secure that top leadership buy-in.
It really does make all the difference, doesn't it, when you have that? And I think we all have met people in the last kind of couple of years who have felt alone in their hospital, in their ward, wherever, and not feeling like they're part of something. And I think hopefully now we're making that much more of a collaborative effect. Fiona, are your editors around the world, are your your journal editors, are they all on board with this? Are they understanding this and writing about this and researching it? Or what advice would you give them to do more?
Well, a year ago I would have said not enough, but amazingly, as a result of the work from the UK Health Alliance and others, we did manage to pull together more than 220 medical journals around the world and healthcare journals to all publish the same editorial calling for a fundamental change in our societies, without which we're not going to save the planet, basically. And also calling for protection of nature for biodiversity. And that was a really amazing achievement. And in particular, without wanting to call one journal out, but I will now do that, it was really important that we had the New England Journal of Medicine on board. It's the most highly cited journal in the world. It has an enormous amount of influence and kudos. And the new editor, Eric Rubin, immediately when I asked him, said yes, absolutely, and was delightful to work with. So to have the premier medical journal in the world signing up to that, and an American journal, because that has been really a block in the past, was incredibly helpful. So my other advice would be that medical journals do have a voice, and although you get pushback from some sectors of your readership if you talk about climate change, saying, well, what is the medical journal doing? Writing about climate change is not relevant. It's not beta blockers. It's not, knee surgery. But repeatedly saying this is core, this is something that we as public health professionals, we as medical professionals must be speaking out about, and then providing your readers with education so that they can then become effective advocates. So that's a second piece of information. One is start, rather like you were saying, Claire, and then really keep going. And then a third thing is that medical journals can convene, and that's what we found, the Lancet and the BMJ working together to pull together the medical colleges and associations and nursing colleges and associations in the UK. The same can be done in other countries, and medical journals in Scandinavia have been very active. It would be nice to see the American journals really getting their weight behind convening medical societies across the UK. And I know that Ed Maybach, who's been working to do exactly that, I'm sure would welcome the help of the medical journals in America to really get the medical societies on board. Because once you get the leadership voices across medicine and healthcare, things do begin to move faster, and we really, really do need that.
Thank you. And Jacob, coming to you now, looking at your colleagues around the world, what advice would you give them? What would you say that they should do to start this journey if they're not already?
I think I'm probably just going to keep elaborating on what seems like a degree of consensus. There was a really good talk yesterday about sort of the shifting that people need to go through, which goes from awareness, acceptance, and action. And I feel like perhaps we're at a tipping point where action is what people are comfortable talking about. So I think that doing wherever you are is deeply important. I think that's how I identify, and I think a lot of the people I've been inspired by have just gone and done. I think I would add a caveat about the leadership point, though, because I'm a little bit sensitive that I think people might wait for leadership to start first. But what I've seen within mental health is that you have people who just keep dropping their shoulder and they just keep doing. And what they're actually doing is building foundations. So from within the RC Psych, there's people who've been working on this for 5 or 6 years without the sort of support they could be getting as well as they could. And then people like myself who are in a different generation have been able to pick up all that work and all the networks that have come with that. So I think leadership is a tricky point because, you can bang on that door all you want, but sometimes if it's not going to open, it's just not going to. And so you just need to keep doing that work. And I think it's a bit of you can sort of be lulled into a false sense of action by waiting for leadership to do that. But I think at the same time, you need to push. And equally, building off Claire's point about collaborating, I think the other thing too is that, waste is kind of the enemy of sustainability in a sense. And so I think part of what you should be thinking about is waste of effort. And then and that being a sort of inroads towards collaborating. So within the RC Psych, we've had colleagues from Germany reach out to us about how excited they were on the position statement, which was a long, laborious process of 6 to 8 months, followed with the college declaring a climate and ecological emergency. Again, emphasis on both the climate and the ecological. But when they approached us about it, we just said, well, just translate the position statement. Don't spend 6 months writing this thing. Just take it and take the pieces that you want. Equally, something else I wanted to point out was within our college, we have the CCQI framework, which develops standards for good quality mental health care. And one thing that we've done is rather than, again, reinventing what is called the sustainable standard, go back and almost retrofit. Say, okay, actually, give people a bit of space to feel some hope that what they're already doing is sustainable, but just shine a light on what actually is sustainable and give them a bit of hope. Because I think the idea of building something from scratch is a lot more intimidating than being able to also give people credit for what is actually fundamentally sustainable already. Because a lot of that's happening. It's just about, I think, us using what is an amazing opportunity to promote what is excellent, good clinical care, which is by definition going to be sustainable.
I think now we're kind of just halfway through, and we want to take some questions from some audience that we've got remotely. So I wondered if we could pass the microphone to my colleague Natalia. And Natalia, can you tell us what's been happening on the chat and pick out a couple of questions for our panel, please?
Of course, very happy to. So I'll start with one question that's come from one of our NHS colleagues. So what examples are there in reducing waste in the NHS that we can share and learn from?
I think that feels like a James question immediately.
Well, I can give some practical examples of waste reduction, but with a nod to the prevention angle, that's what we need to focus on. So clinically, the prevention of ill health is going to have so much more benefit than which bin you put your waste in. But on the waste segregation, very complex in UK healthcare. We used to call it the colours of the rainbows chart, because it's not just, one colour for this, one colour for that. How do you reduce? So it's waste hierarchy, just like it is with prevention of care hierarchy. How can you eliminate your waste at source? So don't use single use if you don't need to. So reuse of surgical instruments, there's a lot of on-site processing. Champion that cause. Colleagues in the audience have done detailed life cycle to show that this is sustainably beneficial. So don't be short term and think that 1 pence per single-use instrument is going to be better for the bottom line. You need to look across the piece. So definitely championing those causes, and then working with your facilities teams to provide recycling facilities. So, as you get further down there, how can you just stop disposing of things? So we have not sent any waste to landfill since 2011. That was a waste manager's kind of role of working on those contracts. So reach out to your teams to find out what the contracts are and how you can start to influence on some of those specifications, and then work with the teams to get the facilities out there so that you can actually put the waste in the right bins.
That's really impressive. And some of the things I love hearing is when individuals on, wards or kind of different primary care sites have kind of gone, actually, I'm going to take this on as well. And it's not a sexy subject, but I'm going to make sure I make a difference. Waste is sexy.
Yeah,
okay.
yeah,
Oh.
absolutely.
Claire, do you have anything on waste? I imagine. I imagine that you probably do from kind of your perspective.
I'm still following from that comment about waste being sexy, but in terms of, I guess, advice in terms of waste, it is about making sure you're following. I mean, it sounds boring and practical, but follow the waste hierarchy, which is what can you avoid in the first place, but not just looking at it from that particular lens. Actually, is there a wider lens to look at it? I'll give an example that we're seeing that's rolling out now: e-leaflets, digitalisation of patient care leaflets. Frankly, if you could just remove that leaflet, that is not having to produce the leaflet in the first place, not having to transport it. I know it's very light, but if you start thinking about how this builds up, so avoidance is the key, but looking at it not just from, well, it looks very small, it's a leaflet, how much impact is that really going to have? But actually, if you look at it from a much wider sort of approach, it does have an impact, therefore it is worth tackling, it is worth looking at. So avoidance is the first one. And then it is going through the waste hierarchy, then looking at how can you mitigate, how can you reduce, how can you then recycle. So recycling for me has got to be the last pathway, because actually if you can not produce it in the first place, that is always the best option.
Jacob.
Just building on something I mentioned beforehand, I think it's also important for us to talk beyond just material waste, but I think also thinking about the sort of well-being of staff and effort and energy that goes into making those changes. I think a lot of things that happen within the health service feels as though people are being asked to do work on audits and QIs, and they're not supported to make that change. And so I think you have to be mindful that in terms of sustainable pillars, I think the sort of psychological, emotional, of course, I guess maybe that's the hat that I'm wearing today, but I think that the problem is that we often struggle with what can't be quantifiable, but then is somehow intuitively very clear. But if you can't support your staff to work and make change, that is the resource that you're needing to actually implement those things. And we can do the numbers and we can say what needs to be done, but if you're not supporting your staff and you're not providing a sustainable environment for them to do that change, you simply can't enact it. But again, I think this question of how do you integrate things that are harder to quantify is a very critical one.
Thank you. Natalia, another question, and then I'll come to the audience. So it's not fair that you don't get a chance to ask too. So please get some questions in your heads. Natalia, next one.
There's one that follows on from Jacob's point. So how can we best motivate colleagues and leaders locally in the wake of the pandemic when many are exhausted and understaffed?
Jacob, do you want to take that one?
I feel like maybe I'm happy to follow on, but does someone else want to take the lead on it?
James, you have an amazing system. We all know this in Newcastle. Tell us about Shine. Tell us about how you're supporting staff.
Yeah, so on the staff side, Shine, that stands for Sustainable Healthcare Newcastle. So that's our brand. I think I've got my little reusable bottle here. And that we established that 5 years ago really for an identity so that staff could see where they could support the reduction of environmental impact in their services, whether if they were interested in waste or more active travel or maybe a sustainable quality improvement project that they wanted to lower the carbon in their care pathway. So really a collective identity, working with the champions or whatever you want to call them across the organisation, giving them a platform to collaborate and share, support them as best you can. Since we declared a climate emergency, we prepared a small pot of money as well, the Climate Emergency Action Fund, because often a lot of these projects need a little bit of pump priming, and when you're struggling for revenue and the challenges of the pandemic, you need that little bit. So we've been very fortunate with that. And then across systems as well. So in the UK, we have emerging integrated care systems. So they work on a regional patch where we're trying to get your municipal, local authorities together with your public health as well as your acute and mental health and primary care providers. So we're trying to take Shine up to a regional level and have a bit of a collective work and bring people together. Often I find that, staff, this resonates with staff. It is a health issue. The climate crisis is a health crisis. Capacity to work on these things is quite difficult at times. So I think we need to acknowledge that, but really focus on why it's still a priority for health. And that seems to be something that resonates at the minute.
Yeah, I know in the NHS we did some surveys, and it showed that staff, while they were not necessarily aware of our net zero targets, they really, really wanted to work on this agenda. And often, a few years ago, I think you would have had people thinking that people don't want to do it, but now it enlivens people. It does make them feel energised. It's something that they want to do. 9 out of 10 people support this in the NHS, and I think it's really good. But it is an important question, isn't it? Because we have got staff in the NHS have been through an incredibly difficult time. I wonder, Fiona, how do you think your journal is supporting staff to kind of be interested in this, but also not making it feel like another problem on their plate?
Well, I think this is a really big issue, isn't it? I mean, speaking for the NHS, speaking about the NHS rather, we know that there is a problem of underinvestment in all sorts of aspects of health, the health service, and that's probably in other countries too, but the NHS does struggle with resource. So making the case for this on top of the fact that we have, problems with staffing and beds and resources generally, and then the pandemic, which has left us, really, really struggling, and people are exhausted. I think that is really important to acknowledge. I think it does come down to inspiring them, and I think there are large numbers of healthcare workers who really do feel that they, for their own sakes, for their children's sakes, as health professionals, that this is something they really, really want to give their energy to. So I think what we have tried to do is to give people a sense of hope and a route for action, so that they can really feel, rather than endlessly being harangued to just do something, but actually specifics about what they can do. And so we're increasingly trying to provide those specifics, both as members of the public and as trusted health professionals, and as people who have a large play on the resources, because they're the ones who are prescribing and diagnosing and referring patients for treatment. So there are a number of different ways that we've really tried to do this, but we also have a well-being campaign, which is about staff having space to rest, reintroducing doctors' messes, where doctors can, I don't know what the international term for a doctor's mess is, where they can go and just debrief and relax and get a cup of coffee and maybe somewhere to have a sleep. So looking at taking a break, and also having ways of sort of getting mental health support, to try and cope with burnout, which has been a real problem. So those two things of well-being and sustainability, I think, can really go hand in hand, and I think that's going to be our challenge over the coming years.
Thank you. Claire, what about GSK? What's your how do you encourage staff?
It's a good question. I'm trying to think of it in terms of relevance for the audience, but I think Fiona makes a good point, which is recognition that a lot of people have been exhausted, I think, is key, but then supporting them with the right tools and choices, so you're not bombarding them with a plethora of options and then leaving it up to them to choose. It's making it very clear, very easy, very accessible to do, something positive. I think that's the key as well. And then recognition, again, points that have come through here, which is around recognizing that when those people are taking action and delivering, that it is, supported, it is, recognized, So we do. We have sort of champions on the networks as well across global sites. We've got a single-use plastic reduction program across the globe, which is really for people on sites and locations to get involved in it. But it's not seen as on top of, it is as part of what you're doing, and how do we integrate that so it doesn't feel like and another thing to do. And then frankly recognising and sharing when they've done some brilliant stuff, which they have across the network, with other parts of the globe. And they do actually feel very proud and inspired and motivated by that as well. And I think actually part of what a lot of the sustainability agenda really should be about is that positive hope. This is, really trying to drive not just the planet's health, but it is improving people's health as well. So this really should be a positive driver, and it's making sure that we aren't overburdening, providing that simplicity, that support, and that recognition.
Yeah, absolutely. Jacob, do you want to talk a little bit about that? I mean, maybe also this thing about hope, which I think is an interesting philosophical concept.
Yeah, I mean, I think it's hard to not think immediately of the concept of active hope, which has been promoted by Chris Johnson and Joanna Macy. But I think also this idea that, hope is a very active feeling, that you actually have this idea that you can do something constructive. And I think that's, you sort of know it when you're doing it, but I think it's very difficult to instill within institutions, particularly ones that are under so much strain. So, yeah, I mean, I think that it's not a... we're kind of in this in the long run at the point. So it's a bit of like we've kind of entered a full-on quadruple marathon at this point. So I think how do we sort of stay afloat as we're going forward is a very, again, I think we need to think much more seriously about this question of what can't be quantified, because I think part of our interest about biodiversity loss and ecological loss and that impact kind of touches to that question, because sort of a loss of nature in certain aspects, I mean, how does that impact on people's health? People kind of look quizzically, but ecosystem services is a really helpful model for that. I mean, nature is everything. And so I think being too focused on the quantity and not thinking a bit more holistically could potentially provide certain blind spots. And if we're going to be in this in the long run, we should be keeping a much more wider perspective.
Thank you. And I mean, just to segue a minute to that, I think one of the most hopeful things I've seen recently was the cycle ride that James and Fiona Latterly did from London to COP, and actually was done by WHO from Geneva to London. And I wonder did that feel like a sense of active hope, Fiona?
It really did, actually, because when we were just talking about it a moment ago, James, we both agreed that it was I think we used the word joyful, didn't we? I mean, rain and hills and not very fit and, worried that would I embarrass myself by being not able to do it. I only did the last leg, which was the shortest leg, so 35 miles from outside Glasgow into Glasgow. But it was such a lovely experience, and it was partly that there was a huge amount of kindness amongst the people cycling. There was no kind of, macho or competitive feeling around it. And everyone was looking after each other. There was a lot of humour. So it was a really good sort of symbolic gesture in itself, but also the way it was done was really wonderful. So, I was delighted to be part of it, and I was so impressed by the people who did the whole way. 8 days, however many miles, 500 plus. You did the whole day.
James, tell us, how many miles?
Amazingly impressive.
I haven't tallied it. It's over 500.
Right.
I don't want to tally it. But it was, and the last leg, although it was the shortest, was by far the hardest. So
Thank you, James. Yeah.
Because the weather, we're in Glasgow. It's lovely today, but it was atrocious on Sunday, and it was so cold. You see your breath coming over the hills coming into Glasgow, and that was the only time. But it was amazing. There was such a diverse group. We had healthcare professionals. We had presidents of royal colleges. We had child healthcare providers. We had AHPs. We had tree huggers from the trusts like myself. And it almost seemed just like a staging post that, everybody was coming together. We had young people there doing the ride as well. Young Toby from Grey Ormond Street, who actually delivered the Dermot's letter to COP, was an inspiration. And everyone was looking after each other, like Fiona said. But a staging post in that it just felt like, right, we're going to come together as child healthcare providers. Often, child healthcare providers are quite niche in acute healthcare. 5%, I think I heard Matt Shaw, of the CEO of Gosh, who joined us on the ride, saying. So I think there's going to be some good coming out of that, and some dedicated work on collaboration across the Child Healthcare Alliance as well in the UK. And there's a global one that we'll be able to touch into as well.
Amazing. I'm in awe, and it sounded like a very positive thing to do. Is there anybody in the audience that might like to ask a quick question? I'll just come to you now, sir.
Hi, thank you. Fantastic panel, and it's great to hear about all the work that's going on. Makes me quite proud to be British. Question. I think one of the challenges about being a front runner in any sector is that it's difficult to know how far and how fast is good enough. And we've seen this with many. And I was just wondering how the panel thinks about how to kind of add up, sorry to quantify, but kind of how to add up all the activity that's going on in the context of the UK's NDC of 68% by 2030. And net zero is the end goal, but we've got 8 years of really hard action. So, how does the NHS overall contribute to that, and to what extent is the bottom-up work and the top-down targets need to come together? I'd love to hear some reflections on that. Thanks.
I just asked, sorry, to say who you are.
Oh, of course, sorry. Ed Rees-Jones. I'm with BCG, so we're a consultancy. We work with pharma and governments and the NHS as well.
Thank you. Who wants that?
I think, Nikki, you're the person to answer that.
I think I'm just struggling so much with masks and whatever. I think somebody else needs to help me out. Seriously, though, who would like to... Claire, would you like to have a go at that?
Is this you don't know who to turn to? We'll turn to Claire. Right, thank you. So, great question. In terms of sort of how do we make sure that we're doing enough and looking at... Well, I think, to be honest, I don't think there's a question, are we doing enough? It's I think we know we need to do more. So I don't think we're going to hit that barrier of, oh my goodness, we've done too much. So I think it is actually just don't worry about quantifying, get on with it, actually. But I think it's also in terms of, well, where are then the material aspects and where do we need to focus on? Things that will take longer to do and change. I can give you the example in our space, which is changing the propellant over for metered-dose inhalers. That is not an overnight change. So we've started now because we know that's going to take time to develop. But then there's also things, like I said before, that you can start now as well, really just driving into. So, renewable electricity, energy efficiency. So there are huge examples to start on and not wait for new technology, not wait for leadership. I mean, those are things that are now, they're active, you can get moving on them. Do we think we're going to hit a barrier when we've done too much? I'd love that to be the position, frankly. But I think it's more a case of don't worry about that part, just start moving and driving. How does that feed into the UK's NDCs? Well, I mean, the global healthcare emissions are around sort of 4 to 5% of greenhouse gases is what healthcare systems contribute to the global piece. The NHS has done a big deep dive in terms of what does that mean for the UK, and the data is available. And you can break it down by sort of, well, what are the contributing parts? So you can see how much, from our parochial side, how much of medicines fitting into that scope 3 for the NHS, which is around sort of 20%. So you can see sort of where those contributions fit. But I don't think the problem is are we doing too much? I think it's how do we do more, frankly.
Thank you. I wonder if we could pass the microphone just back there to the lady at the back, and we'll take that question now. And then we'll come to the chat. So anyone in the chat, like a question, and it will go to the top.
Thank you. So comment and a question. Thank you for the talk. It was just brilliant to hear what everybody had to say. So my comment is that inspiration is amazing, and I'm a child psychiatrist. I'm with the Royal College of Psychiatrists, and also editor-in-chief of the Journal of Child and Adolescent Mental Health, which is an international journal, and we've commissioned a special issue, amazing papers from all around the world, and as you say, Fiona, it's a really important platform to use to collaborate and to do that internationally as well. On another level, though, leadership is really important, and it's amazing to hear what you've been doing, James. But having worked for the NHS for 35 years, as you know, you come, you do the work, you go. The next person just isn't interested, and the leadership disappears. I did an experiment where I work, which is Oldham, which is one of the most deprived areas of England. most people I spoke to, families and healthcare professionals, didn't know what COP was. And I just feel I'm in an echo chamber here. I mean, it's a really important one, but how do we get that message to areas like where I work, where we're understretched, under-resourced, overstretched, under-resourced, not enough staff, people living in poverty, just trying to get food on the table. I can't see this happening. Leadership is important without financial levers in the NHS. And I was talking last night with Jacob about sequin targets, for example. Those are targets that we have in the NHS, and then trusts get financial rewards for meeting those targets. I cannot see this happening unless we introduce those and introduce them really quickly. So it'd be really interesting to hear what the panel have to say about that.
Thank you very much. Jacob, do you want to sorry, not Jacob, James. Do you have anything to say about that? Being a trust, thinking about the money side.
Well, the money's a challenge. Fiona rightly said, years of austerity in public services, the NHS is struggling. From an operational point of view, decarbonising heat is the biggest challenge, absolutely. So the UK is heavily relying on fossil fuel gas to heat our buildings and our infrastructure. So transitioning away from that is a real challenge. That's going to take billions to do across the estate, but we're not waiting there. A lot of trusts are planning out how that can happen, how we can phase it in at the right time and build in the capital plans. On the clinical side of things, I'm aware of sequins working well, certainly in acute care where, for example, the sugar tax and changing the food offering in outlets and things, I've seen how that can work. So I know those kind of levers do work. And then in primary care, around inhalers and the incentivising switch of dry powder from the propellant, I'm probably not as au fait clinically on other sequins that could potentially help.
Fiona, did you want to come in on that?
Well, I mean, I was just going to make a slightly glib point, but we had a panel yesterday which included Emma from GSK, Chief Executive at GSK, and also the Chief Exec of Microsoft. So this was the NHS suppliers really showing their commitment to reducing their contribution to the NHS's footprint. And the point was made by Brad, the chief exec of Microsoft, that they have financial incentives. The chief execs of their different bits are incentivized in their pay packet according to whether they are achieving their climate change, their carbon targets. And I asked David Pryor, who is the chair of NHS England, whether we should do the same for chief execs across the NHS. He didn't say yes to that, but he kind of implied that there will be targets. There will be. I mean, Nikki, you all know more about this, and I think that the sort of financial incentives to trust to see environmental targets as absolutely at the same level as their clinical and financial patient safety targets. I think that's the only way we're going to get there. I mean, Nikki, sorry to keep pushing the thing back to you, but
yeah,
this, don't you?
I absolutely agree. I think that is important and that needs to happen. But I think I also hear your point about, this is an issue that where people are struggling to put food on the table. This is like another thing, and I think we have to be really mindful of that, and everybody has to engage with this debate, otherwise we're lost. There is no way we can keep this in a small room here at COP. We are running out of time. I'm going to take one further quite quick question from Natalia from the online chat, and then I'm going to wrap it up. So if we could just have a quick question, Natalia.
Of course. So the final one is, what is the most important message to give to political leaders in relation to health and climate change?
Great question to end on. Jacob, can I come to you?
Yeah, I can start. I think the first thing I would say is just a sign of gratitude. Perhaps it comes as a surprise, but you think about the negotiations that are happening and the amount of people are being, we're expecting a lot of people to solve the problem. We've given them the sort of control of the wheel. But I think if we're not going to be appreciative of that work and if we don't keep it in good faith, then it's like, what are we doing? And so I think there has to be a sense for me of appreciation. The second bit, I think, is that if health isn't front and center on the table, then it's not an honest discussion, because that's actually the bottom line in the long term. And so I think I think it's Dr. Maria Naira from the WHO said that there should be COP1 for health. And again, I think whoever thought about putting the number at the end of COP, I think really put a clever bit, because it feels like it's a painful reminder that this is number 26. So again, this should be, just echoing what she was saying. And I think, again, this interesting point about NDCs, about why not, I was at an amazing talk here yesterday about why are we not including health into the NDCs, because of the cost savings as well. And that there's amazing countries like Colombia, apparently, which is doing incredible work, and others as well. But that's an easy way to start doing it.
Thank you. Claire, what would your message be to the world leaders here, or what would your constituents' message be today?
I mean, I think realistically it is that. It's put health at the heart of this, because climate change and nature loss, and I love the fact that now nature is finally being appreciated as part of the debate as well, are an impact on human health. So actually, this should actually be a COP about human health, and then, you know, how do we solve that? By solving climate change and nature loss, right? So I think that the message for me is bring health right into the centre of this, because actually some of the challenges that we're hearing as well in terms of how does this then get deployed to those that need it most, so the communities and the local communities that really actually are on the front line of the impacts of climate change and nature loss as well, and inequality, they need to know that this is front and centre as well. So I think it's really important that message is landed. A COP for health would be great, but also, if nothing else, a health day at a COP would be a step forward, frankly, as well.
Thank you. Fiona. Oh, are you okay?
I think that's such a good. Sorry, maybe just get.
Yeah, James,
James.
let's come to you. What your colleagues, your friends, your co-workers at Newcastle, what would their message be here?
Well, I think I'd echo what colleagues have already said. It's really inspiring to see health actually have a presence at COP for the first time, the WHO Pavilion, and actually talking about the health crisis that is the climate crisis. I think my colleagues would want me to say that we need to keep fossil fuels in the ground, and that subsidising fossil fuel industries is just exacerbating ill health across the planet. And I think this is the opportunity that we need to have to really shout that message loud and clear. The healthcare professionals I joined on Ride for Their Lives from London to Glasgow, it was a focus on air pollution, but it was very much delivering that message that this is harming the health of children, future generations, and it needs to stop. And not just those in the developed world. The developing worlds are suffering more for the development that we've had, which has been fossil fuel heavy. So absolutely have that as a focus.
Thank you. And Fiona?
I'm now recovered. Thank you very much. I think that the point about gratitude is very important, and I think the message from health generally should be that we're with that we're all aligned. We want the same thing. We're not in conflict here. And I suppose the only kind of pressure, or the major pressure, is that this is going to have to be fundamental change. It's not like just a tweak here or tweak there, or waiting for the technology to make carbon capture, those sort of things. It's about actually changes to the way we live, and that's going to be incredibly hard. But if the politicians can take courage from the fact that they have the health professionals with them in this journey, that we all are pressing them to be courageous. And take what the necessary action, then hopefully this won't be, a wasted breath for all of us.
Absolutely. So look, here we are at COP. It has got 5 themes. One of them isn't health, but health fits into absolutely every single one of those themes. And I'm delighted that I feel like this is the first time I've seen it bubble up everywhere in this pavilion and in these negotiating rooms. So it is wonderful. The NHS will always be the first healthcare system in the world to say it's going to get to net zero. But at the end of this COP, we certainly hope it's not going to be the last. And we do hope that other countries and other health systems will join us. And we're very much looking forward to some of those announcements as we move into week 2 of COP. But for now, I just wanted to thank our panel, Jacob Kronowski, Claire Lund, Fiona Godley, and James Dixon, for their fantastic contributions. I've enjoyed very much talking to them this morning. And one further thank you, our colleagues at WHO, for letting us use their pavilion, for their health leadership in this space, and for being there today. Thank you so much, everybody. Thank you.
Brilliant. Then, good morning, everybody, and also to the people who are online. Good morning, good afternoon, good evening. A very warm welcome to this session where we are hoping that we can launch a newly established thematic working group on climate resilient and sustainable health systems. This group is basically one of the 10 thematic working groups within Health Systems Global. I'm not sure how many of you on the call and in the room are aware of this thematic working groups, but we will be sharing the links to these to the HSG website where you can find out a little bit more about us. The outline for this thematic working group is over 4 years, and hopefully you will find out more about what our plans are over the next 60 minutes. I will also take this moment now to introduce our chair today, Professor Chris Ebi. She's a professor at the University of Washington. She brings over almost 25 years of experience in conducting research and practice on the health risks of climate variability, but also strategies for responding to it. She has supported multiple countries in their risk and vulnerability assessments and also supported countries for the development of the health components of the national adaptation plans. She's an author of multiple national and international climate change assessments, including the 4th US climate assessment and the IPCC special report on global warming of 1.5 degrees, which I think many of us have learned very essential lessons from. So over to you, Chris, and thank you very much for chairing this session.
You're here, I'm sure, because you're aware of the extensive risks that climate change presents both for our health and for our health systems. And this working group is going to be critically important to help move forward the agenda, better understand where we understand enough so that we can scale up actions that are already being taken and where additional actions will be extremely beneficial to protect and promote human health in the face of a changing climate. I am delighted that we have such a stellar panel today, and I'm going to give you just the overview of the real expertise we have with us today so that we can spend most of our time listening to the presentations. You just heard from Ravati. She's the head of the Climate Change and Health Group at the UK Health Security Agency, and we'll hear from her again in a moment. Suzanne Mayhew is the professor of health policy and reproductive health at the London School of Hygiene and Tropical Medicine. Kabir Sheikh is policy advisor at the Alliance for Health Policy and Systems Research. Jonathan Drury is the Climate Change and Health Advisor for the Pan American Health Organization. Major Clemens Buter is the Pan American Health Organization Advisor for Planning and Operations. And finally, at the end, we'll have some remarks from Kelly Saldana, who's the Director of Health Systems at the Bureau of Global Health at USAID. And with that, let's get started. Ravati, would you like to start with the first presentation and give us more detail on the thematic working group?
Yeah.
Thank you.
Thank you, Chris, and apologies for people in the room. You can see me sit with my laptop in an odd position because the people online need to hear me a little bit better. Brilliant. So I think the first thing that the thematic working would... Sorry? Fabulous. Do you hear me now, Chris? Yeah. So I think the main objective of the thematic working group is to build momentum between practitioners, policymakers, and academic researchers to move from risks to resilience. And I think that is the key thing that we would like to achieve over the next 4 years, and also kind of scale up, as Chris said, and many of us have heard over the last two days, for understanding and responding to the impacts of climate change, but specifically on health systems. Next slide, please.
Sorry, Roxy, just to make it very quiet there, if you're able to move slightly closer to the microphone.
Is this close enough?
It's a bit better, yes.
Yeah, okay, then I'm just going to hold it like this. It looks really funny, but that's fine. Okay, so the other challenge that we have is, of course, the conceptual immaturity that we are struggling with, which makes operationalizing resilience within health systems quite a challenge. And of course, we have seen quite a bit of transition between how we have understood, right, starting from the 6 building blocks of the health system strengthening concept to moving to the operational framework, which came in 2015, and now, of course, this year the shift of looking more at the facility level. And that also kind of brings to front the importance of locally led adaptation and how are we strengthening the environmental sustainability and the infrastructural integrity of healthcare facilities in improving our ability to respond to the health impacts of climate change. And of course, in parallel, we've also seen drip feeding of systems thinking concepts into health system strengthening, which of course started around 2009. But how do these concepts converge? And how can we use this to better understand the impacts on the health systems, but also our ability to strengthen them over time? And then, of course, when we talk about resilience, we talk about return to baselines. And then we've seen from the pandemic as well that which baselines are we referring to? And how are we going to measure progress? And what kind of indicators can we then develop for the follow-up of understanding how health systems resilience is improving? So I think these are some of the key issues that the thematic working group would like to explore together with all of you in the room and online, and also researchers globally. Next slide, please, Anon. Yeah, and then what we are essentially calling, and I think health professionals around the world are calling for this, for urgent collective action, and not just from the researchers, from practitioners, but also from policymakers. And I think bringing them all on the same table, and we've talked about this for decades now, but as everybody said, it's time for action now. It's again, that whole thing about moving from risk to resilience. So our hope will, of course, be to support health systems in dealing with this challenge that they have, that given the gaps in universal health coverage, the healthcare needs, the rise in healthcare needs, health systems really have to have that choice between scaling up their functions, but also keeping emissions down. And how do you then join up the adaptation and mitigation conversations within health systems globally who are already overstretched? Part of our activities over the next 4 years will focus on collectively strengthening this knowledge ecosystem, learning from each other, bringing people from different settings together, and we've seen that no health system globally is resilient, and we've seen that just for one health exposure now, the infectious disease pandemic, but there's more to come. And every system needs to learn. And I think that's what we will try to foster partnerships, strengthen existing collaborations, and bring newer people to the table to discuss these challenges. Peer-to-peer support, of course, we would also like to see strengthening of the overall capacities in the world to understand how the risks are distributed. There's a lot of disparity between the evidence of where majority of the health systems have impacts. I've gone on mute. Okay, back. So I'm basically, yeah, anyways. And then, of course, the idea will be to collect evidence case studies, evaluated evidence of case studies, and a lot of efforts of these are already ongoing from the WHO, from other academic institutions as well, but we will aim to kind of synthesize them collectively and bring them in some sort of collective evidence together. Speaker should be. Problem is they can't hear me, Arthur, if I don't do this.
We can hear you now.
Okay, okay. Brilliant. And then I will end with just one more thing about, we've heard a lot about health sector leadership as well, raising the voice of health professionals and including them, bringing them to the table for discussions around climate mitigation and action. So this is in a very kind of, a satellite view of what we will be planning over the next 4 years. And next slide, please, Emma. Yeah, and the overall objective of the thematic working group is, of course, to promote policy-relevant, action-oriented research and practice, and, of course, something that involves action on the ground. And I know that we've heard this several times, but in terms of improving the resilience of health systems, we are quite in its early stages, and we hope to achieve that over the next 4 years. Next slide, please, Emma. And I will end with saying, before we go into all the other brilliant presentations today, that we do give out this call for increasing membership of this thematic working group. The link will be sent to you. And of course, we would like to establish regional chapters. We have conversations, ongoing conversations for an East African chapter, a South and Southeast Asia chapter, and a Europe chapter. And of course, Health Systems Global will have its next biannual symposium in Bogota, in Colombia, November next year. And we look forward to have a learning lab there for 2 days where we will talk about the methods of assessing the risks in health systems and also what kind of evidence we build from now until then in strengthening the resilience within health systems. Thank you very much. And over to Susanna.
Thank you, Revati. Next slide, please. Is it there? Yeah, thank you. So one focus of the thematic working group is a better understanding of the role of communities in building resilience and sustainable health systems to respond to the both acute and chronic effects of climate change as felt sort of on the front line. And the experience of the past few years in various pandemic outbreaks and the emergency responses to those have highlighted lessons around the importance of working with frontline communities to successfully tackle crises. So I and many others have been involved in work on the Ebola outbreaks in West Africa and DRC, and now we have COVID across the globe. And two critical lessons come out of those, I think. First, that the first people to respond to a crisis are frontline health workers and the affected communities. And they learn rapidly, and they have the best knowledge of what can be done and how best to deliver support, and they must inform responses of the international community, but they're not well built into formal health systems responses. And the second lesson is that without meaningful engagement of local staff and affected communities, emergency responses can fail and resilience will not be built and will not be sustained. And therefore, next slide please, it's critical that we understand better how health systems can effectively involve people at the front line. There's a lot of lip service paid to community engagement, but too often it's about talking to communities rather than working with them and certainly from learning from them. And we need to understand how we can build health systems that are responsive and that meaningfully work with people at the front line. It's not easy, there are no blueprints, and there are few robust case studies as yet. And effective adaptation cannot be siloed. So people's lived experiences don't separate health issues from loss of livelihoods or loss of their homes. So we need to understand how we can work effectively across sectors. So how does the health sector work with agriculture to understand how changing climate means we need to be growing different kinds of nutritious crops? How do we work with meteorology for early warning and preparedness? So there are many health systems questions that arise from this that we need to examine, and we need to start from the front line in order to know which are the most important to engage. There are many promising community engagement and adaptation models already in existence, and a key aim of the thematic working group is to build the evidence base of case studies of successful climate adaptation for health systems. For example, I lead an NIHR-funded global health research group called Partnerships for Resilience, which is building case studies of how communities respond and how health systems can support that. But we'd like to hear from other groups, big or small, to provide case evidence about what works, but also what doesn't work and how we can improve and contribute learning in other ways. So as Revati said, we're asking for new members, and we're asking people to get involved, and we're particularly keen to hear evidence from the ground, from frontline and affected communities, and from local health workers as well. And then together we can build a critical evidence base that we can then use to create better, sustainable, resilient health systems into the future. Thank you. Back to the chair.
Thank you very much. Really appreciate those very helpful introductions to what's going to be some exciting work over the next few years. With that, we would like to hear presentations. We'll start with Dr. Sheikh. at the Alliance for Health Policy and Systems Research.
Thank you very much, Chair. First of all, let me congratulate Revati and Susanna on the launch of the thematic group. And thank you for also inviting me to this panel. So it sounds like a very ambitious mandate that you've set out. And I think these are really strong directions around working with people at the front lines, and I think they're the right directions. It'll be a great new addition, I think, to the complement of working groups at Health Systems Global. And looking forward to seeing this group really stamp its presence over the next few months and years. So for those of you who don't know, I work at the Alliance for Health Policy and Systems Research, which is a partnership based at the World Health Organization headquarters, with the mandate of helping to strengthen evidence-informed health systems worldwide. And we have a focus on low and middle-income countries. In this next segment, I'll talk about learning health systems, which is a focus of work that we've been developing at the Alliance. And for me, it highlights a key attribute and of the type of investments we'll need to make if we are to achieve climate resilient and sustainable health systems. I'll start my presentation by going over some of the concepts and the reasoning behind this work stream, and then conclude by drawing on the frameworks that we've developed to identify some actions that are more specifically needed to enhance climate resilience. Can I have the next slide, please? So first, a little bit about the origins of this work. So as I said, our mandate is to strengthen health systems in low and middle-income countries. And in 2019, we convened a meeting of policymakers and experts, mainly drawn from low and middle-income countries, around the subject of learning health systems. And the consensus was that learning is a critically important area of focus in health systems, but also that currently many health systems have a learning problem. So we recognize, the advisory group that we put together recognized that there is a growing consensus that learning is crucial for the performance of health systems. So there is a momentum and an interest in learning in the learning health system. However, there's still the absence of a shared understanding of how health systems learn, or indeed of how to improve health systems learning across different contexts. So that's the main gap that we look to fill and that we were tasked to fill, and that is to develop the science of learning health systems better, especially building on the significant body of existing theories and frameworks of learning organizations and learning systems, which is a field that's existed for several decades, but hasn't been adequately applied in the context of health systems. And second, to provide stakeholders with clarity on concrete actions that they can undertake to advance learning health systems. Next, please. So this is the cover of our flagship report, which was published in September this year. And as I said, the report builds on not only on theories of learning organizations and learning systems, but also on the current understanding of health systems as it's been put forward by the World Health Organization, in that they span many functions and structures. They should be centered around people and oriented towards health equity. And the report is now available in both downloadable and interactive format on the Alliance's website. Next slide, please. So one of the core frameworks in this report illustrates how learning occurs across 3 dimensions. And I'm going to talk through those, and these are as follows. So learning occurs at different levels of the health system, right from the individual level to the team level to organizational and cross-organizational levels. The second dimension is how learning takes place. And we, of course, recognize that we generally tend to associate learning with the transfer of information. And of course, that is an important means of learning, but equally important, learning also takes place through deliberative practices, and also through the actual action and praxis of working in health systems. And these are under-recognized and underutilized means of learning, which need to also be given equal importance. And finally, and this is a crucial concept, there are different types or loops of learning that can take place. So I'm getting into a little bit of technical territory, but it's an important distinction to make. Single loop learning is about learning to change routine practices, whereas on the other hand, double loop learning changes the way we think about core assumptions and can lead to new policies and strategies and not just improve their implementation. And triple loop learning is actually about changing the way in which systems learn altogether. So it's about building new learning systems. Next slide, please. So again, this looks like a busy slide, but I'll draw your attention to the right-hand side, the potential benefits. of learning health systems. There is, of course, a lot more in the report that you can access, and I will point to those links again later in the presentation. Currently, however, learning activities within health systems are largely focused on single loop learning. That's adjusting regular actions, enabling more informed practices. And of course, this is important because this is how health systems functions improve at all levels, enabling individuals, teams, organizations to enhance their regular practices and perform their functions more effectively. However, many health systems falter when it comes to double loop learning. And this is what is needed to confront challenges, wicked challenges such as climate change. So double loop learning is about challenging the assumptions of regular policy and practice and enabling more aware, critical, and self-corrective practices. Double loop learning prepares health systems for change. And there are two parts to this aspect of change preparedness. The first part is adaptation, which is about developing the predictive capabilities, improving resilience, building the systems that will resist future challenges. And the ability of health systems to anticipate and respond to changes in internal and external contexts is an important asset that emerges from this. And climate readiness is one of the most important of those contexts. On the other hand, we have innovation, which is where systems themselves drive change through a culture and policies that welcome experimentation and has ways of assessing, integrating, and scaling up good practices and helpful technologies. And thirdly, and also critically, learning supports self-reliance. So learning health systems are those that can set their own priorities, define their own frameworks for action, and optimize their use of existing resources as they're less dependent on external actors. Next, please. So those were a bunch of frameworks and theories. How do they actually help us in terms of understanding what is needed to build climate resilient health systems? So here I'm taking this multi-dimensional framework of learning health systems. You'll see one of the dimensions up on top, the information, deliberation, and action. Those are the means. And you'll see the loops on the left, single, double, and triple loop. And what we've done here is we've mapped the different types of learning interventions that need to be institutionalized, or in other words, routinized through different rules and procedures if we are to build a learning health system. And then what we can do is we can overlay a specific challenge, in this instance, climate change, and identify the specific interventions that need to be institutionalized to address that challenge. So I should note here that these are quite high level for purposes of presentation, and this is not really diving deep into the actual types of interventions, but more overviewing the types of interventions that can take place. And I'm sorry if the slide is a bit small, but I'll read through some of it. Can I have one click, please? Perfect, thank you. So at the face of it, when we think about climate change, the important learning interventions are about routinizing information flows. So I've highlighted 3 of these information flow type interventions: creating specialized units that track the health impacts of climate change, strengthening and aligning monitoring and evaluation systems, and improving how that data feeds into decision support systems for decision makers, right? So these decision makers could be policy planners, managers, and even healthcare providers when it comes to the impacts of climate change. Can I have one more click, please? But then when we shift the lens to include the other dimensions, which are not just about information flow, we see that there's a much wider spectrum of learning interventions that needs to take place, and that becomes relevant here. First, you need tech assessment platforms to test interventions and technologies for readiness for scale up. You need to share climate solutions across communities of decision makers. You need policy and systems research, and this is where the Health Systems Global Thematic Group could become particularly important. And you need multiple sectors working together for a common working group. And at the bottom of it, you need a learning strategy in place to ensure that all interventions have the needed coherence in serving the common learning goal of climate readiness. Next slide, please. So I'd like to conclude with one message, and that's to address this neglect of learning in the context of health systems. Investments in learning are a very small proportion of overall investments in health systems and programs in LMICs. And if we are to develop climate resilient health systems, we'll need to build institutions, but also the human capacity to prepare for and drive change, and not only to react to it. And for that, learning investments need to become an integral part of our approach to health system strengthening. Currently, they're not. And so that was a little bit of a flavor of the work and the frameworks that we've started to develop. We'd be happy to share more plans and details and take forward conversations. Back to you, Chair.
Thank you very much. That was an excellent overview of what needs to be done in learning for health systems, critically important. And thank you very much for bringing in the triple loop learning. There is a lot that can be done relatively easily to help facilitate that triple loop learning, and we need to obviously do it quickly. With that, we're going to hear from Dr. Drury, who has extensive experience in the Pan American Health Organization with helping build climate resilient health systems. Dr. Drury?
Hi, everyone. Hope you can hear me. Pleasure to be with you all today. I'm going to spend the next few minutes just giving a little bit of an update on an interesting project that's been underway in the Caribbean for about a year now, called Strengthening Climate Resilient Health Systems in the Caribbean. And it's funded through the European Union with support from CARICOM, CARIFORUM. And it's a very dynamic project in the sense that it stands to bring to the Caribbean real transformational change along a number of the areas that we really need to develop with strengthening health systems. So next slide, please. So in the Caribbean, as we know, there are a lot of challenges for the health sector. We have the climatic impacts of unprecedented heat, drought, flood, intense storms, sea levels. There's also an issue with research in the Caribbean, being one of the subregions of the Americas with less research in climate change and health compared to the others. And the translational research is something we need to build on also. There's also demand on some of the most vulnerable populations, outdoor workers, athletes, coastal communities. As was mentioned a minute ago, the vision and the leadership for the health sector is important to build climate resilience and to establish that. And also the economic sectors, being tourism, agriculture, and others, are very sensitive to climate and health. And there is not a great deal of work in the mitigation area. So that's something that needs to be promoted. Next slide, please. For the Pan American Health Organization in the Americas and in the Caribbean, these are some of the areas we work on towards climate resilient health systems. So some of these are the formation of intersectoral groups working on health, planning through vulnerability and adaptation assessments, health infrastructures you'll hear about in a minute through smart hospitals, early warning systems. How do we look at the immediate health co-benefits and bring that evidence to the forefront? How do we train environmental health officers? Also, the importance of bringing health financing. So just a few of the areas that PAHO is working on. Next slide, please. So this project, as you can see and appreciate from the top of the screen, brings together a number of key partners from the Caribbean. PAHO is leading this effort with funding from the European Union and CARICOM and CARIFORUM, the Caribbean Community. Also the Caribbean Community Climate Change Center in Belize, the Caribbean Public Health Agency in Trinidad, the Caribbean Institute for Meteorology and Hydrology in Barbados, University of West Indies, and other UN organizations. So this project aims at these main outputs of having more of a Caribbean, a pan-Caribbean intersectoral approach, really promoting comprehensive health adaptation plans, raising awareness about climate and health, looking at how we begin to measure the health co-benefits, focusing on things like water, sanitation, and food safety that are really influenced by climate, and how do we make those systems more resilient, climate-informed disease surveillance, and perhaps one of the most important ones is the future of our workforce in the Caribbean, and how do we strengthen that so that we have future leaders that are ready to meet the challenges that lie ahead. Next slide, please. The project covers 16 CARIFORUM countries across the Caribbean, so it is diverse in culture, in language, and geography. Next slide, please. The first few sort of outputs from this project are the immediate health benefits and health national adaptation plans. So in the Caribbean, there is a gap, and that gap is really that there's not a lot of evidence for climate mitigation as it relates to things like air quality, green space, active transportation. There's also not necessarily a system to prioritize what are the leading health outcomes and how do we increase climate financing. The 5 Cs from Belize is working with us on the climate financing piece, and PAHO is leading these two other areas. So several of the accomplishments from year one have been the training of PAHO WHO tools to help countries gather evidence on how is air quality affecting health, how is green space, and how can they promote active transportation also to promote health while addressing the climate. Also, we've started the process of piloting AirQ Plus tools, linking health impacts with emissions in a number of countries. We've trained all of the CARICOM countries on how to develop comprehensive health national adaptation plans. And 6 countries have been selected to plan the HNAPs at the national level, which has already started the formation of interministerial committees, communication plans at the national level to get this information out to the public, and also ideas for financing. Next slide, please. So developing climate-informed surveillance and risk monitoring systems. The gap there is really systems that are able to link climate and health and data, really to enhance public health and be able to address the needs of vulnerable communities. So CARFA and CIMH have been leading this effort with support from the other partners, but we've carried out assessments of national surveillance systems and selected 3 countries for the piloting of early warning systems. Baseline assessments are being underway for water sanitation capacity, infrastructure, and readiness. Process to develop videos and manuals related to climate-resilient water and sanitation plans, and assessment of what are the current emerging food safety risks related to climate change and baseline surveys. Next, please. Leadership. So this is a critical area, is the gap of having leaders that have the interdisciplinary skills and really understand how to develop climate and health solutions. So working with University of West Indies, they've developed a leadership curriculum and initiated the first cohort of One Health Fellows across different sectors that will be trained over the course of this year and next year on climate and health concepts. And they'll be doing practicums in their countries. They'll be designing symposiums and doing community-based projects also. CARICOM youth ambassadors are also being engaged in this project and trained in climate and health. They also will engage at the local level for community projects. And we've also brought together different youth groups from across the Caribbean under a platform to look at climate change and health. Next slide, please. Communication. So communicating climate change and health to the Caribbean people. Really the gap here is how do we reach those target populations of youth, of healthcare providers, of non-health sectors about the importance of climate health and the environment. So we have a robust communication and visibility plan under this project. We've had inception events, we have branding materials, we have social media cards, as you've seen on these slides, jingles, videos. We've initiated partners and journalist trainings and developed different human interest stories and translated those into French, Creole, and Spanish and Dutch. And we did a public perception survey several months ago across 10 countries to see what are really the knowledge, perceptions, awareness of almost 3,000 respondents in relation to climate and health. So that yielded some interesting findings. Next slide, please. This is just an example of an event we held a few weeks ago with over 25 partners across the Caribbean, sponsored by Yale, Earthmetic, and many others, as you can see here. But it was a really dynamic and innovative 4-day conference to really promote research, the research and the practice agenda in the Caribbean. So I think that's an important one that we'll be hearing more about later. They'll be presenting later next week. So to summarize, some of the key project contributions have really been the importance of climate change. Next slide, please.
Jonathan,
yes.
to wrap up, please.
Okay, next slide, please. So the key project contributions have really been placing an importance on climate change and health projects that engage multiple agencies, sectors, and countries, generating data, opportunity to scale up climate and health implementation practice in the Caribbean, and then providing countries with evidence and priorities to really elevate health and facilitate inclusion in national planning. And last slide, please, is just a list of those of us that are involved in this project from PAHO. Many other partners have contributed, And to learn more, please visit the website at the bottom of the slide. Thank you very much.
Thank you. This is going to yield very important results. We look forward to hearing more as you engage across the project. So thank you. And then we're going to hear from Major Clemens Buter on planning and operations for PAHO.
Thank you very much for the kind introduction, Professor Ebai, and good morning to most of us, I think. For some of us, good afternoon. And I thank you for the great opportunity to, on behalf of our team, to present the Smart Hospital in the Caribbean project during the next 8 minutes. I think this presentation is a great practical example of a climate sustainable and resilient health infrastructure system. As you can see on the picture, that's the recently handed over smart facility. It's the Pavilion healthcare facility in St. Vincent. The project is funded by the UK Foreign Commonwealth and Development Office in the amount of 46.3 million pounds. It's implemented by the Pan American Health Organization in very close collaboration with the Ministries of Health. And as previously mentioned, the Caribbean is hit by natural disasters every year. And in the event of an emergency, health facilities to treat the sick and injured are of course really vital. But over 2/3 of hospitals are in areas of higher risk of disaster, and health services are frequently disrupted following storm, hurricane, earthquakes. We have heat waves. Recently, we had the eruption of the volcano in St. Vincent. Of course, we have the pandemic. And climate change will even further increase the level of risk in the Caribbean. Next slide, please. More than 67% of all the hospitals in Latin America and the Caribbean are in areas at high risk for natural disasters and climate change. At the same time, hospitals represent almost 70% of the Ministry of Health national budget. In the Americas, 61% of the impact on health facilities is caused by earthquakes, 17% by hurricanes, 40% by floods, and 8% by health emergencies. Of course, we have the heat waves. These numbers are even outside of the current pandemic. But it leaves millions of people without proper health care and resulted already in billions of dollars in costs. Next slide, please. In phase 1 of the Smart Hospital project in 2013, 2 demonstration retrofit projects were done. One at the Georgetown Hospital in St. Vincent, which was an older facility, and the second one at the Boxen Hospital in St. Kitts, which was newer, but both of which proved to be very successful. The retrofitting works included the replacing the windows to meet higher design wind speeds for this region, strengthening of the roof to accommodate solar panels and ashfall in St. Vincent, improving the natural lighting and ventilation, and improving the fire safety and emergency egress of the facilities. 10 months after the completion of the Georgetown Smart Hospital, the energy data was reviewed, and there was an estimated 58% reduction in the electrical consumption. Similar checks were done at the Boxen Hospital in St. Kitts, and in that facility we saw a reduction of 50% in the utility bills. Phase 2 of the Smart Healthcare Facilities in the Caribbean project started in June 2015 and is currently implemented in 7 project countries: Dominica, Grenada, St. Lucia, St. Vincent, Belize, Jamaica, and Guyana. The project ends in December 2022, and as you can read on the slides, we aim to achieve the following results. Of course, the enhancement of safety standards, reduce downtime and damage to hospitals for natural disasters. I think the recent volcano eruption in St. Vincent was a good example, and the impact, or the not big impact, on our facilities there. Lower operating expenditure due to water and electricity consumption savings. And we would like to promote nationally, but also regionally, our smart standards. Next slide, please. So what is a smart health facility? It's both safe from natural hazards and it's green. There are several win-win ways to accomplish this, in which in the process can be cost effective, cause a reduction in greenhouse gas emissions, achieve climate change adaptation measures, risk reduction, and development benefits. The image shown in the presentation defines what is meant by smart. It illustrates that improvements in safety, or an A score on the Hospital Safety Index, results in a safe facility. A score of more than 70% on the green checklist equals a green facility. The graphic presents safe and green factors to consider, and when these are combined, help to create a sustainable, smart facility. Other measures, such as the use of eco-friendly flooring, paints, furniture, furnishes, will further contribute to increased sustainability and risk reduction. Health facilities can also improve their smartness by greening their operations, including the use of less paper, recycling, generating less and properly disposing of waste, solid and otherwise, proper disposal of pharmaceuticals, using environmental benign chemicals, and use more local, sustainable produced food. Next slide, please. During the next 4 slides, just give me a brief update on where we are with the project. So we have 3 outputs. The first output is mainly focusing on assessments and training. I already mentioned the Hospital Safety Index and the green assessments. So we assessed over 400 healthcare facilities in the Caribbean. We currently are retrofitting 55 of them. So there's still plenty of opportunities for other donors to move ahead with this project. Very important, and I included the link in the slide as well, is the various technical guidelines and all the case studies. Important, the maintenance. Of course, we all know in the Caribbean, maintenance can be a challenge. So we put a lot of effort in providing maintenance courses, including a manual for preventative maintenance, but also practical courses. In output 2, which focuses on design and retrofitting, I mentioned the aim is to finish 55 facilities by the end of December 22. Currently, we aim to finish the first 50 by the end of this year. And in the picture, you can see same picture as the first slide of the presentation, but this clearly shows the before and after picture. So the result of the retrofitting works. Next slide, please. Also important to say that the project itself, it's not only healthcare facilities, it is healthcare facilities, so not only health centers, it includes places that take care of the elderly, children at risk, and mentally disabled. Also, central medical stores are part of the project, which of course is vital to store strategic medical supplies, including the vaccines. And again, thank you for the opportunity to present this project, because output 3 is on PR, external linkages, and we're extremely happy that we see that other donors, other sectors like education and tourism, they start to take over the concepts and they start to use the technical guidelines as mentioned. You can find us on the internet. Of course, we are on social media as well. One thing I would like to add is the training. It's a bit of PR, but when people are waiting, patients are waiting in the waiting room, we also put a lot of emphasis to train the people while they're waiting anyway, of what they can do. We learned in other presentations of the importance of the communities. We heard about learning, and I think this is a great way as well to really teach people who visit the facility of what they can do themselves as well. And even by installing some LED light bulbs, it can make a huge difference already in their own homes and a positive impact on their utility bill. Next slide. So some challenges. Of course, we all face the challenges of COVID-19, but for a construction project or a retrofitting project as we are faced with the travel restrictions, which impacts kind of the travel of our experts as well, the engineers, just to make sure the quality is up to standard. Of course, the ministries of health are all really busy with the impact of COVID-19. So the absorption capacity is at the moment more limited. I mentioned quality assurance. I think it's extremely important to have our technical engineers, but especially the check consultants, as mentioned in point 5, just to review everything that has been done by design firms, but also by the contractor, to make sure that everything is up to standard. Talking about standards, it's important. Building codes and standards, they are there, but especially the application of those codes and standards is important. And I mentioned training, so the importance of contingency plans, SOP, but also rehearsals with the health staff to make sure that the functional aspect of the project is also covered, and that the staff know what they have to do when a disaster happens. Last slide, please. Then the future, as I mentioned, we are very pleased to see that donors in other sectors, they start to adopt the project. We see, for example, that the new courthouse in BVI is also is going to be a smart facility. We see the education sector, as mentioned. Also, we are now working on a guideline for new facilities. So, as mentioned, as funded by FCDO, we only do retrofitting. But now we're working on new facilities. Two nice examples are the two new shelters funded by the EU in St. Martin. And we see a broader interest from the private sector. So we are really capacity building. And as I mentioned, the patients who visit the healthcare facilities, that we teach them as well how they can make a positive impact at their own homes. So we're looking forward to expand the project. And I think that's my last slide. So I would like to give the floor back to Professor Ibar. Thank you.
Thank you very much. That's a very impressive demonstration of how one can start scaling up activities, but also taking the holistic approach we've all been talking about from the beginning of thinking about, for example, training of communities while they're waiting in healthcare facilities. So very thoughtful and very helpful example that other countries could follow as they're looking to build climate resilient health facilities. With that, I'd like to turn to Dr. Saldana for some remarks.
Great, thanks so much. Can we go to the next slide? So yes, I'm not actually talking about funding health system resilience, but more about strengthening health system capacity. I do think it relates to a lot of the messages we've heard. In particular, I know at the beginning, Ravati talked about how we want to have a convergence of some of the conceptual frameworks, and I think that resonates within USAID. We recently launched a new climate strategy, which sets ambitious timelines and targets for reducing global emissions, increasing adaptation, and mobilizing climate and risk financing as countries seek to adapt to climate change. And so we work on the climate crisis, both in terms of helping to implement ambitious emissions reduction measures, protect critical ecosystems, transition to renewable energy, and build resilience. And then also helping communities and countries respond to and recover from climate-related disasters, including preparing to reduce risks and strengthening early warning systems for climate hazards, helping to take early action, strengthening institutions, communities, and governments to proactively address risk and reduce exposure. So, but even with the best mitigation measures, the effects of climate change affect lives in different ways, both in experience habitat loss, which potentially increases the risk of infectious diseases, but also diminished resources, which impact livelihoods, health security, and more. So it's important to think about the broader climate context when we start thinking about the capacities and the health system's capacities. Next slide. So this is a conceptual framework that USAID has for overall resilience. And just a couple of key points to note here is, again, so the context of climate change is really important, and we recognize that impacts countries in different ways through a series of different kinds of shocks and stressors. On systems, but also on individuals and societies. And really the way that they respond to that is by taking advantage of existing assets, resources, and strategies. But the extent to which they're successful can lead to different paths as a result of the shock and stressor, and then different outcomes. And so what we want to try and do is identify how to support countries on the path to rebounding better off than they were before, and in the face of these shocks and stressors. So I think it's also critical to note that when we start talking specifically about health systems need to be resilient to respond to these time-bound events, such as disease outbreaks, as well as to the longer-term dynamics related to climate change. And we think that to be resilient, a health system must be flexible enough to adjust its resources, policy, and focus so that healthcare can be uninterrupted during times of crisis, both to enable response to the emergency, but also to maintain routine essential services. And so to do this, we really have to invest in the health system in a cross-cutting way. Next slide. So earlier this year, USAID released a new vision for health system strengthening. And what we've tried to do here is to recognize that the ultimate objective of health systems is to produce good health outcomes. And doing that is mitigated by, or is achieved through three health systems outcomes that we define as equity, quality, and resource optimization. These are interrelated. One is not more important than the other, and all impact one another. So we want to make sure we're reaching the most vulnerable populations with quality services, and that we align and optimize our resources, including human and financial resources, in ways that achieve equity and quality. Although we try to shift the focus to the outcomes, we still recognize the critical importance of the health system's building blocks to achieve these goals, and identify a series of cross-cutting approaches that we think are critical to enabling this. And that is one, I think recognizing the linkages between communities, the public sector, and private sector across sectors, enabling local organizations to think through and make their own decisions, and then recognizing that to achieve all of this, there needs to be behavior change, both in terms of supporting clients to implement healthy behaviors, but also on the part of providers and managers to promote quality systems in and of themselves. And lastly, throughout this entire process, we promote learning and adaptation of programs and approaches to health systems. Next slide. So these two frameworks come together in really what are these resilience capacities. And so you may have noticed that on the resilience conceptual framework slide, we think it's critical to our approaches to how we strengthen health systems, because ultimately what we want to do is enable the system to absorb a shock or a stressor, to be able to adapt as needed, and then potentially to transform. I think this relates back to some of the points that Kabir made related to the learning health system, and really the extent to which that system can adapt and transform. From a health systems capacity building perspective, we think that it's critical that we don't wait until there's a shock or a stress to the system, but really that we want to build these capacities during sort of what we call everyday resilience. So there's a series of actions and deficiencies that we see within health systems, stockouts of drugs and supplies, health worker strikes, other issues that during which health practitioners can practice resilience during everyday periods, so that they're more prepared when there's an actual shock or crisis. Next slide. So the key messages that we promote when we talk about building capacity, resilience capacities within health systems, is that we really want to rethink how we provide technical assistance, and how we can do so in a way that fosters local capacity and locally generated solutions, because we feel this is critical to the resilience capacities. It enables people to think holistically about health systems, to implement the multi-sectoral approach that I talked about, and also to recognize and analyze the role that different stakeholders can play within the system. During recovery and transformation, we recognize that there is a need for the global community to work together to improve the ability of the health system to make the fundamental change that addresses underlying challenges and contextual dynamics, and to progress towards health outcomes. So that includes creating or implementing integrative policies, processes, or structures, which might not have existed prior to an event or a shock, and so really is taking that transformation. And then promoting research and learning throughout the system and throughout the practice of both everyday resilience, as well as response and recovery to specific shocks and stressors. So I want to sort of explicitly acknowledge that there is a recent announcement of the President's Emergency Plan for Adaptation and Resilience, um, announced at COP26 just a couple days ago, which aims to support developing countries and communities in vulnerable situations around their world in their efforts to adapt and manage the impacts of climate change, including providing support to build strong and resilient health systems and communities. So going forward on this conceptual convergence, we will use the PREPARE initiative to deepen the global understanding of climate risks, vulnerability, and adaptation solutions, and integrate and mainstream adaptation, and then mobilize finance and private capital. So really, we see this within USAID as a whole of agency approach, but also within the US government as a whole of government approach, where we try to bring together all of the different thoughts and assets we have to working on this. I know we're short on time, so I will stop there and see if we have any questions as we go forward.
Thank you very much for that very brief overview of a real important initiative from USAID. At this point, I know we just have about a minute left. Ravati, do you want to take one question from the floor, or should we make sure that we thank our speakers for outstanding presentations and allow people to follow up individually afterwards?
Yeah, Chris, I'll just ask in the room because they've been patiently waiting. If there is any question in the room that you would like to ask, anybody in the room would like to ask? Anybody in the room would like to ask a question to any of the panelists? Yes, please, go on.
Hi, thank you. Thank you for the brilliant presentation. My name is Julius Alejandre. I am from the Philippines, but I'm a planetary health researcher here in Glasgow currently. One of the greatest sources of GHG emissions in the healthcare system is pharmaceutical acquisition or pharmaceutical procurement. In the NHS, for example, 3% of the emission comes from pharmaceutical procurement. So I'm just wondering from the panel, what measures can you propose to cut this emission?
Would anybody like to take this? Any of the panelists? Okay, then probably I will very quickly reflect on this, that yes, obviously it is a huge challenge. Yeah, obviously it is a huge challenge and efforts are in place. And I think that is also the balance that we are talking about. So our focus is a little bit more about adaptation. And of course, the sustainability of the health systems is a key argument as well. And I think the moving forward, it's about joining these two aspects. But I personally think that scaling up the adaptation and catching up a little bit on the mitigation side from the adaptation front would be a key as well. Yeah, that would be my thoughts. I think given the time, probably over to you, Chris, for one final comment, and then we shall close, and apologies that we ran out of time for this session. Over to you, Chris.
Thank you so much. And this was just an outstanding session. Really want to thank the speakers for very excellent, thought-provoking presentations, and look very much forward to working together with everybody to promote sustainable and resilient health systems. Obviously, a critically important topic as we go into a much different future. So thank you, everybody, and look forward to engaging as we go forward.
Good afternoon, everyone. Are we on? Okay. Good afternoon, everyone, and welcome to this session entitled Colliding Disasters, Adapting to Increasing Climate and Health Risks. Apologies for the slight technical delay, but we're all set now, and hopefully you are there both here in the room, that we're happy to have you here, and also online. Warm welcome to you, and thanks for waiting. My name is Miriam Stackpole-Dahl. I'm a Senior Communication Advisor at Cicero Center for International Climate Research in Norway, and I will be moderating this session today. People in every region of the world are increasingly seeing their health affected by climate change, as highlighted by the recently launched report from the Lancet Countdown on Health and Climate Change. The recent IPCC 6th assessment report has told us about more frequent and more extreme heat waves and more frequent fire weather, just to mention a few of the climate change impacts affecting our health. The impacts we see today will increase with further global warming, and we know that the most vulnerable people are often the most vulnerable countries of the world are most affected. Facing the increased climate and health risks, more intersectoral collaboration and knowledge exchange between the climate change and health research communities, policy and practice is needed for integrated and evidence-based action for mitigation of and adaptation to the health impacts of climate change. In the view of connecting climate change and health, it's an honor for two climate centers to be convening this event here at the Health Pavilion. In the session today, we bring together health and climate researchers with practitioners to discuss adaptation options for key climate and health risks. In the panel today, we have 4 researchers who will update us on knowledge to different aspects of the climate-health interface, each bringing a different perspective to the issue. We will cover air pollution, including from wildfires, occupational heat, environmental heat, and climate-sensitive infectious diseases. These researchers are part of or connected to the EU-funded project NBEL that is bringing together leading climate and health research projects. After this presentation, we will bring in policy and practice perspectives to hear how we can take the knowledge from science and apply it for policy on the EU level, internationally, and in the practice of humanitarian organizations. And we will discuss how risks come together in the form of complex events and the practical next steps for countries, citizens, and companies to reduce impacts on the most vulnerable people. And we will have a discussion with our speakers and the audience. For our virtual audience today, please pose your questions for the panel in the Q&A in Zoom. Our first speaker this afternoon is Kristin Aunan, a research director at Cicero Center for International Climate Research in Norway, where a key part of her work is addressing the benefits to human health and climate from reducing emissions of greenhouse gases and air pollution. Kristin, can you tell us how climate change and air pollution are related and how they affect human health?
Thank you, Miriam. I plan to give a brief introduction to the link between climate change and health using some slides. So I think I stand over here. So the connection between climate change and health is many-faceted. I will talk about 3 main links. The first is common emission sources. The second is the atmospheric interactions between climate change and air pollution. And the third is the health interactions. So the first one, it's very simple. We all know greenhouse gases and air pollutants often have the same sources. Particulate air pollution and ozone are the 2 main air pollution components when it comes to human health damage. These are very complicated components. It's not like PM2.5 is one thing. So both for PM2.5 and ozone pollution is partly related to atmospheric processes. So they are so-called secondary components, at least to some extent, for particles. And these pollutants are caused and are created due to a myriad of sources, and both have a complex formation chemistry. But importantly, fossil fuel burning is a major source. And as we all know, fossil fuels is also the dominant source of CO2 emissions. So this means that very often we have immediate benefits for air quality from mitigating greenhouse gas emissions due to the reduced emissions of co-emitted air pollutants. However, unfortunately, the reverse is not necessarily the case. Measures for improving air can actually lead to enhanced global warming that is related to particulate pollution, some of them, not all of them. So, atmospheric interactions, the first point. Climate change penalty is the term being used in this respect. That simply means that there can be a deterioration of air quality due to global warming. And this is related to very complex processes. So just the keywords, there are impacts of natural emissions when temperatures increases. So there are more evaporation from, so we call biogenic emissions, for instance, from plants and trees. There's also a link to mineral dust. So when it gets very dry, there might be more mineral dust in the atmosphere. So there are also interactions related to the impact of anthropogenic emissions. So when it gets hotter, we need more cooling. Of course, then we might also need less heating. So something is going on in both directions. And there are also impacts on chemical and physical processes in the atmosphere. And these are also very complex interactions, some leading to larger air pollution, some leading to less air pollution. But to summarize what we know so far about this interlinkage, the climate penalty is there, but it's more, and it's more evident for ozone than for particulate air pollution. But we also understand that the climate penalty effect on concentrations of air pollution is overall less important than changes in atmospheric emissions. Second point related to atmospheric interactions. When it gets very hot and very dry, and maybe the wind, extreme wind speeds, that is what we call fire weather. So this enhances the risk of wildfires. And wildfires is an important source of air pollution. There have been attempts to estimate the mortality impacts of air pollution from wildfires. So this is just one example, a recent study estimating that maybe up to nearly 1% of all deaths during the period 2000 to 2016 were caused by the acute effects of wildfire smoke. And this is only acute effect. There might be long-term effect as well. If I put these two maps together to indicate an important point, because if you see the map to the left showing the places where we have information about the particulate pollution from wildfires and mortality link, there are some large regional holes. And if we look at the other map at the right, we see that the global fire energy release, which is an indicator measured by satellites, we see that there are large regions in the world with extensive wildfires that is not covered by the regions that we have information about the health effects. So this is an important knowledge gap. The second point, or the second point was about the health, or the third point was about the health interactions. And the thing is that temperatures and air pollutants can actually interact through physiological mechanisms to amplify the damage. So very briefly, many studies report interaction between particulate air pollution and or ozone and temperature effects. So the conclusions from reviews indicate that very hot and very cold temperatures enhance the impacts of air pollutants. And vice versa, high levels of air pollutants enhance the heat health effects, which is indicated with this figure. So the last point related to the third point, health interactions, is the fact that there are indications that particulate matter from wildfires might be more toxic to humans. So studies find that there are stronger effects on mortality and longer lag time than for wildfire PM than for urban PM. And this could be because there is a higher fraction of small particles, and they contain more health-damaging components, the wildfire emissions. So at CICERO, we have this project called Exhaustion, and we have tried to simplify and visualize all these complex interactions between climate change and air pollution in one figure. It is made by Info Design Lab, based in Oslo. You can go to our website and download the figure to study these interactions more carefully. So briefly, the conclusions of my talk. Reducing fossil fuel use will save lives due to reduced global warming and improved air quality. Global warming comes with a double climate penalty, because not only can global warming lead to a deterioration of air quality in itself, but hotter temperatures can also worsen the physiological effects of air pollution. So what are the policy implications? 2 points. Heat stress and air pollution should be considered jointly in policy development. For instance, heat health action plans should include the enhanced risk related to air pollution exposure during heat waves. Secondly, vice versa, air pollution abatement policies need to take into account that global warming will make it more difficult to reach air quality targets. And with this, I say thank you.
Thank you very much, Kristin, for your introduction. And if anyone has questions to Kristin, please post it in the Q&A in Zoom, and we'll get back to that in the discussion section. Our next speaker is Jason Glaser. He is the CEO of Isla Network, an international research and occupational health organization dedicated to protecting workers from the fatal effects of heat in a warming world. Jason, we know heat waves can be deadly, but what is needed to address the issue of workers getting sick and dying from occupational heat stress?
Great, thank you, Mary, for the question. I just want to do some thank yous, and I'll dive into it. I'm going to switch to slides to get my face off the screen. But I really want to thank everybody at CICERO and the Red Cross and the Red Crescent and the WHO who made this possible. And I'm going to show some photos today. I want to make this as broad as possible to hit as many hearts and minds as we can. And so I'm going to show some photos. And if you're at COPE and you want to see more photos like this about the work that I'm going to talk about, you can see Ed Cashew's work, incredible photographer, at the Walkway 6 gallery at COPE. So with that, I'm going to switch over to my slides and take it from there. Are we live at the slides?
Yes, we are.
Wonderful, thank you. So what I'm really focusing on, what we're focusing on, is heat stress and heat illness. And I think a lot of people have confusion about heat stress and some of the outcomes. They say, oh, it's hot everywhere. Why aren't we seeing more of these issues, both the short term and the long term? And what we have to think about is that combination of the environmental heat, that high environmental temperature, and then the people who are working the hardest and the heaviest jobs, these very high workloads, building up their core temperature, and they're unable to expend that heat into the environment because it's so hot and humid. And obviously that's already here, that's already happening in the tropics. And as climate change takes hold, it's hitting into the more temperate regions as well. And so the immediate risks that we can talk about, and I think we saw this summer, especially in the Pacific Northwest, and people have been dealing with in the tropics for much longer, the Pacific Northwest in the US and Canada, that is you see greater health risks in general. You see increased accident risks in general because people get dizzy, they get disoriented, they can cut themselves, increase falls, and even increase traffic accidents and uncooled vehicles. And you see reduced productivity, so nobody's really coming out ahead without protections in these conditions. And then, of course, there's early mortality because of some of those increased accidents. And of course, heat stroke outright can kill you. But what I want to talk about today also are some of the more pernicious effects. And there's a form of kidney disease that is certainly associated and related to this. And we've shown we can prevent its the damage that leads to it through pretty common sense occupational interventions. And while there may be, and there probably are, other drivers of any chronic disease, this is something we can do something about with current policy, current access, and current know-how. So typical CKD usually affects older people, people with diabetes, metabolic syndrome, hypertension, obesity. It's quite easy to detect with a dipstick for those of you who are in the healthcare field through proteinuria. And it's quite widespread and it's worldwide. But what we're seeing with chronic kidney disease of non-traditional origin is disproportionately affecting working age males and the toughest jobs. They're doing strenuous labor and they don't have really basic interventions like water, rest, and shade to protect their health, keep their core temperature down. And it's tough to detect. This thing is a human rights crisis, a labor crisis, and a health system crisis that has gone on underdetected all over the world for at least 40 years. And that part of it is it's harder to surveil because you have to take serum creatinine because of the part of the kidney that's damaged, especially in the early phases. And that's really a problem because, for years I was always told, oh, it's not here in Guatemala, it's hot, we have these industries, and sure enough, it's in Guatemala. The same in Mexico, the same in parts of India. And when we actually use our protocols called the degree protocol to look at the prevalence of this disease in different communities and occupational settings, if it's hot, if people aren't afforded those basic protections, and if it's really tough work, we see this disease. We have yet to see a negative with that combination. And so who am I talking about? I am talking about those doing just the very toughest jobs. So like in Central America, you see sugarcane cutters, but you also see gold miners, salt pan workers, like in Pondicherry in India. And then we are seeing increasing reports of folks coming back from Nepal or going back to Nepal from the Persian Gulf states who've been working on the World Cup construction and other construction in the Gulf. And they have this disease. So this is really troublesome. When I started working around 12 years ago, I would hit these sugarcane fields early in the morning and stay there all day and watch. And these are otherwise very sophisticated operations and industries. And they're receiving support from the World Bank finance institutions and the IDB, the Inter-American Development Bank, and they're providing basic commodities to the global market and major brands. And yet you have these workers in the thousands working without just fundamental protections. You can see this fellow back in the bad days clearly did not have appropriate PPE, personal protective equipment, did not have access to water, rest, and shade. And they were working 12 hours a day, 7 days a week. So things were getting worse, not better as far as labor. There was more monoculture, more industrialized labor, and less farmers providing for these farms. And you would see this in other industries as well. But I want to kind of shift it to the human cost. Our research is available online. If you're interested in reaching out, I'm happy to share it. I've got colleagues from other research outfits working on similar work today, and we're all happy to share the research. But what does this mean for people on the ground? Like, how do we humanize this? And so this fellow Ramon is now departed. He was already sick with kidney disease in his 30s. It's a photo of his father in the background. He died later in life, but of the same disease. And what we've seen again and again are widows left behind from this disease, and they are now entering the workforce, which didn't really happen before. And children enter the workforce either through subcontractors or even direct contracting still in many of these jobs. And it's certainly not limited to sugarcane. It's just sugarcane is a dominant crop in this environment of high heat, formerly really poor labor protections, though that is improving. And so, this just has this knock-on effect because we're removing people like Ramon from being their prime earning years and supporting their communities. And then kids are leaving school to enter the workforce. So this is a development crisis. This is something we can do something about. And, the burden on the health system is kind of terrifying, right? Because now you have this burden on the economic system, on the production system, removing healthy workers, formerly healthy workers from their prime earning years, which has a knock-on effect, obviously, on child labor and local communities and economies. But what happens then when you have to treat one of the most expensive diseases to treat in the world? And you either can't provide good hospital hemodialysis, which is already very expensive. And when you try to do it in the home, people often die of infection because you can see the living conditions are not adequate at all to be providing home dialysis. And yet major dialysis brands are continuing to do this, even though people are frequently dying of infection before they're dying of kidney disease. And you kind of see the whole story right here in this image. This guy's only in his mid-30s. Obviously looks much more emaciated and older than he should. His son then goes and replaces him in the field. And that's really something we want to interrupt, right? The knock-on effects of these diseases due to heat are really important to consider. And so, what do we do about it? I think the fundamental thing is there's more research to do to look at, cofactors and other causes, other drivers, sure. But, this is one risk. This is one thing that we can ameliorate, that we can address immediately. And if you just say it out loud or to yourself in your head, it's water, scheduled rest, shade, and sanitation, because more women are entering the workforce and they certainly should be given a place to take care of their needs if you're telling them to drink more water at the workforce and they're working with men. But we've developed these systems that are highly organized, and then we assess how well they're implemented, because just having a program is not the same as having a well implemented program. And while the basics are basic, fundamental, on a 70,000 hectare sugar farm, for instance, or a major gold mine, this becomes more complicated. So how do you make sure you have the appropriate training, the appropriate buy-in from the workforce on up? And we've done return on investment studies to show that, in fact, workers produce more or the same, and that the employer actually has about a 33-cent on the dollar return on investment. So this is really good for everybody to provide these basic protections. And what we've shown is a reduction in injury. We've shown a reduction in hospitalizations due to acute kidney injury. And we believe we'll see a reduction when we look at our long-term follow-up data soon on the incidence of disease. So this is a very exciting time. But I think we do have to ask ourselves some questions. How do these basic protections evade implementation for so long in the leading development programs in the world, like supposedly helping the bottom rung? And how are they missing from big brand supply chains? The good news is I think we can assure them today through programs like PREP, which is prevention, resilience, efficiency, and protection for workers in a changing climate. And that's the program we're working with at NBEL and through the European Commission. And then the Adelante initiative, where we brought together leaders in the sugar industry like Bonsucro, the sugar mill San Antonio, and other leaders to try to show what's possible in one of the toughest environments and one of the toughest jobs, so that we can expand these implemented and assessed interventions to other locales and geographies and other industries. So it's really the basis for change. And what do we do together? We have to come together, I think, and we need to build up the surveillance to detect this disease. We need to develop and assess the preventative programs like Adelante with the other industries, and we need to have governments involved to consider regulation and assessment of work sites. We definitely need to improve treatment and access to it and assess the cost of this. But we have to support employers, brands, development agencies, and workers in improving and assessing the risk and how we address it, and how then we can make sure that workers are protected going forward. And I think it's just a very clear situation where there is a win-win-win. This is not a zero-sum game, and there is a clear way forward. But change doesn't happen overnight, and it's going to require some reflection and discussion and real buy-in and convincing that, while there might be other drivers of this kidney disease, although there aren't really other drivers for heat stroke that are relevant, this is one you can do something about. This is something you can take ownership over. And if you implement it well and assess that implementation, you can save lives. You can at least extend lives and mitigate the risk for people. And I think that's what our work is really all about. So thank you so much for having us. I think there's a pretty clear way forward on this. And it's just been an incredible pleasure working with my colleagues through NBEL and through Cicero. And thanks for helping put this on the map in a really important forum. So thank you so much.
Thank you so much, Jason, for sharing this with us, and also for showing some concrete work on the ground that can help the people affected. So our next speaker today is Shari Kovacs. She's an associate professor at the London School of Hygiene and Tropical Medicine, and she's been researching the effects of weather, climate, and climate change on human health for more than 20 years. Shari, I want to ask you today, why are pregnant women and children particularly vulnerable to climate change?
WHO, the Red Cross and Cicero for this event. And before I answer the question, I just wanted to say how important it is that health is now a priority at the COP, because this is the first time that this has happened. So thank you all for joining this session. I'm going to briefly talk about some of the results from our CHAMNA project, which is about climate, heat, and maternal and neonatal health in Africa. So why are women particularly vulnerable to climate change? Well, pregnant women and young children are very vulnerable to climate change. They currently bear the brunt of disease from poverty and environmental factors. We also know that there are about 300,000 maternal deaths every year, and the majority of these are in sub-Saharan Africa and South Asia. The vast majority of these deaths are preventable and entirely avoidable, but they're caused by lack of access to health services and lack of social protection measures. And we know climate change is already affecting the world's most vulnerable people. It's affecting livelihoods. And not only that, extreme events cause loss of income, and the impacts on health from extreme events cause additional out-of-pocket health expenses. And all these factors push women into poverty. And women in poverty are likely to be at risk from the adverse effects of pregnancy and ill health. But we also know that high outdoor temperatures cause direct impacts on pregnant women, and that's more of the focus of our research project. And it's worth noting, we know from all the climate information and the talks at this meeting, and also from what Jason has just been describing, that we're experiencing new and higher temperatures and new heat waves. So pregnant women everywhere are vulnerable to heat because we just haven't adapted our systems, our health systems, and our behaviours for addressing or managing these new risks, essentially. And one of the main purposes of our project is to provide the correct evidence, evidence-based advice to pregnant women for dealing with these heat risks wherever they are. So what is the evidence that heat affects maternal health? In our research in CHAMNA, we're using epidemiological methods primarily to quantify the impacts of heat on a range of outcomes using health data on mothers and babies in Africa, in East Africa, Southern Africa, and West Africa. But we're also using qualitative research methods to develop interventions that are both acceptable and feasible. So we have very good evidence that high temperatures increase the risk of preterm birth, the risk of stillbirth, and low birth weight. And we know that babies that are born with very low birth weights have lifelong complications and lifelong health problems. So this really is a kind of transgenerational or intergenerational impact of climate change. And there is emerging evidence around the impacts of high temperatures on maternal hypertension and preeclampsia. And preeclampsia is the most important complication in pregnancy and responsible for some of that high burden of maternal deaths. And we know from other evidence that infectious diseases are also very sensitive to weather patterns as well. So women are at risk of those. And we're trying to find out which women are most at risk. So we're looking at modifiers of these types of associations, and that information can be used to target interventions. And as I've said, part of the project is looking at qualitative information. So we've been talking to pregnant women, to new mothers, and to health workers in Kenya and Burkina Faso about their perceptions of heat risks. And this has shown that high temperatures cause a lot of anxiety, a lot of stress, lack of sleep, but also significant discomfort to mothers and newborn babies, and it interferes with breastfeeding and may increase supplementary breastfeeding, which is so that's giving babies water or other liquids, and that of course can increase the burden of disease and risk the health of the infant. But what we also found is access to health services may be impaired by high temperatures. Women are very reluctant. If they have to walk to the clinic and they're very pregnant, they're very reluctant to walk in high temperatures. And there's a big, strong association between antenatal visits and adverse health outcomes. So a key part of our CHAMNA project is to provide interventions. And as Jason said, there can be, especially low cost and cost effective interventions for managing heat risks. So we're producing evidence to increase adaptation actions within the health systems, within clinics, hospitals, health workers, and community midwives and nurses, and also directly undertaking behaviour change interventions, talking to mothers and their relatives. And heat is an occupational risk, so we're also looking at the impacts of heat stress on health workers. In delivery rooms, very high indoor temperatures are reported in health facilities where women are delivering. And we're currently evaluating 2 such interventions in the project, and we'll be able to report on that next year. So those are the key points I wanted to make, and thank you very much. But I just want to say that if you are interested in maternal health and climate change, there's a session focused on this in the Health Pavilion late on Friday afternoon that's being run by USAID.
Thank you so much, Shari. And now we have the fourth research speaker. And I would like to remind the speakers to try to be brief so we have some time left for discussion at the end. Next out is Amir Sapkuta. He is a professor at Maryland University in the US. His research group focuses on the intersection of climate change and human health, with a particular emphasis on cardiopulmonary, renal, and diarrheal diseases. And I want to ask you today, historically, early warning systems are used for climate hazards, but we understand that you are extending them to health as well, and particularly to diarrheal diseases. Can you tell us about your work and how this work may enhance the community resilience in the regions where you're working?
Thank you, and good afternoon, everyone. First of all, I want to commend the organizers for bringing this panel together. And like Sari said, it's great to see that health playing such a prominent role at COP26 meeting now. To get back to your question, yes, absolutely. Early warning systems have been used in the context of climate hazard, but we have to remember that these same very hazard also kills people, makes them sick. Hence, there is a need to make early warning system to protect public health. So that's a lot of the work that I have been involved in. So sort of like historically speaking, disease surveillance has served as one of the foundation of public health, right? So we have the system in place that detects underlying disease dynamic in a population. And if we sense something is wrong, then we go and respond to that, right? So that's how we contain, outbreaks and so forth. And generally speaking, that approach has worked relatively well over the past century. Except for the most recent pandemic, of course. But the threat that we are dealing with, and particularly these climate change-driven threats, are very different. So we need a different line of thinking, new approach in dealing with it. And please remember that climatologists have been telling us that extreme weather event will continue into the foreseeable future despite mitigation effort now because of the changes that have already taken place, right? So people are dying from it now, right here at present. So this poses a fundamental question, and that is, how are we going to adapt to this new set of hazards as a society, right? So what we need is a system that can help us anticipate these threats, prepare for these threats, and respond to those threats, right? And this is where early warning system comes in. So in our particular case, we are trying to develop early warning system for diarrheal diseases in the Asia Pacific region with sub-seasonal to seasonal lead time. And I will come back to the notion of lead time in a little bit. But first of all, why climate change and diarrheal disease? Well, it turns out warming temperature promotes bacterial growth. These are some of the causative agents for many of these diarrheal diseases. And extreme precipitation helps to spread them in the environment, increasing the fecal-oral route of exposure, right? So this is particularly important in the low resource setting where still a substantial part of the population practice open defecation and access to safe municipal drinking water remains woefully inadequate. So the second point that I want to make is about the lead time. So what our partners have been telling us is that weather-based warnings do not provide them enough lead time to prepare for the outbreak, so to speak. Whereas climate-based projection with the 50-year, 100-year lead time down the horizon it's too far out to drive meaningful discussion at present about public health adaptation strategies. So what they have been telling us is there's a need for this early warning system with sub-seasonal to seasonal lead time that can help their preparedness activities. And this is where we are coming in. And there have been a lot of really exciting development. So for example, the sub-seasonal to seasonal weather forecasting has improved considerably over even, compared to what it was like 5 years ago. We also know that large-scale weather phenomena such as El Nino Southern Oscillation that is known to govern weather regime across the globe can be predicted with, fairly accurate
prediction with 6 months to a year out in advance. We also know that a lot of the infectious disease have memories. By that, I mean they have seasonal pattern, right? And of course, we have much better understanding of the role played by social determinants of health now. And finally, there has been a lot of really exciting development in the use of sort of like machine learning in public health that enables us to harness all of the powers of each of those independent components that I described. So taken together, it provides us a unique opportunity to develop this early warning system to help public health practitioners prepare for climate change driven risk. Right. So what we are thinking is certainly this, application of such early warning system in terms of a ready, set, go framework for public health, where you ready the public health system based on the seasonal forecast, and you set the assets in place based on the sub-seasonal forecast with good 2 to 4 week lead time. And finally, if you still see the risk based on the weather-based warning system, and that will set the everything go, so to speak. And so that's the idea. I think this is really interesting time to be involved in this work, certainly, and so we hope to partner. We are funded with the National Science Foundation as a part of the Belmont initiative to develop this early warning system for the Asia Pacific region. So what we hope to do is then, once we have this for diarrheal disease, we can expand it to other health climate sensitive outcome, but then also expand it to other geographic areas. Thank you for your attention.
Thank you so much, Amir. And this makes the end of the presentations from the research today. And I just want to highlight to the audience that the NBEL project is a kind of a one-stop shop for getting access to all these people who are involved in these research projects, if you are interested to follow up more with them. Now it's my pleasure to give the floor here at the Health Pavilion live to Mary Friel, who's a policy and advocacy manager at the British Red Cross. Mary, tell us about how the Red Cross has been dealing with the overlapping climate and health risks, both internationally and here in the UK.
Thank you very much. I'm going to move over so I can move the slides as I talk. So hello, everybody. My name is Mary and I'm from the British Red Cross. The British Red Cross is part of the Red Cross and Red Crescent movement. We're present in 192 countries around the world, present with local volunteers to respond when disaster strikes. And very much the last 18 months has brought into stark focus for many of us the overlapping impacts of extreme weather and health. And to try and make sense of this at a global scale, the International Federation of the Red Cross and Red Crescent, as well as the Red Cross and Red Crescent Climate Centre, published in September the compounding impact of extreme weather events and COVID-19. And what this found was 139 million people had been affected by that overlapping impact of both extreme weather and COVID. And that was resulting from 433 unique weather events. But what does that mean on the ground? Well, the Kenyan National Society of the Red Cross contributed to this research, really told that story of overlapping risks over time, how that builds into humanitarian need. In Kenya, the Kenyan National Society has been responding to, firstly, extreme floods in 2020 alongside COVID, which has then moved into a period of drought, which currently has over 2 million people facing acute food insecurity. So very much at the front line, seeing that overlapping impact of multiple extreme weather events over time with COVID. And what does that mean for people on the ground? Well, that means rising food prices, it means reduced crop yield, and it is women and children who are on the front line of both of these overlapping crises. But to share as well an example from the British Red Cross in the UK, we are a national society that works both domestically and as well working with sister national societies across the world to provide surge capacity and support in humanitarian contexts. And what we recognised was that actually heat risk was a growing issue within the UK with a significant perception gap. So we commissioned a piece of research called Feeling the Heat, which brings together the latest kind of policy analysis on heat within the UK, as well as offering really practical solutions. So why did we do this? Well, the UK Climate Change Committee on Adaptation warned that the health impacts from heat within the UK is one of the top 8 issues for action from the UK government ahead of the next National Adaptation Programme, which will be published in 2023. We saw very clearly in 2020 the overlapping impacts of extreme heat and COVID as well, that overlapping impact of extreme weather and health. How did we see that? Well, in England alone, very sadly, it was the deadliest year ever recorded by Public Health England, with 2,556 excess heat-related deaths in England alone. And we really wanted to unpack why that was. So as the British Red Cross, we commissioned this piece of research, also trying to understand what were the perception gaps, where were the UK public in understanding the existing level of heat risk to them and to neighbours as well. And what we found was that 1 in 4 people within the UK did not believe that it was hot enough to have a heat wave, despite there being 85 heat waves in the UK declared since 2020. We also find, quite worryingly, that over half of over 75s did not perceive themselves to be an at-risk group. And again, we were concerned about how that perception of not being perceived as being an at-risk group how that would lead on to potentially taking some preventative steps, some really basic steps which can help to save lives. So alongside this policy research, where we've made recommendations on a number of issues around how to involve the voluntary and community sector more in supporting people to get that warning quickly whenever a heat warning goes out. We also thought it was important to publish in a really accessible form heatwave checklist and first aid advice. And we launched this this summer during one of the key UK heat waves in partnership with the Met Office, as they launched their new extreme weather system as well, and also aligned to Public Health England messaging called Beat the Heat. So we saw a kind of a clear gap and a clear role as a Red Cross National Society in trying to tackle that perception gap that exists currently within the UK, and we're currently sharing that with other national societies who may be in a similar position where heat risk is a growing issue. But to conclude, some kind of broader thoughts from having given a little bit of insight on what our global research has said and what we've been doing a little bit more within the UK, I want to just conclude with really the importance of early warning, early action systems. We saw whenever the major cyclone hit in Bangladesh last May, how very, very quickly government, health authorities, volunteers all worked together to be able to support people, 2.4 million people, to be able to evacuate quickly and to save lives. And adding on top the COVID-19 pandemic and that additional context, the Bangladesh government opened up 3 times the number of spaces for people to seek shelter in order to facilitate and allow for physical distancing. And the Red Crescent volunteers were on the ground very practically as well, offering support, offering different equipment as well, PPE, to make sure that people were being kept safe. So we see that as like one really, really practical way of being able to take action. Another is about how do we integrate more readily, not just direct public health interventions, but how can we work more creatively, particularly with city planners. So how can we invest more in cool green spaces? How can we make sure that we're investing so that we can help to mitigate the rising temperatures, particularly within urban areas? And finally, to just conclude that with all of this, the importance in everything being locally led, and that investment flows to communities and that they lead that process. Thank you.
Thank you so much, Mary. we will move to our final speaker today, which is Anne Stauffer from the Brussels-based Health and Environment Alliance, where she leads HEAL's activities on climate change, energy and air quality. And after hearing all the speakers from the research side, we would like to ask you, what opportunities do you see to apply what we're learning today about climate and health into policy? And over to you.
For the question, and also thank you very much for the opportunity to be part of this conversation and learn here again on the new evidence on how our health is threatened by climate change and the impacts we're already seeing. I think this is all very relevant, and adaptation as an issue is also something that has increasingly come up in EU policy deliberations. HEAL is an alliance of over 90 member organizations from the health community working for better health through a healthier environment in the European region and beyond. And for the EU, we have recently seen the launch of an updated adaptation plan, which includes health concerns. Importantly, for example, the setting up of a climate and health observatory to gather more data on how our health is being threatened by climate change. I think at the same time, the extreme weather events that we have witnessed across the European region and across the world this summer have also shown us how ill prepared we still are, and how much there is an urgency to look into adapting. And this also reflects what the previous speakers have said about the need to set up good early warning systems and alert systems and responses. We know from other assessments that Europe is actually the region that is most vulnerable to the heat-related impacts of climate change. So I'm particularly concerned here about those people living in cities, the urban environment, and how we can better protect the health there. And I think there is a long way to go in bringing together urban development, city planning, health experts, and policymakers in looking how we can, if you want, climate and health proof our cities in adaptation. And the EU, when it comes to adaptation, the EU very much has to play and should play a leadership role, a global leadership role, and that of course also includes providing with the adequate financing for adaptation measures to be taken across the globe. The second point I wanted to make when we're looking at the complex on health, climate change and health, is that of course we still have time to protect the worst health impacts, and we really have the time, and we need to make the time to look into prevention, and that means of course climate mitigation. And as you all gathered at COP, I think it's really key that we have a strong COP outcome, that we have an outcome that commits and puts forward a path really to keeping the world on a 1.5 degrees, and to keeping the Paris Climate Agreement goal, and especially consider how we can achieve the swift decarbonization in the next decade, in this decade, sorry, in the years to 2030. And this is also something, a call for stepping up on mitigation is something that has emerged from the global health community. Just before the COP, we've seen a call with a climate prescription, a healthy climate prescription, that was initiated by the Global Climate and Health Alliance and others, and a call that has brought together over 400 health organizations and numerous individuals representing 2/3 of the global health workforce in putting forward a strong call to the COP on stepping up, on ensuring that we stay within the 1.5 degrees goal, and as well including that means urgently phasing out fossil fuels and our dependence of fossil fuels. And that ties into also the first presentation that Christian was talking about in terms of the linkages between air pollution and health. where we actually have another opportunity following the launch of the recent WHO air quality guidelines. And we now have the opportunity in the EU, but also in other regions of the world, to set stricter clean air standards, which are an important driver as well for climate action, and which are an important measure as well in our efforts to help adapt to climate change. But as I said, the key message is really that, you know, we still have the opportunity, and we need to take the opportunity to prevent the worst health impacts we'll be seeing. Thank you.
Thank you so much, Anne, for this. We are unfortunately running towards the end of our session, but I would like to bring in one question from the audience digitally here at the very end. And I'm hoping perhaps, Mary, you can try to respond to this. And the question is, how do we scale up some of these adaptation actions that the speakers have been talking about today in responding to the increasing risks?
Thanks very much. I mean, there's so many ways, but I would point to maybe two different areas. So one globally, which the Red Cross movement has been really trying to raise as much awareness as possible at COP and beyond, is around the risk-informed early action partnership, which is aiming to make 1 billion people safer from disaster by 2025. This is really practically bringing together the capability of meteorology, of humanitarian organizations, really cross-cutting between governments and private sector to try and make sure that we are better pre-arranging finance and putting in place better early warning systems. So that's a very practical way that things can be scaled up, and we saw some encouraging announcements actually yesterday from the UK government and FCDO on that, and we would hope that that will continue to flow through this conference, because if we can avert and prevent disasters from happening and the worst humanitarian impacts, we have a moral imperative to do that rather than respond. The second is just to pick up on the final contribution was around how do we really take action around and scale up heat interventions and that needs to happen within city and urban planning. That's absolutely massive. There are so many buildings which are not fit for purpose globally. I know that Europe was highlighted as a particular example for European Union practice, but that is something at a domestic UK level British Red Cross is looking at ahead of the National Adaptation Programme.
Thank you so much, and I think we could have continued discussing this topic, of course, in more length than we had the chance today. So this session has now come to an end, and I would like to thank all the speakers, both here in the room and on Zoom, and also the audience, both here at COP and virtually, for joining us today. And with this, I would just say thank you very much, and let's continue working on this together.
raised. Or if you do not agree, there's no action from your end. So let me see how that looks like. Good. I see lots and lots of hands raised. Wonderful. Let me raise my hand as well because I completely concur and agree. It's fantastic to see that we all agree that water and sanitation is important in complementing efforts in response to climate change. And this is the conversation that we are having today. So I'll hand over to Dr. Katerina now to set the scene with a background of this topical discussions that we'll have in this session. Over to you, Dr. Katerina.
Thank you so much, Liz. And it's a pleasure to be again in a panel moderated so wonderfully by you. Thank you so much. And I think that my keynote will be about trying to convince those who didn't raise their hands now when you ask that question, Liz. Yes, water and sanitation are crucial when we talk about climate. And at this climate conference that is being held in the shadow of a triple crisis, the health, economic, and climate crisis, it's important to remind ourselves that the uncertainties caused by the COVID-19 pandemic affect jobs, they affect economies, and nearly every facet of daily life. Moreover, the steadily and increasingly rapidly unfolding climate change crisis is adding to the mix. 90% of climate change is being felt through weather-related events, which have an inevitable impact on the water cycle, which means that across the world, people and communities are frequently and more frequently fighting themselves too much or too little water. Either it rains too much and for a short period of time, or we have more and more prolonged droughts. Inadequate access to water, to sanitation, and to hygiene is responsible for as much as 10% of the global disease burden, contributing to 1.6 million preventable deaths each year, including 60% of all deaths that are due to diarrheal diseases. If we look at a map where this plays out, inter alia, those places where people have poor quality water, sanitation, and hygiene services, we see that these are the same communities who are the most vulnerable to the severe impacts of climate change. UNICEF published a very interesting study focusing on children, obviously, but where this overlap is very clearly shown. The lives of women and girls are especially impacted as they travel further distances in search of safe water sources, farther and further from their homes, collectively wasting more than 200 million hours every day on this task. And of course, as water scarcity increases and as water sources start drying out, of course, these distances also increase. Unabated climate change will make an already bad situation even worse. It's clear that we need decisive action, but where the problem begins may also be where the solution starts. Ladies and gentlemen, here at the Health Pavilion today, we will be talking about what sustainable solutions look like. It means harnessing the expertise and know-how of our communities, especially community health workers. It means recognizing that we are in this together and that only by joining forces across sectors, health, climate, water and sanitation, will we forge a sustainable path forward. It means putting women's voices and knowledge at the center. At the end of the day, we are talking about building sustainable solutions which protect and promote the human rights of all people. We have the tools to build a greener future. We can insist on the political will that is needed to realize that future. The future is now, and justice begins precisely here. Thank you so much.
Oh, wow, wonderful. Thank you so much, Dr. Katerina, for those passionate sentiments and some grim statistics that you've shared with us. I think my takeaway from this is what you've really rightly put so 90% of climate change is as a result of the changing weather patterns, and we can all move together. This is not something that can be addressed by one person, but it's a collective action for all. Dr. Katarina has set the stage so spot on. And, you know, there's a saying that they say, words, a picture is worth 1,000 words. So now I want to introduce a video that will paint the picture for you even further. Just meeting our two community health workers from Narok County, both Elizabeth and Jane, so that you can just really see how it is working at the community level. We have the video now.
Kwa majina ni Jane na Shiva Matule.
Kwa majina ni Elizabeth Masigonde.
Naishi Olokuto Senda. Nafanya kazi ya community health volunteer.
Nimefanya hiyo kazi kwa muda wa miaka 10.
Anga inapobadilika, tunakuwa na shida ya maji. Mito ni mbali sana.
Kulingana na venye tulikuwa tunafuna mavuno imebadilika. Juu wakati mvua ilikuwa inaanza, huwa tuna time ati kutanyesha mwezi fulani na hainyeshi. Huwa tunachelewa na kupanda, nayo inatuadhiri kwa sababu hatutime vizuri wakati kunanyesha. Sasa mvua inakatika wakati mimea bado iko kwa shamba. Kwa hivyo kuna changamoto ya maji.
Watoto wasichana wanachelewa, wanakuta vijana wako huko wanashuma, wanapata mimba ya mapema.
Mzee akishaenda kazi zake ananiwachia mifugo na mpaka niwapeleke maji. Nikishawapeleka maji, kama hakujanyesha mpaka niende na punda nikuje na maji, na niko na mtoto kwa mgongo.
Tunahitaji maji safi ikuwe karibu na manyumba zetu na maboma zetu ili tupate maji ya kutumia, kwa sababu saizi unaenda hiyo mtoni unaleta mtungi 2, na hiyo mtungi 2 ni kidogo wakati ya corona. Maji ya kuweka hiyo mitungi uoshe mikono hata hakuna. Hata mtu unapoingia choo kutoka, huwezi pata maji ya kuonawa mkono. Yaani kupata maji ni shida.
Siku ya kuchota maji hakuna kazi ingine, ni kuja tu kupika, hakuna kazi ingine utafanya. Inabidi niamke mapema na inachukua muda mrefu. Ukienda kuchota maji na kurudi tunatumia karibu 4 hours.
Unakuta hata hiyo maji imechafuka mtoni, unakuja kuchota unaleta ugonjwa.
Wamama ndio wanaathirika sana kwa sababu mzee akishamaliza breakfast yeye anaenda shughuli zake. Sasa hataki kujua kama mtoto alipikiwa chai akienda ama mlipata maji.
Mimi kama CHV nikienda kuangalia watu, kutembelea maboma zao, kama wakati huu wa kutembea kuangalia machoo na mazingira, tunakuta ako na ugonjwa, anaumwa na tumbo, anahara, na hiyo yote ni shida ya maji. Hata unatembea unachoka, hata ukiingia kwa boma kuomba maji unapata maji chafu yenye hata ukikunywa unaumwa tena, hata wewe unapata shida ya tumbo. Maji ni maisha na maji ni uhai. Tunapopata maji safi, maisha yetu itakuwa mzuri. Tutapata maji ya kutumia kwa nyumba, kulima. Tutapata hiyo chakula, wasichana hawatapoteza wakati ya kwenda shule. Tutaendelea kama nchi zingine. Community wananitambua kama daktari wao. Ninayotaka ni serikali kututambua sisi kama community health workers. Hiyo pesa yenye inaendanga kwa hospitali itaenda kwa miradi zingine.
Mimi kama community health volunteer ningetaka serikali watichimbulie boreholes na matangi ili kuturahisisha sisi kama wamama ndio tuweze endelesha maisha ya kila siku, kwa sababu sisi na watoto ndio tunaumia.
some really important questions posed there. What can we all do to ensure that water scarcity, the impacts of climate change are not adversely affecting our communities, even at the rural setting, at the peri-urban setting, at the urban setting? And what Jane and Elizabeth are experiencing is not something unique. It's something that is felt across many countries in Africa. And we are here today to discuss possible solutions, as Dr. Katarina had put it. One of the things that I picked out of this video is the passionate plea that comes from Jane and Elizabeth, who are representing millions of community health workers, stroke volunteers across different parts of the world, to ensure that the governments recognize and remunerate them for the work that they are doing. And this takes us to the second question that I have for you. The rules are the same. If you agree, if you say yes, please do raise your hand. And the question is, do community health workers like Jane and Elizabeth, as you have seen in the video, need to receive a salary and recognition for the work that they do? Please raise your hand if you say yes. Again, the icon to raise your hand on is on the lower part of your screen. So please raise your hand if you agree, and no action if you don't agree. I completely agree, so I will raise my hand. Oh, wow, and I see the numbers really rising rapidly. So far, out of 55 attendees, we have 34 that have said yes, they need to be recognized and remunerated for the work that they do. And here at Amref Health Africa, this is something that has been really close to our hearts. We have done a lot of advocacy campaigns, pushing different governments across the continent to really recognize the pertinent work that is done by our community health workers. And now I want to introduce a really unique segment in this particular session. And this session is called the armchair meeting. I know we're not able to meet each other physically at the moment, but this armchair meeting will bring some semblance of, we're together, we're in the same room, etc. And in this meeting, our panelists will discuss pertinent issues around this topic on building resilient systems in Africa, and they will pose to each other questions. So over to you, Dr. George Kimathi, to take us through this. Thank you.
Liz, thank you. Thank you so much, and good morning, good evening, all of you, and very happy to be here. Thank you, Liz, for that. I'm very happy to be part of this armchair conversation with my colleagues, Barbara and Catalina. Catalina has laid a very good foundation together with Jane and Elizabeth from NAROC on the power that we definitely have to extract from supporting community health systems and community systems, and listening to them, their passionate appeal for social determinants of health, for access to safe water, access to sanitation was so revealing. But first, before I get to engage with my colleagues here, just to share a couple of thoughts that come to my mind as I think about building community health system resilience in Africa. First of all, to appreciate that infectious diseases that are very sensitive to climate impact, malaria, schistosomiasis, dengue fever, affect sub-Saharan Africa populations disproportionately. And we all know that over 90% of annual global malaria cases are actually in sub-Saharan Africa generally. And we have issues, big challenges in malnutrition, diarrhea, heat stress. But again, during COVID, we've seen a huge pandemic around mental health. Climate change is such a huge contributor to that when you think of displacement of communities, destroyment of homes, and of course, loss of life which comes from it. So, and also the economic cost, as articulated by Katarina earlier, which is so clear, all this has been documented. And the estimates are that by 2030, actually, climate change will account to $2 to 4 billion in direct costs because of this. But then I think governments have also done some bit of work, which is useful. I think it's good for us to appreciate that approximately 84% or thereabout of countries are actually on the path of implementing the 11 actions in the national plans joint action plans, which is really good, of looking at the intersection between health and environment, which is really, really powerful. But we also know that within governments themselves, there are challenges of particularly coming up with sector level policies that are required to track these commitments and to push them to realization. So this is critical. But again, with governments and appreciating the costs and the disease patterns that we are seeing due to climate change, we know investments are important. So we need to invest. We need to put in finances for us to support communities, like what we had from Jane and Elizabeth, for them to be able to undertake mitigation measures. And therefore, the private sector is so important to all this, for private sector to be able to decarbonize production, which is critical. But also governments definitely then comes in to provide incentives for these companies to decarbonize quickly, for us to be able to appropriately ensure that low carbon technologies are affordable. That's so important. But I think most importantly, and for the purpose of our discussion today, is to ask ourselves, how do we ensure that communities, and that is where the rubber meets the road, that's where the greatest impact is felt, of course, where communities live. And particularly when you look at African communities, that we have direct investments that are going to these communities for them to do afforestation, to do smart climate agriculture, very critical. But let me share just a little bit what we do so much within AMREF, particularly around the health workforce and frontline health workforce in Africa. We believe that a couple of things that we are doing, we need to do much more about. One is asking ourselves, how do we build the surveillance and early warning systems within the health system, and particularly at primary healthcare level. And data is so important. So building capacity of healthcare workers in appreciating the value of data, all the way from capturing the data, synthesizing it, and presenting it in a manner that is able to make sense and to inform decisions at that level. And therefore, skills building is critical. But can we be able to build skills without developing curricula? I think it's important for us to ask ourselves, how do you develop curricula for healthcare workers that is able to be interdisciplinary, that you can produce a healthcare worker who is able to think cross-sectoral? Because the impact of climate change in health is about nutrition, is about understanding mitigation measures that communities need to put in place. But again, thinking of frontline healthcare workers, I think the most important level that we're gonna have to invest in is actually community healthcare workers, which is so critical, like Jane and Elizabeth, what we had from the ladies from Narok. And studies have shown that if you invest $1, just $1, at community level, training community health workers, retooling them, equipping them, it gives us a return of $10. You can see the math, straightforward. And therefore, because community health workers are the link that we have in sub-Saharan Africa between households, between populations and the health system, they are so critical. They are the ones who get to interact on a daily basis with the impact of climate change, changing disease patterns, increase in incidences of disease. They are the ones who interact with it as they work with households. And therefore, because they understand that their context, they are built trust over the years, they are able to do referrals for patients and clients at community level. This is so important. And of course, doing what we are discussing today, doing promotion activities for WASH, encouraging use of safe water, encouraging hygiene practices at community level. But also very importantly, linking to the health system, supporting their communities to do surveillance and understanding early warning systems and putting early warning systems in place. That is so important. But I guess that would not be enough if we don't build their capacity, community health workers, for accountability, for appropriate and effective engagement with the governments at the next level. Because the primary duty bearer of all these things that we are discussing certainly has to be the government. And as I said earlier, governments are provided that leadership. But how do we build the capacity of community health workers to have the resources, to have the tools, and to have the voice on behalf of communities to push for certain things that need to be done at community level? I think that's important. And I guess, as Jane said, then we need to invest in engagement with governments to ensure these community health workers are formalized and become part and parcel of the formal system. That is so critical. But again, as we do that, we cannot lose the fact of gender in all these conversations. As Katarina indicated earlier, it is so disproportionate in terms of effect that women and children are most affected, because women are caregivers. Even when you look at the community health workers that we work with across Africa, majority of them, up to 70-80% of them, are women. They are the ones who struggle to look for food for their children when drought hits, when there is famine. because of climate change. They are the ones who walk for kilometers and kilometers to look for water for their families. But also when you have disease patterns change, women are caregivers of their children and their families, and therefore they are disproportionately, of course, affected. So it tends then to broaden the existing gender-based health disparities which we are seeing today. And therefore, we cannot look at all these and the conversations that we're having without asking ourselves, how do we ensure that women are actually at the center of the conversation? That's so critical. But again, as I said, when there are civil strikes because of droughts, because of insecurity, which is a result of climate change, women are most affected, which is really unfortunate. And certainly there has been studies now which show very clearly that environmental toxics, when women are exposed to this, then the preconception, at the prenatal period, they are profound and lasting obstetrical outcomes. So very direct impact, negative impacts on women because of climate change. So then the question that I have in my mind and I want to pose to Barbara is, as we've discussed and as we heard from Catalina earlier, intersectoral action is certainly very important. We need to bring in the private sector, we need to bring in CSOs, we need to bring in governments, we need to bring in all players for us to address the negative impacts of climate change on health, access to healthcare. That's so critical. But then we can do all these things, but we do not involve women actively. Meaningful engagement of women in everything that we do, potentially we cannot get there. It cannot be sustainable. So Barbara, I want to pick your thoughts on, could you share your experiences, and could you tell us why it's so crucial for us to ensure that women are on the driver's seat when we are discussing and implementing climate resilience at community level? Barbara.
George, thank you so much. And what a great question to start off. Why women? And I have a lot of good answers for that question. But first, let me also say thank you to Amref Health Africa. Such a pleasure to have this opportunity to meet like-minded actors in this world of climate that we're doing, who also have so long been walking the path alongside communities for better health. So why women? Well, absolutely, without a doubt, one of the key learnings from human development over the decades has been women are essential to any sustainable community lift. Particularly, we've seen in microfinance, as well as with girls' education, the indisputable fact that women and girls are key to sustainably alleviating poverty, to sustainably allowing communities to unlock the brilliance that exists, to really being able to ensure that voices are heard and that we are listening. I think it's such an exciting time to be alive, because this is half of humanity that is finally having some real chance to make a difference in the course that our planet is taking. I have the real privilege to, at the moment, be here at COP26. And one thing that people have noticed, because of the real inequity about vaccines, not everyone is here. So I'm speaking doubly loud on behalf of all of us who believe that women are central to the solution, to elevate women and their really around the world as part of climate solutions. So Pathfinder has for many, many decades really walked alongside women, supporting their choices in a rights-based way around sexual reproductive health and rights. And everything you just said, George, about understanding the pivotal role that women play, not only as the community health workers, and boy, Liz, you were right. A picture is 1,000 words. Well, that gorgeous video really just moved me. I think that the way Jane and Elizabeth talked about their experience was so real. I mean, it's undeniable what we have as an opportunity to further empower those individuals who are at the front lines. In addition, though, to community health workers, women themselves often set the tone for things like their household behaviors and choices. So simple things like washing hands, behavior on water treatment, that is really set at the household level. We at Pathfinder recently did a huge amount of research in a climate forecast looking at extreme heat and how that will impact countries around the world. And we really noticed that there's such an important way to develop and design interventions based on an understanding of how women at the household level influence behavior choices. And that's hugely exciting. So the other lesson for me coming out of COP26 is that at long last, there are some conversations which are connecting the dots. We have to get out of our own silos and reach across for some new partners, for some new ways of working. I think Katarina will address this as well. It's just exciting to see the Global Alliance for Climate Health, because not only is health a way to better climate solutions, but climate solutions are a way to better health. They're really mutually reinforcing. And I have just three ways in which at Pathfinder we're really working in this emerging area to support what we call women-led climate resilience. We at Pathfinder believe this work is so important because the context of doing our work has shifted. It's impossible to be working in Africa and not understand with real empathy and compassion the climate context that people now live in. You can't do the work without understanding and without really taking that into account by listening. Over a decade ago, we started in Tanzania doing work at the nexus of women's reproductive health and rights and the environment. We were working in the Lake Tanganyika. And in that community, we learned so much from members who told us about the importance of this link. And then often, communities had just been approached either by environmental groups or sexual reproductive health and rights, but very rarely working across silos. So we started doing that work and we learned a ton about the importance of working at the intersection. Right now, our approach to women-led climate resilience, we're working in 3 different areas. We're just launching some work in Niger, where obviously the incredible lack of water is creating not only water insecure, but also affecting crops. And so there's quite food insecure communities there, which has led to an unanticipated and fairly recent trend of huge female migration, out-migration to the larger cities of Nigeria. Our community health workers, our network, and our team on the ground there, led by Dr. Sani Alu, is very much taking this seriously and understanding how and where might we be able to understand what can be done, and really listening to how the health system itself can be further made robust and resilient so that while people cross borders and are on the move, they also have access to critical contraception needs that they have. We understand communities in migration also have much more vulnerability with gender-based violence and other unanticipated concerns. So we really get excited about starting on this journey. And we know that it will take reaching out to partners, many of whom are on this phone call, to be able to say, we're going to work together. We're working in new ways. We're building coalitions. We're working across with agriculture, food, WASH, of course. I raise my hand loud and proud. And I love this in the chat right now. COP, I'm doing some speaking events, really encouraging that, yes, this climate adaptation funding needs to happen. It's time to actually press go on the promises and the pledges, and that we have to have programming on the ground to put it and to incorporate, to make it work. So yes to women-led climate resilience. Yes, George, to, as you just pointed out, all the good reasons. Women in the driver's seat for being part of climate solutions. And yes to working in new partnerships. We at Pathfinder are so very grateful to understand the importance of all the expertise that people bring to the table. So we look forward to that. And as I hand off the baton to Katarina again, I understand with your background in human rights, Katarina, I think we all understand the various pragmatic reasons to incorporate women and girls, but there's also great legal doctrine to be able to rely upon. So I'm just curious if you can help us understand that as we make our best case in front of policymakers, funders, and donors for this work. Thank you.
Thanks so much, Barbara, and you are very right. It's the right thing to do, but I always think, maybe because I'm a lawyer, I always think that making the legal case, in my opinion, is powerful when we talk about, as you were saying, with governments, when we talk with donors, even with international organizations, development banks. And why do I mention international organizations and development banks? Because these normally have boards of directors, and very often it's governments who have signed up these human rights obligations or women's rights obligations that sit on those boards. So if their own countries signed up to certain legal obligations, this is what they should be advocating for when they sit on the board of the World Bank or the African Development Bank or the IMF. So, as you were saying, ensuring women's empowerment participation is obviously good sense, but it is a legal obligation of states under human rights law. And however, the reality is that despite the fact that the Universal Declaration on Human Rights, that we all know, was adopted already over 70 years ago and insists on the elimination of discrimination based on sex, gender inequality remains one of the most pervasive human rights violations throughout the world. And as we were discussing before, the climate crisis will only exacerbate this situation and these constant violations. So while human rights does not provide a silver bullet solution to complex policy choices or even trade-offs, it does, however, put forth a framework that helps to establish some basic minimum requirements. And I think this is something that is important for us to bring forward when we interact with governments. It's not a choice or an option. We are talking about human rights obligations, I'm repeating myself, that they have signed up to. The number of countries that have ratified the Convention on the Elimination of all forms of discrimination against women is huge. So I think we should use these powerful arguments. And for example, active, free and meaningful participation of all affected groups in connections with decisions that affect them is one of those foundational principles. Non-discrimination, including based on sex, is another one. These are critical in order to ensure accountability, which is also at the core of human rights law. So human rights law also offers practical considerations, which, for instance, influence how water users get prioritized. For example, a state must ensure that water is first directed towards the realization of human rights, including the right to safe drinking water, but also the human right to health, to food, to the environment which is the most recently recognized human right. And what we often see is that, unfortunately, number one, governments often don't even know how much water they have, and they don't make these calculations of prioritization. And the overall water required for ensuring the basic needs that I refer to is relatively small when you consider the amount of water used by the industry or by large-scale agriculture. And what we also see is that in the context of climate change, where water resources are becoming scarcer or more variable, as I was saying at the beginning, clear prioritization is essential from a human rights perspective. I like to say that we need to ring fence, protect the amount of water that is necessary to ensure the human rights of the people in a given country. And then, yes, and then with the remaining of the water, we can use it for other uses. I was talking about the industry or even large-scale scale agriculture, etc., as long as human rights are first ensured. Sorry. Um, Much of what you were saying is music to my ears. Sanitation and Water for All is a global partnership, and we believe in the power of reaching out to other sectors, reaching out to different partners, to different constituencies, to different stakeholders. So we do support multi-stakeholder forums, dialogues, not just with, as I was saying, with the water and sanitation minister, but also with ministers responsible for health, for economic development, ministers of finance, and also with civil society, with academic institutions, with donors, as you were referring, Barbara, but also with the private sector. So we think that this cross-sectoral dialogue is indeed crucial. It is indeed critical to ensure sustainable and effective policy choices, such as those related to the prioritization of water users. This is also an important means by which to ensure meaningful participation, especially of marginalized groups, including women. Finally, the realization of human rights requires dedicated efforts to take these rights from words in a treaty to the lived reality of people across the world. To do that, we must generate the political will to respect, to protect, to fulfill, to ensure these rights. When water sanitation are high on the political agenda, honestly, the technology and the financing are easy to arrange. But elevating political attention means that we need explicit outreach beyond the water sector to the highest levels of decision making. So water, sanitation, hygiene must become unavoidable for any politician. It must transverse any party lines or ideological agendas, because without water, sanitation, and hygiene, and we saw this now very clearly during the COVID pandemic, our efforts to ensure good health or to addressing our worsening climate crisis will not succeed. And indeed, ensuring access to water and sanitation is a critical and central, even I would say, dimension of ensuring the full realization of all human rights.
Wow, this was such an enriching conversation between the three of you, Dr. Kimathi, Barbara, Dr. Katerina. At some point, I forgot I was moderating and I was busy taking notes, but my biggest takeaways from this is climate and health are interrelated. It doesn't matter from what lens we're looking at, but they're interrelated. Women are at the core, they're the most affected. Vulnerable communities need to be brought at the fore. Coalitions, partnerships, stakeholder engagements, including various constituencies, also is a key issue that has to be addressed to be able to move the needle in these conversations. And last but not least, climate change is a human rights issue, and human rights cuts across the food security, right to water, among others, as aptly stated by Dr. Katerina. This is really amazing. And I can see there's so many comments, feedback, questions. And I can see, I'll just read a few of the comments. Emily Blunt says, we need to pass the mic more often to community health workers and involve them. That's quite true and has been captured in these discussions. Constance Matholwa says, government countries need to recognize the role that community health workers like Jane and Elizabeth play, because they're often undermined and their contribution is taken for granted while they do quite a bit of work at the community level. Joram Oisebe says, we have a large network of community health workers that we can empower in matters of climate change so that they can be champions. We also need to bring on board all stakeholders. And this really resonates with the point that Dr. Kimathi was talking about. Do we need to also invest in curriculums that empower various stakeholders to understand what climate change is and how they can play a part in ensuring that issues are addressed. There's a question here that has been posed. I don't know which panelist will take it, but the question is from Joe Bonge, the Executive Director of the Young Volunteers for Environment from the Gambia, who asks, what outcomes at COP26 will support prioritization of health, climate, gender, and of course, water, sanitation, and hygiene? Basically, he's asking, what does success look like post this climate conference? Anybody who wants to take that between Kimathi, Dr. Kimathi, Katerina, and Barbara?
I'll begin with just one very clear outcome, which is in the last important conference of the parties, there was $100 billion per year promised for climate adaptation funding to the most affected countries that are also least equipped to deal with it with their own funding. So that is a huge consequence, and that funding has not happened. And so we're starting to see that the US government, under the Special Envoy to Climate, John Kerry, as well as Samantha Powers, who now runs the US aid, that actually this will be mainstreamed as part of the kind of funding that happens. So I hope that part of the outcomes for COP will be climate adaptation funding, which is long overdue. That's one very clear outcome we can all hope for.
Yeah.
Perfect. George, you want to add?
Just a quick thought, Lisa, and I totally agree with Barbara in terms of financing, but I also think if from the COP26 we are able to change the conversation to invest where it matters most, that is invest in community, strengthening their systems. If it's community health workers, invest there, retool them, equip them, and put them in the front seat of strengthening their systems and taking action. I think that for me will be really critical, changing the conversation.
I so agree with you, George, in that stat around the 1 to 10. Who else gets an ROI of 10 times the input? It was a really brilliant sort of smart investment of those funds.
Another thing that we have been seeing, but of course we would like to see more, is so let me give 2 steps backwards. There has been a tragic and sad, I think, dissociation between the water and sanitation and hygiene community and the climate community, as if they were unrelated, as if climate didn't contribute didn't affect access to water, sanitation, and hygiene. And one of the things that our partnership has been doing has been to foster this integration of the 2 sectors at the national level. And we have seen some examples of national governments that have started to integrate, to bring in water, sanitation, and hygiene to their national adaptation plans, to their nationally determined contributions, and vice versa. Also, the infiltration of climate considerations into national strategies and plans for water and sanitation. Because working in silos and turning our backs to each other would bring us very far, right? So I think that one of the impacts of this COP has already been the creation of a bit of momentum. And as you know, for the first time, there is a water pavilion inside the COP. I know this is something symbolic, but it means something. It means that the water community is getting together and making sure that their voices are heard and infiltrate the climate negotiations. So I think that this infiltration, the mutual infiltration, would be an important outcome. Liz, I don't want to take the floor again now, but there is here a question that was addressed by Naneke to me.
Yes, exactly. There was a question. I was actually getting to that. To all of you, that specific questions, if you can take each a minute addressing each of the questions posed, we'll appreciate that. So Naneke Nix is asking Katerina, how can you ensure the power of communities so that they are enabled to speak out to governments to prioritize water? The question for George is, can you give an example of how you empower community health workers? And last but certainly not the least, Barbara, can we as international NGOs call upon donors to make sure that climate change funds are cross-sectoral but women-led, and how can that be done? Each of you has a minute for that. We'll start off with Dr. Katerina.
Please, thank you so much. Well, one of the things that our partnership promotes is multi-stakeholder engagement and the creation of national multi-stakeholder platforms where we bring also the voices of the communities, of civil society, etc. So how you can ensure that? What we do is we make sure that those countries that are our partners, that they establish or strengthen, complete such multi-stakeholder platforms, and that these multi-stakeholder platforms give real opportunities for civil society, for communities to express their opinions, but also to influence decision making. So it's not a button that you press, but it's an important dialogue that has to be held. And we see some impact, some changes in several of our partner countries, namely those that we prioritize each year when it comes to multi-stakeholder engagement. But it's a long-term process. It needs our constant, I would say, persuasion efforts and fight. That's what I would say. Thank you.
Perfect. Thank you so much, Dr. Katerina. Barbara, over to you. I'm sorry, George. Ladies first.
Well, I'm very curious to hear George's answer, but on the question of donors, we have to demonstrate success. I don't know if you've noticed, but donors can be quite risk averse. They don't like to lead out where there's unknown territory. So I think taking a bit of the opportunity to go out, partner up. We at Pathfinder have already done some what we're calling pilot projects on the ground. We've worked in Pakistan to do some women-led climate resilience in drought-stricken Thar Kapur. And we're also working in Bangladesh, where flooding from the Himalaya is just a regular occurrence and becoming more frequent and more intense with climate. We're actually discovering, as you would not be surprised, that these areas show us every solution is quite localized. However, there's absolutely things that can be done to increase resilience at the individual level, at the community level, and at the health system level. So by demonstrating that there are great interventions that move the needle and can be done at scale, I think that allows us to go to donors with a very solid case. And I would add that we are not shy in letting donors know now's the time. You know, time is up. This is absolutely the chance, and we have that opportunity working together. Thanks for the question.
Thank you, Barbara. And last but certainly not the least, Dr. George.
Thank you, Lisa. Thank you, Barbara and Katarina, for those thoughts. Liz, let me say this. AMREF works with over 120,000 community health workers across Africa. And what we've learned over the years is that if you do 2 or 3 things that we've done over years and we've seen it, you can build capacity of community health workers. As Neneke is asking, thank you, Neneke, for that question. One is, of course, what you might want to nearly call basic. Training is so important. If you are looking at a specific disease or even how they facilitate learning, awareness creation, behavior change within communities, it's so important. That knowledge is very critical. We've seen that to be very important. We developed tools, digital tools to do that quite easily. One of them called LEAP, which we've used across a couple of countries in Africa now. It works very well. But also, is tooling them. Community health workers require basic tools. Sometimes it may look basic, like a backpack with some templates or notes to capture what is happening at household level. That is so important. Even tooling community health workers with a basic phone, very basic phone, that they're able to capture data at household level, transmit it to the health center, but even use the phone to learn. That is so critical. The phone might cost, say, whatever amount of money, but it means so much in terms of transforming the healthcare access, promotion, prevention at community level. But and I guess very important, and I can see what the conversation in the chat is the recognition. The recognition at different levels. We have to move away from seeing community health workers as volunteers and expecting to give them just stipend when they participate in meetings. We have to see them as workers. I guess actually the most critical healthcare workers that we have within our systems, if we have to cut it where it's happening most, okay? And that recognition is not just about salaries, as someone has said here. It's also about about moving community health workers from being volunteers to integrating them within the healthcare system, giving them clear schemes of service, giving them clear career paths to grow, giving them clear, allowing them, formalized, structured training, institutionalized training in medical training schools, just as we do for other healthcare workers. When we do that, then we give them a chance for the training, we provide for the tooling and equipping that they require, and we provide for career growth and the esteem that they need as health workers within the healthcare system. That is so powerful. I guess if we do those three things plus, of course, others will get there in terms of building their confidence, empowering them, and giving them a chance, the chance that they need. We lean back, allow them the chance to actually take the steer as we sit back and watch them do it.
Absolutely. You have all been so spot on, as in this has been so mentally nourishing to just hear the role that we can all play in ensuring that we're pushing the needle in these conversations around climate change and positively impacting in our communities. But everything has to come to an end. But before we come to an end, I'll take you to our last part of this session, which is our call to action. And in the typical style of Dr. Githinji Gitahi, he could not be left out of this conversation, even though he had an emergency. So he quickly recorded a call to action for everybody attending this session. Please, let's play that pre-recorded call to action.
Colleagues, my name is Dr. Githinji Gitahi. I'm the Group CEO for AMREF Health Africa. And I'm really sorry, I had planned to join you today, but I couldn't. And therefore, I have decided to share my views through this video. And I hope my apologies are accepted. I do appreciate our partnership with all of you and the fact that some of my colleagues at AMREF Health Africa will be joining you. But I want to make this point through this video that in 1945, when the UN Security Council was formed, the biggest threat to global peace and security was war. But this is no longer the case. There is peace now, it's the age of responsibility, and the biggest threat to human peace and security now is climate change and disease outbreaks, as we've seen in the COVID-19 pandemic. I therefore want at this meeting to reiterate the importance of and the centrality of climate change, but also thinking about water, sanitation, and hygiene, which is very well linked to the climate change discussion and which also is a contributor to health security, as you've seen with the COVID-19 pandemic. And as such, I would call upon all of us to put water, sanitation, and hygiene at the center of climate change debate and also find solutions to combat it. Secondly, to also put multi-sectoral response to climate change at the center, because we must break the silos. We know very well that even as we talk about the negative impacts of climate change that affect significantly the environmental and social determinants of health, clean water, sanitation, food, and livelihoods, that women are significantly affected. The UN estimates that actually climate change displacements affect 80% women. So we must think about this impact. We must think, for example, that it's not only direct climate change impact, that social health or sexual health and productive rights is affected and affects climate change. Absence of reproductive health services for women and girls is a contributor to increasing population growth in many populations, which then put a stress and a strain on the climate and natural balance. The other thing I would like to talk about is the centrality of communities in adaptation and local solutions. That all these issues we talk about, including disease outbreaks arising out of negative impact of climate change, start and end at communities. Communities are resilient when they are supported and empowered. So we must put communities at the center of building a climate resilience environment. And finally, that we must put women at the center. Women are captains of combating climate change impact. Women are the ones who have to deal with the impact of scarcity. They're the ones who are to adapt to absence of water and food for their families. and yet they are underrepresented in many of these conversations and on the decision-making table. So we must also make women at the center of this response, of the conversations, and of decision-making. Finally, I truly want to make a call that if the UN Security Council is indeed going to look at peace and security for the world, climate change conversations and disease preparedness must have a stand or center stage within the UN Security Council. Because you know what? The global threats to human peace and security are no longer war. They are going to be climate change impact and disease pandemics. Thank you very much. And I feel honored to have been able to participate and contribute. Thank you.
Thank you so much, Dr. Gethenji Gitahi, for that very comprehensive call to action that summarizes everything that has been so eloquently discussed in this session. Thank you so much, Dr. Katerina. Thank you so much, Barbara. Thank you so much, Dr. George. Of course, thank you to each and every person that was able to attend this really wonderful and enlightening discussion. Thank you to our ICT, to all the organizers of this fantastic session. There should be a part 2 and a part 3. It was so enlightening, but we've run out of time. I want to thank you all. Have a goodbye, and make sure that you push that call to action in your various platforms and organizations. I've been your host, Liz Tonjira. Goodbye, good night, good morning, good afternoon from wherever you are. Thank you. Bye.
Thank you, Liz.
Thank you so much, everyone.
Thank you, everyone. Thank you, Liz. Thank
Bye.
you. Thank you,
Thanks
everyone.
all.
Bye-bye.
Bye.
Warm greetings to all participants. We give 1 minute to colleague to join, and then we start. All participants of the COP26 meetings in Glasgow and online. So my name is Lasha Boguadze. I represent the International Federation of Red Cross Red Crescent Societies. And it's my enormous pleasure to welcome you on the side event together with all co-organizers, UK Health Security Agency, Chatham House, Global Climate and Health Alliance, Red Cross Society of Indonesia, Red Cross Society of Uganda, Red Cross Society of France, Civil Society Engagement Mechanism for UHC 2030. So we will be talking today about the One Health linked to climate change, as it's often forgotten disaster. Not taking too much of my time, I would like to introduce you to Rivati Fake. Rivati will facilitate our session. Rivati is Honorary Associate Professor for the Global Health at Heidelberg University, Germany, and brings over 12 years of experience in delivering interdisciplinary multi-partner research, capacity strengthening projects in Europe, in Central Asia, South Asia, West Africa. Rivati's main interests lie at the intersection of climate impacts and challenges of operationalizing resilience within health systems. As head Climate Change and Health Unit at the Public Health England, UK, Rivati leads the National Climate Health Risk Assessment and is the focal point for the National Adaptation Programme. Rivati is contributing author of IPCC 6 assessment report and head chapter author of the UNFCCC Adaptation Gap Report. Rivati, the floor is yours, and thank you very much to facilitate such an interesting and rich session.
Thank you, Lasha, and sorry for that long introduction, but pleasure to be here and to welcome all of you on this 6th annual, as I understand, One Health Day. So it's a pleasure to be hosting this session on this important day. And of course, we at UKHSA believe that this is a cross-cutting theme for all the work that we do for all hazards approach for disaster risk reduction, and also predominantly the emerging infections and surveillance for antimicrobial resistance, food security, and so on and so forth. So obviously a very, very central topic to the work that UKHSA has been delivering, and some of you might know us as Public Health England previously, and as of 1st of October we are the UK Health Security Agency. So absolutely it's a pleasure to be chairing this session, and welcome everybody. And without any delay, I would say we have a fabulous lineup of 6 panelists, so I would request all the panelists to stick to 6 minutes. And moving on, the first speaker for today is Osman Dar. He's the Director of Global Health Programs, One Health. You probably need to get headphones, yeah. Yeah, so he is the Director of the Global Health Program on One Health at Chatham House and leads work on zoonotic diseases, antimicrobial resistance, and emerging infections. And he is going to offer us policy perspectives for the One Health approach. Over to you, Osman.
Thank you, Ravati. I'm just going to try and share my slides. That's all right. Just give me a sec, please. Hi, everyone. Thanks for the intro, Ravati. I'm going to talk a little bit about the One Health high-level expert panel and the work that we've been doing in the policy space globally around these One Health issues, and also a little bit about how that aligns with the agenda around climate change and climate change mitigation and adaptation. So, firstly, what is this One Health high-level expert panel, and why does it exist? Of course, over the last 20 years, we've had a lot of emerging infections, some with pandemic potential, culminating in the current pandemic that we're all going through. Many of the drivers for these spillover events from animals, be they wildlife or livestock, to humans, are similar to the drivers for climate change. And so there's a clear policy alignment, and that's been a big part of the focus of the One Health high-level expert panel. And why has it sort of been created? To specifically address these issues at the human-animal environmental interface. In terms of the global organizations, that sort of the technical agencies that lead on this kind of work, the FAO, OIE, and WHO have been collaborating around these issues since about the mid-90s, but it's been a bit of a stutter start collaboration. When there's donors in place, when there's funding in place, they collaborate. When the funding dries up, the collaborations are more limited. And there's been the conspicuous absence of the environmental sector from all of that. So after about 10 years of collaborating in this way, they sort of formalized their relationships through the tripartite in 2010, and they were focused largely on issues like AMR, food safety, zoonoses, but again with that conspicuous absence of the environmental sector. And so in 2020, the end of 2020, France and Germany at the Paris Peace Forum put forward a proposal to create an independent expert advisory group that would support the three organizations plus UNEP, because there was a recognition that the environmental sector was being underrepresented, and advise them on strategies around joint collaboration, joint working, and a coordinated way of advising UN member states on these sort of One Health issues. And so that's why this advisory group was put together. It started its work in sort of April, May of this year. There were, I think, over 750 applicants, and we've a final list of 26 experts from around the world. What are they sort of focused on? They're focused on providing that policy relevant scientific assessment on the emergence of health crises, and on supporting the four partner organizations in developing a long-term strategic approach to One Health issues. And in line with that, the partners are now putting together a One Health global plan of action. And it's got sort of 6 pillars, that One Health global plan of action. One is on strengthening that One Health coordination, communication, collaboration. The other is around zoonoses and emerging threats. Thankfully, there's another track that's specifically focused on neglected and endemic diseases. There's one on food safety and sustainable food systems. There's one on AMR, and we're looking at expanding the AMR focus to include vector-borne diseases, pesticides, and insecticide resistance as well. So that's an exciting new development. And then there's a track that's entirely devoted to environment and health issues as well. So there's a lot of alignment across the climate change agenda, as well as the pandemic prevention and preparedness and response agendas. And OLEP is sort of the expert advisory body for that global plan of action. OLEP itself is divided into 4 working groups, one that's focused on definitions and operational issues, implementation, scale up, turning theory into practice. One is focused on the sort of the current knowledge base. There's a third looking at surveillance issues. And here we're not talking just about the pathogens themselves, but also surveillance and monitoring of the drivers. And that's where it's really interesting. And there's a lot of alignment with what's happening across the climate change community. So who are the experts? It's a diverse bunch across all of those sectors and include people from behavioral and social sciences, modeling, epidemiology. And what's really nice, I think, about the group itself is that there's a very good geographical spread as well, with equal representation from high-income countries as well as low-middle-income countries, and there's very good gender balance. So you get a lot of robust discussion within the group and a lot of perspectives being shared from different experiential backgrounds. So what's important for stuff that the group's already done as far as the policy framing goes? Well, one is that they've taken on board the challenge of coming up with a One Health definition that can be endorsed by all four of those partners, those UN agencies, as well as by the global community. And that's perhaps what we should focus on, that definition, and then developing an overarching impact or goal for that global plan of action and a theory of change or pathways of change to try and achieve those goals. As far as the definition goes, this is what we have as a draft that's at the moment being circulated with the partners for approval. So I'll give you a second to read through it, but really it aims to be comprehensive and promote a clear understanding and translation across sectors and areas of expertise. And while health, food, water, energy, and environment are all sort of wider topics with sector-specific and specialist concerns beyond the scope of just One Health approaches, I think it's their interface where these multiple sectors have a shared responsibility and relevance in protecting health, promoting health, and promoting the integrity of our ecosystems. The other really interesting element, which is perhaps new and dynamic and which is encouraging for those of us working in this space, is that there's a real focus when it comes to developing programs and interventions on addressing the co-benefits of interventions that are tried, co-benefits across all three sectors, but also the trade-offs. So you never start an intervention or start an approach without considering what perhaps the negative consequences will be to the environment or to animals or to humans, depending on what the issue is. So I think that is a really exciting new development, which perhaps hasn't been there in the sort of siloed approaches we've seen around sustainable development to date. The other important thing to say is that the groups come together to promote a series of principles that should underline One Health approaches. And this should, perhaps hopefully inform a lot of One Health programming in the future. One is that there needs to be equity between the sectors and disciplines. The second is the idea of socio-political parity and the inclusion of and engagement of communities and marginalized voices, especially in the prioritization process. So the initiative should be a balance of top-down and bottom-up approaches, and not just the top-down approaches that we tend to see. That there needs to be socio-ecological equilibrium, and that means recognizing that other things other than humans have an intrinsic right to life and an importance in of themselves, independent of humans. And then there's the stewardship function, of course, that humans as sort of the apex living organism on the planet have a stewardship and a welfare function as in relation to the animals and ecosystems, and as well as future generations. And then, of course, underpinning all of that is the transdisciplinarity and multi-sectoral collaboration across all the relevant disciplines. I think what's also important to understand within the global policy context is that OLEP's work and the work of these four partner agencies have to really strike a careful balance between sort of the hard realities of a global geopolitical paradigm that's dominated by economics, security, and national self-interest, and then our sort of more public health, collective aspiration for a better world. And we're always constantly trying to navigate that. And so that sort of informs how we've developed this theory of change as well. So the overarching impact or goal is,
Can I ask you to wrap up, please?
Yeah, so just another minute or two. Is achieving these optimal health outcomes while contributing to sustainable development. And the approach looks at sort of the whole set of drivers, acknowledging the ecological planetary boundaries, and then the anthropogenic impacts. But understanding that we have to sort of navigate our theory of change between these national security-driven issues around health security, energy security, water security, and food security. And the activities and actions of both the global plan of action as well as OLEP will be across these sort of three broad dimensions of change as we consider them. So scientific evidence-based practice, knowledge exchange, and education. There'll be an element focused on socio-political engagement, policy and financing, and then operational considerations. And hopefully that 5-year global action plan for One Health 2022 to 2026 will be launched in January of this year and should align both the climate change agenda, the Sustainable Development Goals agenda, as well as the agenda around pandemic prevention and preparedness and control. Thanks.
Thank you, Osman. And we wouldn't have had a better introduction to the topic and the comprehensiveness of how many aspects of human, animal, and environmental health climate change is also touching on. So thank you very much. And also thank you for raising the points of equitable representation and having that joint vision and common understanding of how One Health is perceived by the people who are working in public health, in animal health, and in environmental science. Thank you very much, Osman. With that, we will move on to our next speaker, Jenny. Jenny Milner. She is the Executive Director of GCHA. Many of you have probably heard her. I think she needs very little introduction. And Jenny leads also on one of an important COP26 health program initiatives, which was the health sector leadership for climate adaptation and mitigation action. And she is going to talk to us about the role of health professionals in scaling up One Health.
Yeah, thank you so much. I think this is a point that is often made in these contexts, but I think it bears making again and again, is that health professionals are among the most trusted professionals in society. So they're trusted by people. They're also often listened to by decision makers. And over the last many years, health professionals have really increasingly come to recognize that in order to protect their patients' health, the health of the communities that they serve, they cannot simply wait for cases to walk in the door. They have to look at what's happening outside the hospital, outside the clinic door. This applies to climate change, it applies to One Health issues. And in response to that, the health community really has galvanized. As we've come to see greater and greater impacts from climate change around the world, just in these last few years especially, as they've ramped up with extreme weather events and whatnot, seeing the pandemic unfold and recognizing some of the many interconnections between human well-being and animal well-being and ecosystem well-being has really led the health professional community to be more and more willing and ready to step into a space of calling for action on these issues. So in the lead up to the UN climate negotiations, the health community rallied around a letter to prime ministers, heads of state, climate negotiators, calling for the kind of action we need to see on climate change. And this letter was signed by, I think many of you may already have heard this from me before, signed by organizations representing 45 million health professionals around the world. So that's around 2/3 to 3/4 of the health professionals globally. Those organizations are recognizing that it's essential for health to have a voice on these issues, that the health voice can help move the needle, that the health story is an important one to tell, both because of the impacts on health from climate change and other environmental issues, and because if we address things with health and equity in mind, if we look for solutions that proactively think about those things, those policy solutions are going to be more effective, deliver better results, and we're going to really get the kind of win-win solutions that we need. So I think my work has primarily focused on health professionals' roles in talking about climate change, addressing climate change. I think all of this very much applies to the issues that arise in One Health, where we're again seeing the impacts of those issues in things that are, walking into people's clinics. And again, health professionals recognize that they cannot be silent on these issues.
Jenny, and very well said. I think it's also time for us as health professionals to internalize the power that we have, and we recognize that we can, collectively get the people to move and move ourselves. More importantly, thank you, Jenny, for that wonderful intervention. With that, we will move on to our next panelist. I hope I say the name correctly, and I apologize in advance. It's Oan Quat. From Vietnam. She's the Executive Director of the Center for Supporting Community Development Initiatives and also a member of the Civil Society Engagement Mechanism in Universal Health Coverage 2030. And she is going to talk to us about the role of communities and how can we collectively strengthen communities that are at the front lines of these impacts. How can we strengthen them for One Health Action? Over to you, Oan.
Thank you very much. Greeting from Vietnam, everyone, and thank you for giving me the opportunity to share with you some of the perspective from civil society engagement mechanism for USC 2030. So CSEM is a civil society constituent of USC 2030. It is a global multi-stakeholder movement for universal health coverage. CSEM convenes civil society voice to ensure that USC policy are inclusive and equitable. We are a network of over 1,000 organizations around the world, and we believe that civil society have a vital role to play in achieving universal health coverage, and especially to ensure that no one is left behind. So we are often best placed to understand and amplify the needs of community and changing vulnerability on the ground. So when you talk about One Health and climate change, I think we can all agree that community are the first to know when a suspicious or unusual health events occur in the community. But not only that, the community can also be critical parts of the response through changing the behavior to prevent climate change, for example, or to participating in surveillance, in prevention and mitigation. However, whether or not and how much community can contribute depends whether relevant system in place, whether they are connected to the systems, and whether they are organized and capacitated to be able to collect information and provide timely and reliable reports. So we need public health systems capable to monitor unusual health events, and we need community systems that are organized, capacitated, and well connected to the public health system. On the other hand, the system will define how community react to unusual event or threats. During last 2 years, we have witnessed flow of people, millions and millions of people running away from COVID threats. So I will just share with you a few pictures that we see, all of us see all the time on television, from China to India, to Africa, and these pictures are from Vietnam, from my country, just recently. Hundreds of thousands of people running away from an epicenter. They run away. Millions of people from India doing the same. Millions of people from China. Hundreds of thousands of people from Africa. Mostly, noticeably, mostly from developing country, running away from the threats because people are fear for their life. People also fear for the fee of the healthcare in case that they fall ill of COVID. So they have to run away because universal health coverage is not there to provide them the security of health services when they need. And consequences of this movement in terms of economic, social, political, environmental must be huge. We haven't been able to calculate all these costs, and it keep accumulating, but we can anticipate that the cost is huge. So without universal health coverage, without health security, the whole society and the planet will have to pay. So impact of climate change on the planet and human and animal are are enormous. I live in Vietnam, one of the countries most affected by the rise of sea level due to climate change. I have seen with my own eyes vulnerable people become more vulnerable, displaced, be pushed further into poverty because their only livelihood is taken away as seawater invades river and spoils the soil. For these people, universal health coverage is needed for them more than ever because they are already deeper in poverty. So there are a lot of paper on association of climate change and zoonotic disease and their transmission to human. COVID is an example. It is a wake-up call. And we can all agree that community can and should be at the center of the response to the climate change of One Health and of universal health coverage. It is human activity that affect the climate. It is human behaviors that make zoonotic disease transmit to human. But it is also the human, the community that can educate, can advocate, can organize, can participate, and can hold accountable. But as much as health system need to be strengthened, political need to realize their commitment to universal health coverage. Community need to be invested in to build strong system so that we can be part of the holistic solution. Because everything starts and ends with community. So with community advocacy and participation, we can get to universal health coverage, we can have a One Health, we can address climate change. And I will end my talk here with to share with you that we at CSAM we have a Health for All advocacy toolkit that people can use to advocate for health for all, for universal health coverage. That community is at the center and leave no one behind. If we can get to USC, we can get to One Health, and we can work together for the environment, human, and animals' health. Thank you.
Thank you very much, Juan, and absolutely timely also. Like you very beautifully brought together the Agenda 2030 in many sense. Yes, we need to move now, but we know where we want to get. And I think the framework that Osman you outlined and also what you Juan outlined, I think this is a very good way of conceptualizing how to bring all the things. I mean, a lot of people are talking about it, but I think the main challenge is how do you operationalize this in practice, and cannot be achieved without putting communities front and center and putting health front and center of these discussions. So thank you very much for this absolutely rich discussion so far. I would quickly move on to the next two inputs, which are video recorded. And they will basically, both of them, so Josephine Okawera, she's the Director for Health and Social Services of the Ugandan Red Cross Society, and Nurista Agrestiana, she's representing the Indonesian Red Cross Society, and they're both going to share examples of how to operationalize the commitments that we are making to put communities front and center of the One Health UHC agenda. Over to you, Lasha.
Greetings to all of you from across the globe. My name is Dr. Josephine Okwera. I'm the Director for Health and Social Services at Uganda Red Cross Society. Uganda is home to more than 18,700 species of flora and fauna, including 53% of the world's mountain gorillas and 11% of the world's bird species. Uganda has a population of 40 million people, with about 66 of that population engaged in agriculture, out of which 58% were in agriculture, are also involved in livestock farming. The One Health concept is about 5 years old in Uganda, having been launched in 2016, where the National One Health platform to spearhead collaborative efforts among 4 government sectors. That is the Ministry of Health, Ministry of Agriculture, Animal Industry and Fisheries, Ministry of Water and Environment, and the Wildlife Authority was launched. The One Health Technical Working Group was also formed, and URCS is a member of this technical working group, besides other non-government organizations like the UN agencies, the US government agencies, academia, veterinary and medical associations, and research institutes, among others. Uganda Red Cross Society is a membership organization which was incorporated by an act of parliament in 1964 to be auxiliary to government in implementing life-saving interventions. We have a broad network of 51 branches and over 430,000 members. And these are community-based volunteers that enable us to provide last-mile interventions across the country. Our programming focuses on disaster risk management, health, WASH, livelihood, and climate change adaptation using all of society and community engagement and accountability approach. We focus on building the capacity of the community to prevent, detect, respond, and recover from disasters and disease outbreaks using the community-based surveillance model and the community engagement and accountability approach. The foundation of our community-based surveillance program, where most investment is put, is on community health promotion and risk reduction. We also support preparedness and response to outbreaks. Community-based surveillance is conducted by trained community members who are Red Cross volunteers. They are trained to identify signs and symptoms of epidemic-prone diseases, and once an alert is identified, the volunteer reports to the surveillance team and reacts appropriately with relevant information on control measures and first aid if needed. Interventions are conducted not only for humans, but also for the animal health and environmental health. Our volunteers support surveillance and mobilize their communities to vaccinate their domestic animals. We also have volunteers who support their communities to create awareness on environmental issues and also to improve sanitation. Our community engagement and accountability approach includes community participation and feedback mechanisms, providing correct and timely information, social and behavior change communication, and advocacy. We believe that when we meaningfully engage the communities and are accountable to them, it builds trust, making it easier for them to accept our interventions that can empower them and lead to resilience. So how does URCS meaningfully engage the community in its interventions? As a membership organization, we do have community members involved in URCS governance at central and branch levels. We also have volunteers who are community-based, who are trained to implement health interventions. We engage with the local civil societies and community-based organizations for collaborative implementation. We provide volunteers with the skills to be able to give information as aid to the last mile and to leave no one behind. We do social and behavior change communication activities, including the community dramas and mobile cinemas. Now, planetary health is an emerging concept defined as the health of human civilization and the state of the natural systems on which it depends. Planetary health calls urgent attention to the extensive degradation of our planet for human advancement. URCS is streamlining this concept in all programs by providing health literacy and other interventions that integrate communicable and non-communicable diseases, environmental awareness, and climate change adaptation. However, there are some challenges that we've experienced, and we do make certain recommendations. Human, animal, and environmental departments still work in silos, especially at the subnational and community levels. We recommend joint planning, budget, and a joint approach on digitalized surveillance systems, diagnosis, data sharing, and risk mitigation. There is shortage of trained human resources to implement an integrated program, so there is need for human resource development. The current achievements in Uganda have mainly been driven by external funding. Lack of emergency funds will result in delayed and slow response. We therefore recommend advocacy for government budget allocation, policies, and regulations. Community myths and misconceptions hinder progress towards the desired adaptations. This requires long-term investment to sustain community engagement and inclusion programs. Thank you for listening.
Lasha, do you want to play the second video as well?
Yes, sure.
Dear esteemed college, warm greeting from Indonesia. My name is Nurista Agastriana. I'm with Indonesian Red Cross or PMI, and I'm here to speak about the connection between One Health and climate change issues in Indonesia and how the PMI has contributed to solving the problems. Ladies and gentlemen, Indonesia is an archipelagic country with lots of beautiful island and culture. Its rich flora and fauna, diverse culture, and long coastal line offer beauty and many opportunities to its people and the world. However, this factor also presents many public health risks endorsed by the high number, dense population, and multiple border entries to the country. For example, the beautiful cultural ritual and wisdom, which include controlled hunting and consumption of wild animals in several places, might present zoonotic and risk for the local people. Indonesia has long acknowledged the importance of addressing this public health risk, not only from the perspective of human health, but also from animal health and environment, for one usually goes to term of One Health. The government has developed and implemented the mechanism of multi-sectoral coordination between stakeholders to tackle any potential public health threat. The coordination runs from national ministries to local government, private sector and organization, academicians, media, and the community. This platform was established and collaborate for intervention. Since 2018, PMI has taken an initiative to integrate community roles in the One Health platform in Indonesia through the Community Epidemic and Pandemic Preparedness Program (CP3), supported by IFRC and USAID. PMI raised community voices. We developed a system to engage community and be resilient when facing a health crisis, and we empower them to recognize and respond to the potential health threat, to report to the health authority and deliver health promotion as an immediate response and engage their peer to clean the environment, all while coordinating and working together with the local health office and animal health office. We train over 600 community volunteers that have capacity on pandemic and epidemic control and community-based surveillance to detect, report, and react to human and animal health risks in their environment. The training enables volunteers to conduct surveillance in their community to identify potential cases based on community case definition and allow them to report to the health facilities. The system covers a range of human and animal zoonotic diseases including dengue, leptospirosis, anthrax, rabies, avian flu, diphtheria, measles, and unusual events by human and animals, and also COVID-19. We evaluate this program in the middle of the year. We found that the community trained and provided with tools for epidemic pandemic control and community-based surveillance capacities were more prepared and adapt to respond to the event of health crisis during the COVID-19 pandemic. Importantly, acknowledging the effect of climate change, PMI and the community have also mitigated and adapted the factor in our program. The community volunteers have also been conducting several activities such as risk reduction, health promotion from the natural and non-natural hazard, and also community health risk mapping for not only for the non-natural hazard but also the natural hazard such as floods, landslide, earthquake, and so on. The global health crisis is caused by the imbalance of interaction with animal and human and also environment. Resilience will be required to recover and come back stronger than before. What we can do now, our action have the potential to impact human health, animal health, and the environmental health. The simple steps that we can take to raise community awareness on this issue will help us to avoid a health crisis, mitigate the effect of climate change, and prevent future infectious disease and zoonotic disease. Finally, climate change is not the future. It is here, it is now. Therefore, we must act now. Terima kasih.
Fabulous. I think the last three speakers have really highlighted very, very well how we can harness the strength of communities in sensing how the hazards are evolving, how the impacts are evolving, but also how the ability of the communities is evolving and improving to respond to these. And I really like the word last mile approach. I would also call it the first mile approach, because that's also the way that we can put it together. And I think another aspect that came out was the funding part. You know, it's not just about coordination of the actors and everything, but also mobilizing funds in time. And I think that the Red Cross really advocates for early anticipatory action, and how can we then, you know, strengthen the communities to really do the action that is needed. So thank you very much for those three inputs, which brings me to the final input of the panel today. Mercedes Aguirre, she's the coordinator of the Disaster Risk Reduction unit at French Red Cross, and she is going to talk also about the same aspects about operationalizing One Health and climate change at the community level. Over to you, Mercedes.
Hello, thank you very much. So it's correctly shared?
Yes, I think we can see the screen, yeah.
Great. So, well, thank you very much. I'm very pleased to be part of this panel today and to share with you the perspective of the French Red Cross in this subject. So the presentation, as you correctly mentioned, is going to be about advocacy and operationalization of One Health. So at the French Red Cross, we had been implementing health and climate change project for many years now. But it was in 2019, actually, that we realized that this issue was still not getting the needed attention. So I don't know if you had the chance to read one of the latest report of WHO, where they are mentioning about the health argument for climate action, that actually they're mentioning and state that health is the sector where demands for climate support most frequently are left unmet, and less than 0.5% of multilateral climate finance is allocated to health. So these facts actually motivate us to organize on 2019 a global conference about this subject. And we gather over 500 participants from different countries, actually from more than 70 countries in the world. And soon after, we produced a document called Health and Climate Change, Taking Care of Humankind at More Than 2 degrees Celsius. That this document that you can find in the link that I'm showing on the slide, and I will share with you afterwards in the chat. It's actually a brief document about the discussion that we held during this conference, and we're sharing concrete actions, good practices, and recommendations to address this subject. So this report has been recently done their second version in April, and it's not a research report, but it's primarily intended to be educational, so it concerns everyone. What you're going to see in this report actually is we established 8 challenges. I'm not going to go into details, but what I wanted to show actually is that even at the moment at the French Red Cross, we're not implementing very specific project in One Health, but all our actions and activities actually considers all the dimension of One Health. So as you can see, for example, in the last challenge, the number 8, that is protecting ecosystem to promote health, we make a specific recommendation regarding the building community resilience through a multidisciplinary and multisectoral One Health approach should be done. And this means actually considering human, animal, and ecosystem health as a whole. At the very end of the report, you will also find our 9 recommendations, and you can also see that we make a specific attention in the second one that we are mentioning the One Health approach as well, and we mentioned that we have one only Earth, and those we have one only health. So our approach actually is in line with the One Health approach. How is this, how we're doing this, how we're moving forward? So it is of primary importance, as I already mentioned, the multidisciplinary and the multi-sectoral collaboration. So this means like complementarily between humanitarian operation, research institution, private sector, authorities and civil society, who can make actually possible to achieve significant improvements in terms of prevention, surveillance, detection and response, as our previous panelists already specified. So we also encourage to look for local collaboration. We try that our actions to be as local as possible. As an example of this, we have implemented a project in the Guyana Shield that was called Rampart Project Vector Control. And actually in this, that is in the north of South America, we were looking there, I mean, the aim of this project was to reduce the impact of epidemics, but mobilizing regional cooperation. And this regional cooperation was the combination of regional technical expertise and communication level actions. So we're trying to look for this complementarity between disciplines and sectors. So our programs are also based in another pillar that is very typical in civil society and mostly in the Red Crescent movement, that is the community-based approach. So communities normally are the first to be impacted and not sufficiently involved in epidemic control strategies. So empowering, as our previous speaker from the Indonesian Red Cross and the Uganda Red Cross just mentioned, is empowering communities to adequately prevent, detect and respond to the various diseases that might affect them. And finally, the other pillar is the health system reinforcement that goes in a trade collaboration with the community-based approach. They are actually couple each other. So with this, I mean to invest in climate resilient health systems so they can anticipate the onset of diseases and carry out preventive and curative interventions. I would like to finalize with a phrase that actually was given by the head of WHO Climate Change Unit during the Global Conference in 2019. And he said that the Red Cross and the Red Crescent movement has crucial role to play in increasing the resilience of population and health systems with regard to climate change effects. So this reinforces what our other speakers said that we need to empower our communities and volunteers to respond to health threat of any kind. Thank you very much.
Thank you so much, Mercedes, and I think this is a fantastic conclusion to this wonderful inputs that the panelists have. Before we move into the question and answers, is that keep the 1.5 ambition alive, because half a degree of concern, even 2 degrees, will be way too much for us to lead. Prioritize locally led adaptation, focus on the technical capacity, but also look at health systems and how can you strengthen community health systems to scale up action on One Health, on universal health coverage and climate change. So thank you all the panelists, and now I open the floor for questions. I think probably we can take, I can't see the online system, Lasha, but do you have any questions online that people have raised which you want to read out, if you don't mind?
Not yet. We have made basically the comment, and thanks for all for sharing different tools, advocacy tools, and also health for all tools.
Okay, then I think probably while we wait for people to put questions online, is there any question in the room? Yes, over to you.
Thank you. So, hi, my name is Jacob. I'm with the RC Psych. I was just wondering if you could help me better understand how One Health interfaces with ecosystem services as a framework, which I think, I'm not quite sure of its history, but it comes, I think, from perhaps how finance is hoping to approach the kind of thorny question of how to put a value to nature, but equally also how this sort of interfaces with the SDGs more widely. And it's sort of really exciting to have another framework which helps kind of bring together the kind of complexity of health. But I suppose, in summary, sort of SDGs, ecosystem services, and One Health, and how do those work together, and how do you think about them together?
Who would like to take this complex question? Do you want to go? Do you want to give it a try, Jenny, first?
It's a little bit outside of my core competency, but so I'm not going to be able to speak to it in detail. I can just respond by saying I find it really exciting when we start to bring these conversations together. I think each slightly different framing adds something to our understanding about these issues. So I see them more than, it's not quite right to say that they're complementary, because in some cases they're quite overlapping, but the slightly different frame in every case adds a little bit to the conversation. So I'm not in-depth familiar with any of those. I can't respond in detail to the question, but I think the conversations are really dynamic, fantastic conversations to be having, which is, this panel is really fantastic for that.
Thank you, Jenny. I think, Osman, do you want to give it a try, and then we can move to another question from the room?
So specifically on ecosystem services, I think at the global level, obviously UNEP, the UN Environmental Program, is now strongly engaged in discussions around One Health and how ecosystem services and management relates to both the health protection elements of it, so preventing and controlling infectious diseases, but also some of the advocacy, health promotion, health improvement elements. And I think a really good example of something tangible to use is industrial sort of land use change projects. Now these are often huge infrastructure projects where there are huge implications for ecosystem services. So environmental impact assessment is a mandatory part of the process. So say you're building a huge new dam, you have to have an environmental impact assessment around the dam and its implications. But what we're sort of starting to move towards is having one health impact assessment. So you're not only assessing the environmental impact, you're also assessing health and social impacts, and that is part and parcel of preventing or mitigating some of the damaging effects. So typically, you would say with a dam, for example, if there's schistosomiasis in the area, you'd expect once the dam's built that schistosomiasis would increase in the communities that are living around the dam. That wouldn't have normally been addressed through an environmental impact assessment. But when you start approaching it with this One Health perspective, you start thinking about those things at the a priori stage. So I hope that sort of gives you a flavor of how it works.
Okay, thank you, Dr. Lin. Yeah, I'm very happy that the One Health issue was gradually emphasized and accepted by the healthcare communities. But I know that for the younger generation, involve of the younger generation, like medical school students or nurses, is also very important to increase the awareness. But I don't know if do you have any experience, or because the medical curriculum is quite impact, so they need to study a lot of curriculum like pathology, internal medicine, whatsoever. But as far as I know, not yet this kind of issue put into the medical curriculum. Do you have this kind of information, or how do we do that? Thank you.
Jenny, I think this is straight up your alley.
Very much so. Yeah, that is something that I can speak to. You're quite right. These issues are not yet well built into the medical school curriculum, the nursing curriculum, any of the other health professional curricula. There are efforts to do that. There are a number of people who are working on that. It's quite tricky, as I'm sure you can imagine. The medical curriculum, the nursing curriculum, they're already quite full with many things that have to be covered and that have to prepare medical students, nursing students to, receive the qualifications that they need in order to practice. And so some of the strategies for embedding these health issues or these other types of issues into those curricula include thinking about how you actually make it part of the existing curriculum rather than standalone separate issues. And I think there are people doing, quite good work in thinking that through, but there's a tremendous amount of work still to be done to actually make that happen. The International Federation of Medical Students Associations has been pushing for a few years now to get climate change embedded in the medical curriculum. There's an organization called, I'm not gonna get the name right, the Global Consortium of, it's at Columbia University, that kind of has a clearinghouse of information that is specifically focused on how this can be done and examples of how it's been done. But it's an extremely important issue because health professionals will be seeing these issues in their patients, and they do need to be prepared, and in the communities if they're public health professionals. So there's work being done, but we need a big push, and it needs a lot of support to actually get that to happen in those schools of health.
Yeah, and just to add to that, I mean, it's also that the students are increasingly demanding that they be trained on topics like these. So I think we've seen that also in the UK. So it's a positive move. And I think I would also like to bring Owen Quat. If you would like to reflect on this question, that how do you bring volunteers, for example, the capacity strengthening of Red Cross, Red Crescent volunteer workforce for One Health understanding? Would you want to reflect on that?
No, but I would like to reflect on previous question about SDG and also the question about health professional and clinician. I am a doctor by training, actually. I spent a couple of years working in the hospital before I left to work for public health and for community. And I think actually One Health is really at the center of SDG. If you think about it, and if you want to educate a medical student and medical professional, it is just show them the 17 SDG and let them think how to help link to all these elements. Just an example of a person, if a patient walk in your clinic, the patient can be extremely poor, cannot afford to pay for the clinical fee, except if she have to sell something, she have to or stop sending the children to school. Then you can, if you spend time talking to the patient, you will recognize that she cannot afford some of what we often call environmental friendly practice. She cannot afford to go green, to work organic, to eat organic food, or to afford organic agriculture. So there's all these links, and she have to use pesticide and so on, so that she have money to pay for medical care. So so you see this link, and you can see the link, like if a person doesn't have a documentation, don't have an identification card, don't have a document as a right document as a migrant, then the person will need to spend more for healthcare, may not be covered under that particular country universal health coverage, and then they have to do many things that may be harmful to the environment, may further transmit communicable disease because of for their living and because of their poverty. And then there's thing to link with education, link with the gender. I mean, you just organize a small seminar with the student or the medical professional, and you will see the link with One Health and with 17 SDG.
Thank you very much. And we have 2 more minutes. I don't know if there are any other questions. Yeah, one more. This is probably the last question that we take.
1 minute actually, and then it's okay. Talking about Red Cross, Red Crescent volunteers, so I think we had the clear demonstration, the value and opportunity and the work the volunteers are doing, and also we had the long discussions, a series of discussions, I think with Jenny also, so that okay, when we are talking about professionals, health professionals, so it's not really only the medical doctors or laboratory technicians, but all includes should include or closely linked to the community health workers and volunteers. So I think so. Then we should take this in this entire context.
Wider
And
view, yeah.
yes, wider view, and then we
Thanks.
can see we could see how so what an impact it has on community from the Uganda or Tunisia, and also from the.
Thank you, Lasha. Thank you for that input. And the last question for today, over to you.
Yeah, I'll try to be very quick. So I'm Mark Davis from the Faculty of Public Health in the UK. I just had a very quick question, just followed on from Jenny's comments really about the importance of mobilising the health community and health professionals. I just wanted to ask if you reframe that as mobilising the One Health community and One Health professionals, and thinking about veterinary professionals, environmental health professionals, just your reflections really on what that means. Does that change how we approach that community? And just your reflections on that really. Thanks.
Yeah, certainly. The letter that I referenced in my remarks that was signed by the health community worldwide, when we went out for signatures on that letter, we actually opened it up very broadly to the health community, including the full spectrum of folks working on health, because I firmly believe that the entire spectrum of the health community is needed to address these issues. And one of my work prior to being at the Global Climate and Health Alliance is as a in the public health field. One of the things that I've always loved about working in public health is that it requires professionals and workers from many different disciplines and many different strands to get the job of health done. And I think that can very much be extrapolated to thinking about a One Health frame. So yes, indeed, we do all need to mobilize in calling for the things that need to happen to protect people's health in these arenas. So thank you for that question.
Fabulous. So that brings us to the end of this fabulous panel. I would like to first of all thank you all in the room, because I think it is very difficult to listen to somebody we are sitting here in front of you, difficulties. Thank you for your patience with us. I think that was really good, and this panel wouldn't have been successful without the organizers and the panelists Osman, Jenny, Oan, Josephine, Norista, and Mercedes. Thanks a lot, and enjoy the rest of your COP journey.
Yes? Yeah, it's fine. Thank you. So we're going to start now this new event from 5 to 6. It's going to be a new guide to unlock business action on air pollution, explaining the guide and its benefits. I just wanted to state that today at 1 p.m. we launched the Alliance for Clean Air at 11 a.m. Sorry, I'm losing track of time, and 11:30 even. And it was with 10 companies that actually committed to measuring their air pollution footprint and including this in the way that they report. And this is done in a context of a new collaboration between the Climate and Clean Air Coalition, the Stockholm Environment Institute, and IKEA. And it comes at a great moment because we have new updated guidelines from the WHO on air pollution, which show that most cities in the world, probably 95% or more, do not meet these guidelines, and there's much more to do. We're doing this in the context, for the first time in 16 years, in which we have a world committed to net zero by 2050, but we have nowhere near the ambition in air pollution mitigation, and we got to catch up. The EU itself, UK, all have annual average standards that are actually exceed the WHO standards by 4, which means that we're allowing people to die and not reducing preventable non-communicable disease. Around 40% of cancers from lung cancers come from air pollution. Around 50% of EPOC-type deaths also. So it's something we need to stop ignoring. And so the panel today includes a set of members. Sarah, first off, Climate and Clean Air Task Force, also a CCAC board member. And we're going to hear about her work and how the CCAC supporting this work. Also, we're going to have Andres Arens from IKEA Group. He is the head of climate in IKEA. And this all started, and he would probably say, from a nice conversation. That's where all the deals come, either with a beer or with a coffee. And so I think that's really great. And also another suspect, another person that's involved, Chris Malley from Stockholm Environment Institute. So I just want to kick off the discussion because it's, sometimes, I don't know if you've seen some ladies protest with a shirt that says, "I can't believe I have to protest for this crap." Well, essentially, this goes with air pollution. I can't believe we still have to talk about why we should include air pollution in climate mitigation. So I just wanted to ask you off the bat, why do we need to include air pollution on climate action?
Oh, Marcelo, what a very good leading question, and it's such a pleasure to be with all of these esteemed speakers today. I focus on efforts to reduce short-lived, potent climate pollutants like methane and black carbon, which tend to have an outsized impact on our health, but are also fueling climate change. Methane alone is responsible for about half of the net warming that the planet is experiencing today. And it's also an ozone precursor, ozone, of course, being toxic to our lungs and toxic to crops, plant material, black carbon being a deadly killer. And so often these pollutants are released alongside carbon dioxide or from similar sources and sectors. The business community has focused largely on estimating its CO2 footprint and mitigation opportunities, but there's been less focus on the criteria air pollutants or these other gases and noxious compounds that harm our health. So I was thrilled to learn about and through the CCAC help support the creation of the new tool that we'll be discussing today to help businesses assess the extent to which their operations are polluting the air beyond CO2, beyond the greenhouse gas that we all are so familiar with. And in doing so, lay a foundation for mitigation, for reduction of that pollution.
Mm-hmm. And so then, we have multiple commitments on net zero from the private sector, from countries. Why is it important that businesses need to take action overall in air pollution? Are there opportunities that are missing? Are there synergies that we could find? Why should they be interested in doing this?
Absolutely. Well, you laid out the health case very well, Marcelo, and in terms of the extent to which this pollution is killing people around the world. A recent study by the Climate and Clean Air Coalition, on which I serve on the board, found that reducing methane pollution could save more than 250,000 lives every year, just because of the ozone benefits, reducing the ozone pollution around the world, not even factoring in all of the volatile organic compounds and hazardous air pollutants like benzene and formaldehyde that cause cancer that are so often released alongside it. And that's, I think, the key theme here is when businesses and governments take action to reduce their climate footprint, their CO2 emissions, their methane emissions, there are often co-benefits of doing that should be accounted for and should be extra impetus for fast action.
And I just want to make some examples under which when we incorporate air pollution, what sustainable changes. Diesel vehicles, great CO2 emissions, horrible NOx and PM and black carbon emissions, and probably not the most sustainable way of transportation. Second, wood burning. Carbon neutral, not so much when you incorporate black carbon and also deforestation. And of course, even biofuels. I remember I did a paper on biofuels in Brazil. So it seemed to be better for the climate because it came from the bagasse and you didn't have a lot of fossil fuel input like the Iowa ethanol. Yet the biomass burning put that all to rest and actually was much worse in terms of health impacts.
Those are such good examples, Marcelo, and there are solutions that could help us address them. For instance, on the vehicle side, right, we can electrify vehicles. If needed for the heavy transportation, we can move to zero-emitting fuels like green hydrogen, but all of it really needs to be addressed.
And also, when you do include both, you leverage higher impacts as you do, for example, with carbon pricing. You put a carbon price, there's a paper out that came out in MIT, Noel Celine wrote it, and she said, basically if you put a higher price on pollution, you leverage billions of dollars in health benefits in China because you offset and reduce the emissions from coal. So I'm going to move it over to just one second, to Andreas Adens from IKEA Group. You have a whole bunch of very, trailblazing sustainability tools in which you assess your products. But now you're including air pollution. Could you tell us, show us, I think you have a presentation, right? Or on greenhouse gas emissions and how this is tracked.
Yeah, I think first we're going to have a session by Chris explaining the guidance.
Oh, there we go.
And I come in as a good example towards the end.
There we go. Okay, we'll go with Chris then.
Thank you very much. My name is Chris Marley. I work for the Stockholm Environment Institute, and I just want to start by adding to what Marcelo and Sarah have said about the opportunity of taking action on air pollution together with climate change. Next slide, please. This is my favorite slide to provide the argument as to why we should look at air pollution and climate change together. It comes from a 2018 study by the European Commission Joint Research Centre, who looked at all of the NDCs submitted in 2015 and assessed the extent to which they could simultaneously reduce air pollutant emissions. And they found that by 2050, 400,000 premature deaths could be avoided because of the improvements in outdoor air pollution from implementing climate change commitments. But that's not all. They also looked at what would happen if commitments were increased to be consistent with the Paris Agreement goal of 2 degrees of warming, which today research in Australia has suggested that we're now under. And they estimated that the health dividend, the health benefits from meeting the goals of the Paris Agreement, 2 degrees, never mind 1.5 degrees, more than double. We get double the health benefit. We get over 1 million premature deaths avoided by 2050 if we can implement the Paris Agreement. So there's this really strong link between taking action on climate change and getting air pollution benefits alongside it. Next slide, please. In terms of the contribution that businesses make to air pollution, we have a large fraction of the emissions of air pollutants coming from activities that business participate in. I can't see the percentages, but a large fraction of the transport sector emissions of particulate matter and NOx are associated with the transport of freight. In buildings and industry, we also have large contributions to particulate matter emissions, to emissions of nitrogen oxides. And what this means is that the health benefits of air pollution are to a large extent determined by the activities of businesses. There was a study in Nature in 2017 that assessed the impacts of international trade on air pollution. And they concluded that 700,000 premature deaths per year were associated with the air pollutant emissions of a product, of the production of a product that was consumed in a different region to where it was produced. So consuming products and services in Europe is causing air pollutant emissions in Asia, for example. And that international trade is resulting in a very large health burden because of the air pollutants associated with it. Next slide, please. So having identified that there's a problem and there's a large health burden from air pollution, what do people do about it? For national governments, they develop an emission inventory as the fundamental building block of air quality management. The European Monitoring and Evaluation Programme produces an air pollutant emission inventory guidance so that there is a consistent way for countries to estimate the contribution of different sources to air pollutant emissions. In the United States, the US EPA has their air pollution management cycle. A fundamental part of it is understanding the contribution of different sources to emissions and what the reduction potential is from different sources. Next slide, please. This has parallels for greenhouse gases in business. We have the greenhouse gas protocol, which provides a consistent way for businesses to estimate their greenhouse gas emissions. Next slide, please. But unfortunately, we have a gap. We don't have a corresponding air pollutant emission inventory guidance that businesses can use to get an understanding of the contribution of different parts of their value chain to health-damaging air pollutants in the same way that we do have for national and subnational governments. And that's what the Stockholm Environment Institute, the Climate and Clean Air Coalition, and IKEA came together to try and fill this gap. Next slide, please. And the reason that we wanted to fill that gap is because there is a large opportunity if we can link air pollution and greenhouse gas emission inventories together. We've seen that from countries in their NDC updates. For example, in the UK, they state that the 68% reduction in greenhouse gas emissions will be achieved in a way that achieves health benefits from reducing air pollution. If we can estimate our air pollutant and greenhouse gas emissions together, we can identify those strategies that have health and climate change benefits, as Sarah and Marcelo said at the beginning. Next slide, please. So it's for this reason that the CCAC, IKEA and SEI came together to try and develop a guidance that would allow companies to do the same thing that we've seen in some nationally determined contributions and climate change plans, to identify those strategies that can be taken across their value chains that have multiple benefits for climate change and air pollution mitigation. Next slide, please. We are very pleased that at 11 a.m. today we launched this guide, and we would be now really interested to work with companies and businesses and others who are interested in applying it. We're going to have a 6-month review and application process where we test this guide with different diverse types of businesses to make sure that it is appropriate and can be applied with businesses with very different value chains. Because I work for a university, I have no business acumen, so after we've gone through that review process, we will be distributing it for free. The purpose of this effort is so that all businesses can look at their greenhouse gas and air pollutant emissions together, so there's no charge for this. Next slide, please. The greenhouse gas protocol and other guidance for businesses covers the right-hand side of this slide. It covers the greenhouse gases and methane and hydrofluorocarbons. It doesn't cover the left-hand side of the slide. It doesn't cover the air pollutants and black carbon. They're the pollutants that are covered within the guide that we have been developing. Next slide, please. There are two main components to this guide. The scope of the guide is to provide businesses with a way of looking at emissions across their value chain. So the first part of the guide aims to provide a process, provide a framework by which businesses can map the different sources of air pollutants that are occurring across their value chain. So we have this 6-step process in which we map the value chain, identify what sources might be there, and then identify the most appropriate methodologies that are available to quantify the air pollutant emissions from those different points within the value chain. And I should point out here that many businesses may already have done some of these steps as part of their greenhouse gas accounting, in which case we try and make it easy to then integrate the air pollutant emissions into that existing system and existing work that has been done. The aim here is to try and make the development of, or the addition of air pollutant emissions as easy as possible. Next slide, please. The second part of the guide, which you may struggle to make out on this slide, is then providing the source-specific methodologies that will allow businesses to estimate the emissions across their value chain. The guide includes 6 major sources of air pollutants within it. It includes, next slide please, it includes the electricity generation from electricity consumption by businesses. It includes the stationary fuel combustion, so burning diesel, fuel oil, kerosene, gasoline, biomass within operations within the value chain. It includes transport, both freight transport to distribute goods and services, but also passenger travel, customer travel, and mobile machinery in construction or in agriculture. It includes industrial process emissions. It includes emissions from agriculture and emissions from waste at the end of products' life. Taken together, these 6 sources cover more than 98% of global air pollutant emissions, of pollutants like particulate matter, black carbon, nitrogen oxides. Over 98% of emissions globally are covered by these 6 sources. I said that the guide tries to make it easy for companies to add in these air pollutant emissions into their existing greenhouse gas tracking systems if they're available. And for this reason, we've specified different tiers of methods by which you can quantify air pollutant emissions. The most simple methods allow you to just add an additional pollutant into your greenhouse gas monitoring system using the same methodology. But we also have more detailed methodologies if a company is interested in doing a deep dive into a particular sector where it might be particularly important. And an example of this is in the transport sector. To estimate greenhouse gas emissions, to estimate emissions of carbon dioxide, we're generally only interested in how much fuel is consumed by our lorries and trucks, for example. But for the emissions of air pollutants, we also care if they're using fossil fuels. Hopefully in the future we'll have all our lorries powered by green hydrogen. But while they're using gasoline and diesel, we also care what Euro standard or what vehicle emission standard they meet. And so we provide those more detailed methodologies so that we can get specific estimates of air pollutants where the methodology differs from greenhouse gases. Next slide, please. So our next step is to have a first draft of this guide ready by the end of November, and then, like I say, go through a 6-month review and application process in which we would encourage any business interested in piloting or reviewing this guide to get in contact with us. We'd be really happy to share an advanced copy of this guide with you. Once we've been through that process, we will then revise it based on that feedback to make sure that it's appropriate for a diverse range of businesses before we finalize and release it in the middle of 2022. Next slide, please. Thank you very much, and feel free to get in contact if you would like to pilot this guide. Thank you.
Thank you, Chris. That was great. And I just wanted to mention that this thing is really important because companies always have to report I said it before in the morning, different regulators, different formats, different time frames, and sometimes we miss opportunities. And I just wanted to state that when we put it together in Chile, the emissions power standard, right? We were thinking power plant emission standard. We thought it was great, and I remember I asked the superintendent, so how are we doing with the standard? Is it being met? And it's like, yes. Okay, so what are the emissions? No, so he shows me a table. It shows this company doesn't meet, because was it under or over 30 milligrams per cubic meter? They weren't measuring the flow to see what the emissions were. So that goes to show that there's that disconnection. The guys were bean counters, lawyers, many of them, and they just wanted to see they meet or not the standard. So therefore, we need to streamline these methods so they're useful for all the multiple reasons why we need them. And that's why I think the job that IKEA is doing in working with the value chain and working in different multiple indicators that always want to be improving is really important. So I just wanted to hear a little bit more in detail, Andreas, how that's going.
Sure thing. Thank you, Chris, for a great presentation of the standard. I think it's been amazing work done by the Stockholm Environmental Institute and the Clean Air Coalition, Climate and Clean Air Coalition, sorry. So it's really wonderful what we've done. And as you said before, this all started with a cup of coffee 2 years ago in Madrid. And that was maybe the best coffee I had during that meeting as well. Because, I mean, all of us companies, we measure so many greenhouse gas emissions. We have great data for quantifying the footprint. And within IKEA, we're wondering, but couldn't we also use this data to measure our impact on air pollutants? So air quality is a bit different because it depends on where you emit it and so on. But at least how much harm we're generating, at least, then we can start from there. And we had a call with Nathan Borfeld at UNEP, who's part of the Climate and Clean Air Coalition. And within half an hour, I think we were very efficient and just come back. We need to do something. And what we see now is the outcome of that cup of coffee, of a great teamwork. So I'm just so amazed that we're here today. But okay, but what does it mean for a company as IKEA? So next slide. I mean, we are all about furniture, so this chair really represents all that we're about. But if you need to have this chair, you need to manufacture it, right? So of course, then you require energy. And depending if it's fossil fuel or not, and if it's electrified process or not, it really has an impact how much air pollutants you're causing. It's not just the greenhouse gas emissions. And today at IKEA, we measure this on each supplier level and their energy breakdown. But of course, we also need to transport it. You as our customers, you should go to the store, and depending on what type of car you have, there will be more or less emissions connected to it, or none if it's a zero-emission vehicle. Or we transport home to your place with our last miles, as well as from our suppliers to the stores. Also the materials as well, which materials it is, and what are the sources. If it's steel, a lot of coke and coal still today. But of course, as we also move into fossil-free steel, we will also eliminate not just the climate footprint to a large degree, but also the air pollutants as well. And then finally, we hope you love our chairs that we sell, but so you repair them, you reuse them, you refurbish them, you repaint them, you maybe give them to a sibling or your sons and daughters. But in the end, the chair will die. And when it dies, if it's not recycled, it will be incinerated or end up on landfill, also causing air pollutants as well. So we have a huge impact on air pollutants within IKEA, and it's time that we actually start to measure this to take our responsibility to actually eliminate these air pollutants as well. And in addition to chairs, we also sell meatballs. So it's also about the agricultural practices that we have in place within our supply chain as well, also generating air pollutants. So we have lots to do here. So that's why I'm happy that we have this standard as well, because now we actually can get to work. Next slide. And when we start quantifying it, I mean, this is our climate footprint. You see, half of it is in materials, so that's the raw material extraction and all the processing until it's a material which becomes a furniture. We see the second biggest one is the use at home. It's electricity that our customers are using to power the LED bulbs or the appliances they buy from IKEA. So for this, it's fairly easy, within quotation marks, to measure today, because there is the standard, as Chris was onto. We have a greenhouse gas protocol, and we have emission factors from say, the International Energy Agency, or what is the CO2 footprint from bought electricity. And we know exactly where we need to be in 2030. We need to at least halve our emissions by 2030, and that is for the total value chain if we want to stay in line with 1.5. And by 2050, we need to reach net zero at the latest. So we have a clear roadmap in place when it comes to climate. Not that we have all solutions in place. There are still gaps, but this is where we need to all work together to find those solutions. But for air pollutants, we don't have that today. And that's a bit the reason that we had as well. We need to get some type of guidance in place so we can also quantify this. So how can we have a similar picture like this, but for air pollutants as well, and really see how can we truly try to eliminate air pollutants as much as possible? So next slide. And then, when it comes to the main drivers to actually drastically reduce our greenhouse gas emissions, we know that we need to strive towards 100% renewable energy, where electrification and zero emission fuels are a key part. We also know that we need to work with materials with a lower climate footprint, the same as with food ingredients with a lower climate footprint, such as plant-based food, so less cows with their farts and burps. We also have to have transform into a circular business model, where instead of just selling new products, we can also find profit from reselling, reusing, refurbishing, etc. of our business model, and also get profit from that. And finally, removing and storing carbon as well through better forest management practices. So we have a lot of main movements going on in climate, but then how does that contribute to then cleaner air? We know that electrification is of course important as part of a way to eliminate greenhouse gas emissions, also away from livestock, and how we also reduce fertilization within agriculture. But what does it concretely mean? What is the impact? Not just the watts, but actually the amount. That is where we need to go. So next slide. And then as well, as the end, how can we actually contribute to actively reducing air pollutants as well, at the same time as us limiting climate change to 1.5? This is where we need to go. And what I'll try to explain today is a bit more in concrete what it means for us as a company, not just on a high level here, but go through the different parts of our value chain, because it's not just our stores and what we call the scope 1 and 2 emissions. We have huge opportunities all across our supply chain and value chain to do something about it. Next slide. So really, in essence, this guidance helps companies to quantify the air pollutants that's generated all across the value chain. And simply put, what gets measured gets done. That is the whole emphasis of this standard as well. So let's start measuring and let's get to action. So if we take the next part of our value chain, the first one. So next slide. So, of course, if you're buying something at IKEA, the first step that you need to take is you need to go to the store. So of course, how can we enable that? And within IKEA, we push a lot for charging stations as well. So we can actually promote customers going to us with electrified vehicles. This is a small part, but it's an important part. And here we can also stimulate the use of electric vehicles or zero-emission vehicles throughout society as well. And we know today, or we need to become actually a bit better, because here it's a bit tricky with customer travel actually, to be a bit honest, to measure the impact, because we cannot track every car that's going to the store. Then I think it's a bit of a GDPR issue. But we have a good understanding at least of the traffic flows as well. We also know where our stores are located and so on, so we have a huge part here to look into it, and we have that data. Next one. And we also can send products back to our customers' homes as well. So if you cannot take it home, we also have trucks going home. And here we have full control. We know, since this is our suppliers, we know which type of trucks are going home. Which Euro standard is, are we using diesel or is it zero-emission vehicle? So we can quantify this from the climate footprint. So we have all of the information at hand with this new standard to also measure how much air pollutants is actually generated by this, and also where it is. And also, is it in densely populated areas or not? Because that also has a higher impact on people's health. Next one. What's even bigger footprint, it's also how we transport our products from our suppliers to the warehouses and stores. So it's both ocean shipping, but also the land transports as well. And in order for us to measure our climate footprint today, we need to know what is the fuel used for each shipment done within IKEA. So here we work together, we ask our suppliers, what type of ships are you using, what type of trucks are you using, how many kilometers did you drive, what type of Euro standard are you using, etc. So once again, we have all of this information at hand for the different fuel consumptions to measure the climate footprint, and thus also how much air pollutants we will also cause from this one. So maybe you already sense a theme here, that we have most of the things in place. And I think that's also key here, that, I mean, I know how trouble it is to get climate reporting and sustainability reporting in place. So let's not make it so more difficult for us. Let's make it easy for us to have a more holistic agenda. And that's like the essence of a standard as well. Let's use what's in place, and then we can measure and get a more holistic agenda. And as we continue, if we take the next slide, we can also see, I mean, what is the impact of production as well? So as how we manufacture our products at IKEA. So it's of course both the electricity that's sourced in manufacturing today. Is it coming from coal? Is it coming from wind power? But it's also, what are we using, diesel or coal, or all natural gas as well. So we have all of this information down on an invoice level at our direct suppliers. And then we can see what's the impact as we then transition to 100% renewable energy, as well as striving towards electrification, and of course improving energy efficiency. So once again, we have all of this information. And if the factory is close to a high populated area, then of course it's once again a higher priority, because this is also a local challenge. Climate, I think it's easier from a perspective that we can always increase it a bit somewhere in the world and reduce it somewhere else, because it's a global emission that has a global impact. All of this is local as well, so it also puts a lot of pressure on us, like where is this emitted as well? But it almost comes as the next step. But this is also a local question. Next slide. So these are ways previously how we could reduce it from the outdoor air pollution, from transports, production, material sourcing, etc., as well as agriculture management practices. But of course, still, as I said, it's all about a chair, but it's also about home furnishing as well. So even if, as we're launching this standard today and inviting all of you to join in the pilot, we as a company as IKEA also, of course, have another aspect that we can work with clean air, and it's, of course, the solutions you have at home to also purify the air. Well, we know that a lot or most of air pollution in a home actually comes from outside as well. So, but here, as a home furnishing company, we have a solution or an ability as well to also clean air indoors as well. So it's key to also not forget about that part. Next slide. So I hope, I mean, this is our climate footprint at IKEA, how it looked financial year 2020. In February, we'll update it for 2021. But I hope in a similar way as we can quantify this today, with this new standard, all company reports can have a similar breakdown. This is how our air pollutants come and where they come from, how big they are. And this also becomes a mandatory, or like almost like a common behavior of all companies to disclose, just like we disclose greenhouse gas emissions. So that's also key. Like, as you join us, make sure that you test it out, that it becomes simple, and join us to create that this will be the new norm for transparency and reporting. This would be great. And then we see that how it just like reduces for each year, step by step, really enabling clean air for the many people. So it's not just a luxury for a few. So, next slide. So what we will do, okay, we need to finish COP26 first, I think, get some rest. But after that, what we will get going at IKEA is really to set a baseline. That is the key, because we have all the facts, we have a standard, so we need to just set the standard. The next one is, since we have a fairly ambitious climate agenda at least, we need to also check what is the impact of the existing actions we have in place. So don't reinvent the wheel, check what you already have in the pipeline, and then with the standard you can see what is the impact of that one. And then you would get some kind of gap analysis. So where do you want to go? And what is remaining? What different additional actions do you need to take? Maybe it also costs you to revise your climate agenda as you're now working more holistically, addressing both climate and clean air as well. Fantastic. So this is what we will be part. And as I said, we also launched today Clean Air Alliance as well, where we're also pushing for companies to set a baseline and set goals and become a champion for clean air as well. So you can also join that one as well. So a lot of great initiatives launched today for all of you to join. Next slide. So But as we say at IKEA, most things remain to be done. But let's at least do it together, so that we pilot this, try it out, and help each other, so that this becomes the new norm. Thank you.
Great. Excellent. And I have a lot of hope. And also, I just wanted to mention that some of the companies that have joined the Alliance for Clean Air are very complicated in terms of emissions. And sometimes addressing those emissions, the answer really is to cut across the whole thing and just get rid of the dirty fuels and go clean right away. So some of the sectors that are involved, I saw, for example, the rail service, today the maritime service. There's other, transportation overall has huge challenges. Where do you see the opportunities there?
Oh, thanks, Marcelo. And really exciting to learn more about the tool and hear about the work that IKEA is doing. It's all very impressive and hopefully will stimulate other companies to join in with that level of ambition. Yes, you know, my first actually project with Clean Air Task Force in 2006 was to press governments to put filters on their diesel vehicles. And, you know, fortunately, I think we're at a place now where we can start to actually leapfrog and just get rid of the burning of fossil fuels, especially in the transportation sector, as quickly as possible. So that means for light-duty vehicles, as Andreas mentioned, trying to electrify and go to zero emissions as quickly as possible. For some parts of the transportation sector, like aviation and heavy trucking, it's going to be more difficult to fully electrify, and that's where some of these zero carbon fuels will hopefully start to play an increasing role, such as hydrogen and ammonia. And I also really appreciated the life cycle assessment of your approach at IKEA and of this tool, because as we switch to different fuels, we're going to need to assess those fuels and their impacts on air quality and the climate really from beginning to end. So for example, when choosing natural gas or supply if necessary, or when choosing hydrogen, figuring out, really assessing all of those emissions from the beginning to the end, including the methane emissions, the black carbon emissions, and so forth. Businesses can push and pull on this system in a lot of different ways to help clean up our whole economy.
Great, excellent. And I have a question to you, Anders. So companies have internal price on pollution sometimes, and they decide things based on that. Have you thought about, this is just something I came, internal price of pollution in terms of particulate matter and local pollutants, because that will help you decide also to move forward faster.
Now I might put some rain to the parade, because we actually took a decision to not have an internal price on carbon and rather just make sure that we need to do the right activities to be in line with science. So I wouldn't say that we would maybe put the price on air pollutants. I think what we need to do is really measure it, quantify it, and see how far do our activities today, and how can we as a company aim to eliminate air pollutants as much as possibly can within our value chain. Of course, some parts will be more difficult than others, but I think that needs to be the mentality we need to have. And I think we have a lot of great progress already. We have a commitment towards 100% electric home deliveries by 2025. We have a strong electrification agenda within production and so on as well. So I think that needs to be the starting point, to just make sure that we realize it. And then, of course, you need to see, does it require an investment, or are you already changing your vehicle fleet, or maybe suppliers already changing a boiler to something else, which is already needed to be done. So a few steps, I would say, before putting a price on air pollutants.
Great. And just for reference, if you do want to price the pollutants in terms of health impacts, it's probably upwards of $100,000 per ton versus, for particulate matter, versus CO2, which is, I think the EU is around €30 per ton. So much higher overall. Now, in the case of you, Chris, so you already seen this tool. Where do you foresee there's going to be the biggest challenges for the value chain overall? Is it going to be agricultural burning? Is it going to be the use of biofuels? Where is it going to happen?
In terms of applying the tool, I think that it will depend on the business and what existing data they have already. I think with companies that are already reporting on their greenhouse gases, we have tried to provide for each sector a methodology that completely aligns with those greenhouse gases, so that it is easy and straightforward to be able to get an estimate of the air pollutant emissions from those same sectors. I think the challenge comes where you want to get more detail and more robust estimates of air pollutants in particular sectors. So for a company that's estimating their greenhouse gas emissions, the sector where you have the largest divergence in terms of the methodology is transport, because you need to know what emission control technology is fitted to the vehicles that are being used, and that may not be data that is being collected as part of your greenhouse gas reporting protocols. I then think the sectors that are more informal also have challenges in terms of data collection. So agricultural residue burning from the agricultural products that are used in businesses is one particular challenge. Figuring out for those farms that supply businesses how much of the residue that is produced is burned is a challenge. I think at end of life as well, understanding how much of particular products are informally dumped or are burned informally will also be a substantial data challenge to estimate the air pollutant emissions from those sources.
And I guess also in the methane agenda, you also have big error bars in terms of estimations of some of the sources, right? I mean, where do you see, initiatives that you participate in helping out in getting that data that's available, required for, so Andres can have an estimation of the methane production in different settings and for meatball production, and where do you see that the information that you're going to be providing coming? Is it going to be a challenge?
A challenge to procure the information? Yes. Well, I think that it's becoming easier. The methane emissions are becoming much better understood. We have better satellites going online that are going to be finding some of the bigger plumes and hopefully resulting in their quantification and earlier cleanup. There's a lot more funding flowing into this effort now of finding and understanding the methane sources, and also the abatement opportunities, the reduction opportunities. And I think that's a place where companies can really lead the way as well in terms of using their purchasing power when they're procuring the materials, which I think, if I saw correctly, with the largest bar on the chart there. In the agriculture sector, we are seeing some movement toward lower methane intensity meat and dairy through a number of proven solutions, including selective breeding of cattle to lower the methanogenesis and also increase the productivity per animal, better feed quality, dietary shifts and so forth, and even some new innovative solutions like feed additives that are being studied and could help also cut the methane production. So I think this tool is really coming out at the right time and should hopefully synergize with these global efforts and be a place where some of this new data can feed in. I'm sure I'd love to hear actually what the plans are to sort of update it over time as this new information unfolds.
And Andres, in your case, are you thinking of actually putting targets on your own value chain, try to get them to adopt the best practices every time, or are you going to use the influence that you have as IKEA to get your supply chain cleaner and cleaner each time?
Oh yes, we are already doing it. I would say we are at a point where we partner and work together with our suppliers. We actually call them supply partners, and that is, I would say, necessity already to just meet the climate goals. To also listen in to what needs do they have to move a climate agenda. Do they need discounted loans to realize an investment? Are they maybe too small to procure renewable electricity, so they can bundle electricity and enable them to purchase it? So all of that, we're in very close dialogue already. So and this agenda will just be as part of that dialogue that we have, of course, and then as part of a Clean Air Alliance, we have committed to set a goal as well. So it's not just to set a baseline, but we need to set the goal, and we will do that as well.
And is the holy grail of finding the carbon neutral meatball in the plans that you have?
Well, we don't really believe in climate neutral or carbon neutral products or materials, because everything has an impact on climate. And I think it's always important to separate, disclose what is the emissions and what are potential removals and stored. So no, there won't be, but of course we have a plant ball now, which is like 4% of a meatball's climate footprint, which is great, tasty, and so on as well. But I think we need to get away from that things are neutral. Everything will always have an impact, but at least make sure that we reduce that impact in line with science.
That's great. That's a great comment. No more what Greta calls creative accounting. That's great. That's great. Now, Chris, yourself, where are you excited with the next steps? What's the thing that you're really looking to tackle? Because now the ball's in your side of the court. You have to deliver the methodologies and have to make it useful and have people actually use it.
So what I'm excited about, and maybe it goes to Sarah's question as well about the updating of this, is that this is really the initial step in order to be able to get companies have a methodology, have a guide to estimate what the totality of their air pollutant emissions are from particular sectors. But there are then a series of steps that you need to take in order to be able to understand what the ultimate impact of those emissions are. So Andreas mentioned that for air pollutants, you need to know where they are emitted because that determines what the impact is that they have on health. So I think what I'm excited about and where I would ultimately like to get to is for a company not just to be able to report what are the air pollutant emissions associated with their value chain, but what are the health impacts associated with their value chain because of the air pollutant emissions that they've caused. And then ultimately to be able to say that a company, because of taking actions X, Y, and Z in their transport, in their agriculture, in their manufacturing processes, has benefited health by X number of premature deaths avoided, X cases of asthma avoided because of the actions that have been taken to reduce air pollution. I think that's ultimately where we would like the guidance to go.
And that is great. Probably it's the biggest common denominator you could find between the climate and air pollution agenda, saving lives, making lives better. So that's great. I'd like to give you guys a last minute to closing remarks, just on the whole day, the Alliance for Clean Air, the opportunity of using the tool. You want to start it?
Oh, terrific. Well, thanks again for this opportunity to participate and for this exciting tool. I'm hopeful that a lot of companies will start using it and look forward to sharing it with the Clean Air Task Force and CCAC network as this moves forward.
Andres?
I would say, I call out to all of you as well, and thank you all for coming as well. And I really want to convey the message. This needs to be easy. So I have full understanding for all of you. But we don't want to add a different burden here as well. So we try to make it as easy as possible. But we need your input, all of you, to actually realize this as well. So then we can have a more holistic agenda where we address both clean air and climate together as well. And then make this the new norm. And we can only do that, a norm we can only create if you're many people. So please join us.
Great. And Chris?
What Andrea said, I think. Yeah, we're about to go. We've launched this guide this morning. We are excited and happy and would encourage all companies who are interested in being part of the review and initial application process to get in contact with us, and we would be really happy to work with you in piloting it. So thank you very much.
Great, thanks. And if you'd like to follow this agenda alongside the Health Pavilion, next week is Cities Transport Day and the CCAC high-level panel, I guess, or I don't know what they're called.
Ministerial.
Ministerial. But anyway, so that you could follow that up, and I think it's really great, the things that have been done in the CCAC. And I think when the environment and health work together, it can never be defeated. Thank you.
Thank you.
Well, hello, everybody. Hello, everybody. My name's Steve Hammer. Can you hear me? I'm a climate policy advisor at the World Bank. I really appreciate your joining us here today. This is a really important event, trying to bridge some of the key issues that is facing the world today, and both of which are proving to be very prominent here at the COP, and that of healthcare and climate. Last year, the COVID pandemic really showed us the strengths and weaknesses of our national and local healthcare systems. And this is proving to be very important intelligence for us as we look towards the future and the system stresses that are going to be created as a result of climate change. And so in many ways, many have characterized the COVID crisis as a bit of a dress rehearsal for healthcare systems in communities and in countries. So we're here at the WHO Climate and Health Pavilion as part of a series of events that they're hosting over the next 2 weeks, where we're talking about these issues, trying to elevate attention among policymakers and practitioners alike. I'd like to thank the WHO for your generosity in hosting today's event. Now, today's event is being recorded, and if you're watching via WebEx or YouTube, you can join in via chat boxes to pose questions to the panel. So, why are we here? And today is a particularly relevant day to have this conversation. If you've been following the COP26 so far, today is known as Finance Day. And that means it's a big day for the World Bank Group. The World Bank is the world's largest multilateral provider of climate support in low and middle income countries around the world. Last year alone, we financed $26 billion of climate mitigation and adaptation projects. And in this year's new Climate Change Action Plan, we committed to ensuring that an average of 35% of our total financial support to clients, to countries, to businesses, for the period 2021 to 2025 will link to climate action in some way. Climate and health is also an increasingly important part of our agenda. And in recent years, the health team has been very active in developing new technical assistance resources and providing financial support to clients on projects that advance both climate and health goals. We'll have an opportunity to dig into that type of support and what we're actually doing to help clients with today's session. My colleague, Tom Arabi, a lead health specialist at the World Bank and one of our top experts on health and climate issues, will make some opening remarks. Mafalda Duarte, the CEO of the Climate Investment Funds, will then join us by video with a short statement that focuses on how the Climate Investment Funds, or the CIF, engages on this issue, working through the World Bank and other multilateral development banks. Stephen Dorey will then present the results of a new report the bank has prepared in collaboration with many other institutions focused on COVID-19 and climate smart healthcare, an opportunity for synergistic response. We'll then have a panel of experts, some of whom are here, some of whom are joining us virtually, participate in a discussion to react to that report and provide their own take on those issues. Joining me here in Glasgow is Sonia Roshnik from the international group Healthcare Without Harm, and online, Feng Zhao, from a manager with the World Bank's health team, and Lori Rufo from the Climate Investment Funds. Hopefully we'll have enough time and we can take some questions from the audience as well. Tamir, over to you for some opening remarks.
The climate crisis is a public health crisis. According to the IPCC, between 2030 and 2050, at least 250,000 more people could lose their lives to climate-related malnutrition, malaria, diarrhea, and heat stress. In addition to human costs, the economic costs are real and troubling. Climate impacts on health could cost up to $4 billion by 2030. But these devastating outcomes are not inevitable. There are actions we can and must take to avert them. but time is running out, and we need to act with urgency. The Climate Investment Fund is pleased to support the COVID-19 and Climate Smart Healthcare report, together with colleagues from the World Bank. This critical study shines a light on the linkages between COVID-19, climate change, and human health. It offers a menu of practical collective actions to spur on the COVID-19 recovery and help build climate resilient and decarbonized health systems. We are working with the World Bank to elevate the understanding of climate health nexus in other ways as well. Our teams are jointly developing analytical tools tailored to country and local contexts. For example, we have recently rolled out climate and health vulnerability assessments that identify in-country climate and health risks and recommend investments to address them. On top of this, we are developing a specialized resource for quantifying the health-related economic costs of inaction, which could also explore the economic implications of climate health policy options. Armed with these analytical tools, the Climate Investment Funds and our partners like the World Bank can better ensure that our climate investments are also public health investments. One cannot come at the expense of the other. Thank you for coming to this important event and for your valuable contributions. I wish you all good health and a productive session.
Okay, we're having a bit of technical difficulty right now, so if you just give us a second, we're going to try and find bring in our colleagues. Just 1 second. Okay, is Stephen? Dorby?
No one in it.
No one
the
in it.
host, Tamer, is not in the call, so
That's a problem.
I can't do
Is
anything.
Lori in the call?
No, no one.
No one's in the call.
No one.
No one's in the call right now.
hear us in Glasgow? I think the issue is for our WHO colleague, the issue is that you're connecting to the wrong link. It should be the one that Stephen Hammer has, so maybe he could share that with you. Because I'm on two WebEx connections at the moment, one just with WHO and the other one for the actual event.
Tamer, can you hear me?
I can hear you. It should be Stephen Hammer has, so maybe he could share that. For colleagues on WebEx, please forgive us for this. I mean, it's just going to take a moment for us to connect to our colleagues back at the WHO Health Pavilion. Yes, I can hear you, Stephen.
Can you hear me?
I can hear you, Stephen.
Okay, great. This is Steve Hammer in Glasgow. Yeah, so apologies. We have a broken link, so we're trying to get the right one back up on the system again. So just one more minute.
Okay. So for colleagues on WebEx, please forgive us for this technical glitch. We're trying to establish the connection right now with Glasgow. Please give us a moment. Thank you for your patience. Perfect. I think we can see now our colleagues in Glasgow.
I think we can see you up on the screen.
Stephen Hammer, can you hear us?
Yes, I can.
Stephen, we can see you, but we cannot hear you.
Okay, can you hear me now?
We can hear you now.
Perfect.
Yes.
I think we're back in action, folks. So,
excellent.
I think we just take it from the top. I'll give a short, quicker introduction. I apologize, everybody. Thank you for your patience. So thanks for joining us at the WHO Climate and Health Pavilion. My name's Steve Hammer. I'm a climate advisor to the World Bank Group's climate change team. And I'm really pleased you've joined us this afternoon, this evening, to talk about this event which bridges the climate and health worlds. Both topics are front of mind here in Glasgow, as over the last year, the COVID pandemic has really shown us the strengths and weaknesses of both local and national health systems. In many regards, this is a bit of a test run for the stresses that these systems, these healthcare systems, will be facing in the years to come as a result of climate change. So we're here at the WHO Pavilion, and thank you to the WHO for hosting us, trying to elevate attention to these issues among both policymakers and practitioners. Today's event is being recorded, and if you're watching via WebEx or YouTube, you can join us via chat boxes where you can pose questions to our panel. You can see we have one panel member in person and others joining us online. So why are you here, and most importantly, why are we having this conversation today? If you've been following the discussions at COP26 in Glasgow, you may be aware that today is Finance Day. There are thematic days spread out over the course of the two-week COP. But today's Finance Day, and that's a particularly important day for the World Bank Group as the world's largest multilateral provider of climate support in low and middle income countries. Last year alone, we provided $26 billion of support for climate mitigation and adaptation projects. And in this year's new Climate Change Action Plan, which covers through the year 2025, we're committed to ensuring that fully 35% of all of the financing we support we provide to clients, and that includes both governments and businesses, will address climate in some way over the period 2021-2025. Now, climate and health is an important piece of that agenda, And in recent years, our health team, and you're going to hear from several of those experts today, have been active in developing new technical assistance resources, new analytic resources, data banks, in addition to providing financial support on projects that advance both health and climate goals. First, we're going to hear an opening statement from Tamer Rabi, lead healthcare specialist at the bank, and one of our top experts on climate and health issues. He'll make some opening remarks. Then we'll be joined by Mafalda Duarte, the CEO of the Climate Investment Funds, who will join us to talk about how the CIF engages on these issues, working through the World Bank and other multilateral development banks. Stephen Dorey will then present the results of a new report the bank has prepared, focused on COVID-19 and climate-smart healthcare, opportunities for synergistic response. We'll then have a panel of experts, Feng Zhao, a manager with the World Bank's health team, Laurie Rufo from the Climate Investment Funds, and joining me here in Glasgow, Sonia Roshnik from the international group Healthcare Without Harm. They'll react to the report and provide their own take on these issues. If we have time, then we'll move to audience questions. So Tamer, over to you for some opening remarks.
Thank you very much, Stephen, and good afternoon, good evening to everyone, wherever you are in the world. My name is Tamer Rabi. I'm a lead health specialist in the World Bank's Health, Nutrition, and Population Global Practice. At the beginning, let me take this opportunity to welcome all our friends and colleagues who've joined today's event at COP26, either in person or online. It is with great pleasure that I provide some opening remarks on behalf of the World Bank on perhaps what is considered the most significant challenge to achieving sustainable development and threatens to drag millions of people into grinding poverty. There's no doubt that climate change is the defining public health challenge of the 21st century. This and the fact that the COVID-19 pandemic has already reshaped the world, magnifying gaps in health systems and intensifying pre-existing inequalities, calls for joint global action to enhance health system resilience to both climate change and to current and future pandemics. The convergence of COVID and climate change also offers the real promise of truly sustainable health systems, which decouple progress towards universal health coverage from carbon emissions. At the World Bank, we're deeply committed to tackling the climate crisis, together with our client countries and partners, and have sharply increased the share of our financing towards climate adaptation and mitigation in our country programs, including in the health sector. We have adopted a rigorous process that involves a number of critical steps, including one, the screening of all World Bank operations for climate and disaster risks, and two, integrating climate considerations into all World Bank lending aligned with the MDB joint methodology and climate co-benefits. We have also dedicated much needed attention to understanding country-specific context related to climate change through our ongoing work with the country climate development reports. And in this vein, and through our engagement in the health sector, we've been conducting climate and health vulnerability assessments in a number of countries across all World Bank regions. Such assessments have provided us with a more grounded understanding of the climatology and health risks, as well as adaptive capacity at a country level, ultimately with the aim to assist our client countries with their climate action plans and the successful implementation of their nationally determined contributions. From another perspective, we've intensified the monitoring of climate-related activities by incorporating climate-specific indicators in World Bank finance projects to capture progress towards achieving specific climate outcomes, and have also been applying the resilience rating system alongside of this. Moving forward, we're close to finalizing the development of a new country climate and health economic valuation toolkit that would assist greatly in understanding the climate-related economic impacts from a health sector perspective. Shifting gears, the World Bank recently had to mount a health response to the COVID crisis, which you will hear more about from our Global Engagement Practice Manager, Dr. Feng Zhao. But here, I'd like to highlight that the emergence of the COVID-19 pandemic has brought with it a sharp focus on public health services and health systems, with climate change further aggravating this challenge. In this regard, this was the impetus behind the report that we were presenting today to get us closer to reaching climate smart universal health coverage. Here, I'd like to extend our deepest gratitude to our partners in the climate investment funds who have partnered together with the World Bank and Healthcare Without Harm to develop the report and who have been a core funder of this work. With this, I'd like to thank you once again for joining us today and look forward to a very productive discussion. We will now be viewing a recorded message from our colleague Mafalda Duarte, Manager and CEO of the Climate Investment Funds. Thank you.
IPCC between 2030 2050, at least 250,000 more people could lose their lives to climate-related malnutrition, malaria, diarrhea, and heat stress. In addition to human costs, the economic costs are real and troubling. Climate impacts on health could cost up to $4 billion by 2030. But these devastating outcomes are not inevitable. There are actions we can and must take to avert them. But time is running out, and we need to act with urgency. The Climate Investment Funds is pleased to support the COVID-19 and Climate Smart Healthcare report, together with colleagues from the World Bank. This critical study shines a light on the linkages between COVID-19, climate change, and human health. It offers a menu of practical collective actions to spur on the COVID-19 recovery and help build climate resilient and decarbonize health systems. We are working with the World Bank to elevate the understanding of climate health nexus in other ways as well. Our teams are jointly developing analytical tools tailored to country and local contexts. For example, we have recently rolled out climate and health vulnerability assessments that identify in-country climate and health risks and recommend investments to address them. On top of this, we are developing a specialized resource for quantifying the health-related economic costs of inaction, which could also explore the economic implications of climate health policy options. Armed with these analytical tools, the Climate Investment Funds and our partners like the World Bank can better ensure that our climate investments are also public health investments. One cannot come at the expense of the other. Thank you for coming to this important event and for your valuable contributions. I wish you all good health and a productive session.
I'd now like to invite Stephen Dorey to present the results of the new report. Stephen, over to you.
Thank you, Stephen. I hope you can all see my slides, my screen. Good evening, good morning, good afternoon, everybody. And thank you for the introduction, Stephen, and for the words from Mafalda and from Tama. So my name's Stephen. I'm from the Health, Climate, Environment Program within the World Bank. So I'm briefly going to summarize the key points from this new report, which looks at COVID-19 and climate smart healthcare and focuses on some of the potential adaptation and mitigation activities that we think countries could be employing. The report provides starts off by providing some context, examining the links between the COVID-19 challenge and the climate challenge, which we call the dual crisis. So COVID-19 has a major impact on health, obviously, also leading to vast increases in mortality and morbidity, pushing many back into poverty and leading to wider issues such as increasing undernutrition. Meanwhile, on the climate side, I think we're all well aware of how this affects and links to health, and the major pathways including temperature, precipitation, rising sea level, and also changing disease patterns, particularly through vector disease patterns. Significantly, both of these then converge to raise human health risks through communicable, non-communicable, mental health, and also affecting services such as public health services and health systems. So the report then also considers some of the shared drivers, vulnerable groups, and interacting management impacts of the dual crisis. For example, if we look at land use change, this could well be is often implicated in the in zoonotic disease emergence. Could be the case in COVID, and it's also a well-known cause of greenhouse gas emissions through deforestation. Looking at vulnerable groups, COVID-19 disproportionately affects many of the very similar groups to climate change. In fact, the only real difference is the direct health impact on younger people, though obviously we know that they're going to have bear the brunt of the legacy of this pandemic, similar to climate change. And looking at the capacity to manage this, both crises also risk negatively interacting with one another. For example, reducing access to resources and impairing basic services and information. One example would be that we've got on the screen here would be emergency shelter capacity. So where social distancing is required, you either need to compromise on that social distancing, or you severely reduce the capacity of your emergency shelters for extreme events such as wildfires or windstorms. So, what can we do about this, and how can we avoid the scale, given the COVID crisis, of locking us into a high carbon service delivery legacy for our health systems? So we've structured this part of the report around 9 components. Now, I'm not going to go through all of those, but these represent the multi-phase programmatic approach that the bank used to respond to the health aspects of the COVID crisis. And therefore, we've done this in a way to help to integrate these findings into action. To support these, we have a number of case studies in the report, and these are from all different regions of the world. And with the actual report itself has a document with it specifically focusing on these case studies. So I'll just briefly summarize a few of these in the next few slides, and then we can go on to the panel. So for each of these, starting perhaps with public health surveillance and risk assessment, for each of these components, we try to look at both adaptation and mitigation activities, and for some of these, you'll see the activities across both. They have mitigation and adaptation benefits. So looking at public health surveillance and risk assessment, it's clear that a One Health approach is relevant to COVID, but it's critical to pick up new diseases that we expect associated with climate. We're on the mitigation side. In integrating surveillance systems will lead to efficiency savings, which will include carbon emissions, as well as making these systems more effective. The report here looks at Yemen, where a surveillance system was strengthened with the electronic integrated disease early warning system. And this means that their system is going to be better at picking up new diseases that we expect to come from climate. And it should be remembered, this has been done in the context of a conflict afflicted country. So the things that we're talking about here are not just for high income countries that are peaceful. Anyone can needs to act on these. Switching to emergency preparedness, planning, rehabilitation. I highlight here the importance of health worker training on climate emergencies in advance. Preparation is everything. Looking across to mitigation, one easy option really is low or possibly no emission backup generators. For example, during daytime, solar generation can be just as effective, and you then don't have to rely on the fuel supply chain, which can be impacted in these events. So the example given here is in the Philippines, a country that is well used to being affected by extreme weather. There, the multi-hazard approach that was already in existence enabled a very rapid response to COVID. I'll just go through one or two more examples. So for capacity for testing, isolation, and treatment, important here to highlight the importance of infrastructure, and this needs to be resilient to climate shocks. We go to vaccines. Adaptation is obvious. You know, the COVID pandemic is the first time that countries have vaccinated adult populations against a novel pathogen, and this is going to be something that we will be seeing probably again with climate. On the mitigation side, sustainable cold chains have an obvious mitigation target, and something that the report provides plenty of interventions that can be employed. The bank, Ghana was the first country that the World Bank approved funding for vaccine deployment, and this was achieved in the context of sustainable cold chain principles. It was a great start. Obviously, still a long way to go. This is the final component that we'll look at just now, building back better. Where do we go from here? So investments in nature-based solutions can provide robust and very cost-effective solutions for healthcare delivery in a changing world. This is particularly the case, for example, with cooling for vegetative shading, or with flood protection, where reforestation, including in urban areas, can have very significant impacts. On the mitigation and low carbon healthcare side, it's important that health systems play their part to decarbonize in alignment with the Paris Agreement. And we need to remove fossil fuel-based electricity generation from health systems as quickly as possible. Similarly, health systems rely a lot on transportation, and a modal shift to low carbon transport systems should be prioritized. Where possible, especially in urban areas, this can be predicated on human mobility. And then finally, it's important to see what we can do to transition to local sustainable food systems. I'll stop here, just leaving these final points that we can have up on the screen. So in summary, the COVID pandemic has magnified gaps in the health systems and exacerbated existing inequalities. Remember the vulnerable groups I spoke about. Climate change is increasingly threatening the ability of our health systems to improve population health, and this is something we need to recognize. Many of the health sector COVID interventions have the dual potential to make health systems more resilient to climate-related risks and to limit health sector carbon emissions. Thank you very much for your time. I'll hand back to the team now.
Thank you, Stephen. Very comprehensive, very clear presentation. And I think one of the things it does nicely is show how system features can serve both ends. And one of the things that I was hoping we could do with some of our panelists is to have them think about the implications, in terms of the work that they do. And I'm going to start with Feng. You've been coordinating the World Bank's health system response to the COVID pandemic over the last 2 years. And Stephen mentioned our use of the multi-programmatic approach, or MPA, as the framework that we use to think very holistically about the challenge. Could you talk to some of the lessons that we've gained from that exercise, from those projects, and what you think the links are going to be as we look at climate going forward? Turning it over to you now.
Thank you so much. Greetings from Geneva. I'm sorry I couldn't be in Glasgow to be with you, but looking forward to the conversation. The way I see it, we are facing two crises at the same time, both COVID pandemic and climate change. You have heard from the world leader about the magnitude of the problem on the climate change side, and we have experienced in the last 2 years about the pandemic. The way I say it, they have some commonalities. Both crises has affected the whole world. No one is expired. No one is spared. Both are not a specific sector issue, and they affect all the sectors, the whole world. It really require a holistic, multi-sectoral intervention. And both require immediate attention and action, and we just cannot afford to sequence them. And so we have to find a way, despite our limited bandwidth and effort and resources, we have to find a way to tackle both challenges at the same time. Now, the the World Bank has committed to addressing both crises. Um, Before the COVID, we already have a corporate commitment to climate co-benefit. What does it mean is all the bank's operation and projects have to quantify the contribution to climate change agenda. This is a major undertaking which provide responsibility and requirement for our operational work to align with the climate agenda. We didn't drop those during the COVID, despite the challenges we're facing. We streamlined some of the procedures, but overall, the climate co-benefit, so it's in place throughout the pandemic and continue to hold us accountable in this great agenda. On the COVID side, the bank has taken unprecedented effort to address COVID. We put in very significant size of financing into it. The first phase on the emergency response, the 6 billion program was quickly put in place, put in use, and with very quick actions. And currently, we have a 20 billion program to support the vaccine issues. One of the feature, if I can highlight in our COVID response, is really the multi-sectoral design, which we realize COVID require actions not only from the health sector, but also a lot of other key sectors. So the design of that has reflect on that. This design actually also allowed us to make a connection to the climate agenda. And let me give a couple of examples. For example, we have been working closely with the energy sector, which allow efficient energy to supply to the health facilities to ensure they continue to function and provide services during the pandemic. We have designed to feature sustainable cooling in terms of vaccine delivery and other service delivery. We also work very closely with the water sector, the wash agenda, which is a typical example, make sure there's clean water and in place to allow the response to take place, which is also part of the climate agenda. And last but not least, we work very closely with agriculture and the environmental sector on the One Health agenda, which not only addressing human health, but also cover on environmental health and animal health. So those are examples, and also from these two crises, we have learned quite a bit. We need to address the two challenges at the same time. Moving forward, we'll continue to make that effort and make that connection and really take advantage of the multi-sector approach, which is the World Bank's comparative advantage. We're looking forward to continue to partner with everybody here and also beyond, and to continue make effort to address both challenges, COVID pandemic and also climate change.
Thank you very much, Feng. Sonia, Healthcare Without Harm was a key partner in the development of this report, worked on many of the case studies that were featured. Tell us, what were the big takeaways for you as part of this work? And then I'd like you to think a little bit more about, okay, if we treat the first examples, the first efforts of this type as some type of pilot, what is it going to take to move this to scale? And what are the prospects of that occurring in the near and medium term?
Well, thank you very much. Yes, we're delighted that the World Bank has written this report. So thank you for showing some leadership. The pandemic crisis does offer us a huge opportunity to try and respond and recover from it whilst integrating everything that we know about being more prepared, and also decarbonising the health sector and building resilience in the communities around. So the thing that was most struck me in the preparation of this report really is that there are multiple places where people are really trying to do that already. So just to give you an example, if you take the state of Chhattisgarh in India, where they've been solarizing health clinics, they realized that by providing, renewable energy to clinics, not only could you increase the number of patients that are seen, but also increase the number of deliveries. So actually that helped them be better prepared for the pandemic, and it spurred them to commit to 100% solarization. So the pandemic actually helped build that drive and that momentum. Another example in Malaysia was a Tsuchi dialysis center that, provides vegetarian meals to staff and to patients anyway, but during the pandemic crisis, as a means of protecting staff and patients and their families, provided an extension to that meal service by providing them freely and in disposable boxes much more readily. So thereby building the resilience of the community and actually trying to encourage people to move away from a meat-based diet. So again, they used that opportunity during the pandemic to demonstrate that you could go even further. And what we've seen since trying to compile those case studies is, the NHS in the UK has, committed to net zero, developed a net zero plan in the middle of a pandemic. We've been bringing organizations into Race to Zero with the UNFCCC, and we've got 54 health systems. That's over 11,000 hospitals that have joined in 24 countries. So people really have grasped that the climate crisis is a health crisis, the pandemic is a health crisis, and actually they've got some common responses to that. In addition to that, and at this COP, there will be an announcement about a number of countries that are committing not just to make sure that their systems are resilient, but that they are going to be looking at a baseline carbon assessment and decarbonizing, and many of them setting a date for net zero. So the pandemic, in a way, we could have all just turned around and said, oh, it's all too much. But I think it's fueled people into thinking, really being scared that if we do not act now, it will be too late. And the reality is that this is not going to be the last pandemic. So I'm delighted that it spurred us on. It's a little bit scary that we needed this wake-up call. I hope that this COP will help drive that even further, and, that financing institutions will see the sense of building these things in a synergistic way, of using the opportunity of One Health and doing the things together. So.
And when are we going to hear that announcement about the country commitments?
On the 9th of November.
Okay, watch for that.
Yeah.
Lori, I'm now going to turn to you. You work with the climate investment funds, and one of the windows, the funding windows within the climate investment funds, or the CIF, is known as the pilot program for climate resilience, or the PPCR. But resilience, we've heard what it can mean in certain contexts. But can you talk to us about what it has historically meant to the CIF, and how you are now kind of re-envisioning what it might mean as we look at the current crisis with COVID, but also the future crisis going forward, of how we bring these two together? And is there, because some of the other windows are focused on decarbonization, do you see opportunities to bring them together in a coherent and systemic way?
Thank you, Steve. Can you hear me well?
Yes, we can. Thank you.
Yeah, thank you. Good day and good evening, everyone. Let me start by giving you a brief background of the Climate Investment Funds. So the Climate Investment Funds was established in 2008. And since then, we have been working closely with our client countries and MDB partners to design and implement transformative solutions to tackle climate change. We have pursued this agenda through our dedicated programs on clean technology, energy access, climate resilience, and sustainable forests. With the implementation of these programs, we recognize the direct and indirect health impacts of climate change. So in the investment plans of the countries that have been working with us, they have identified projects that would address some of the fundamental drivers of health impacts of climate change. And let me illustrate that on how we are doing it on the ground. So for instance, under our pilot program for climate resilience, or PPCR, We have supported the construction of resilient infrastructure systems in water supply and also in the health facilities in selected vulnerable countries. We have also invested more than 300 million in hydromet services in order to improve climate services, early warning system, and disease surveillance systems. In PPCR, we have also supported projects that promote climate smart agriculture, community based livelihoods in order to provide sustainable income to communities. And at the same time, we are aiming to improve the nutritional status and health of the population, particularly the women and children. In Tonga, the lack of basic infrastructure has been identified as a priority to build climate resilience. So, what the CIF did was provide finance to support climate resilient public infrastructure in the social and health sector. In Africa, like in Zambia and Niger, drip irrigation technology and solar powered boreholes improved the food production and also promoted good health outcomes in communities. Also, in our forest investment programs, we have been working with indigenous peoples and local communities to support sustainable forest management practices and at the same time improve their income and overall well being. The country's efforts under this forest program that we have offers an approach to decrease human and wildlife contact and also improve ecosystem health, so decreasing the risk of zoonotic transmission. So, like for instance, in the Democratic Republic of Congo, indigenous peoples are turning to traditional protection practices by using plants as preventive medicine and also implementing community-led action to raise awareness about COVID-19. With our renewable energy program, we have also been supporting countries to deploy renewable energy solutions like solar, geothermal, and biomass to increase energy access with health co-benefits from cleaner air. So an example of this is that in Honduras, we built solar-powered mobile clinics to strengthen the health capacity of the health system's capacity and also to meet the COVID-19 demands. Also, I would like to mention that in the wake of COVID-19 pandemic, CIF has operationalized some urgent actions to meet the COVID-19 challenges. We took that as an opportunity for us to build back greener, resilient, and more inclusive. So what we have done is we have allocated available funds under the PPCR to further enhance climate resilience while at the same time supporting COVID-19 response strategies of countries. Interventions under this window included promoting sustainable livelihoods, improving water and sanitation, building resilience and promoting low carbon lifestyles in cities, developing tools and insurance schemes to manage risk, and at the same time, we have also some initiative to provide recovery assistance to vulnerable communities. In our technical assistance facility window, we also established a separate funding program to offer technical assistance and capacity building support to various sectors to integrate green and resilient policies into their COVID-19 recovery plans. And in here, under our technical assistance facility, we have noted that most projects have put importance on integrating health climate linkages into preparing long-term development plans, and some of the capacity building activities are geared towards delivering health benefits. And lastly, I would like to mention that we have also put together a knowledge product on how climate finance can support COVID-19 recoveries. So what we have done here is that we have drawn some lessons from our own implementation experience over the past 12 years. In that report, we have provided insights on how climate investments can boost green recovery, promote positive health outcomes, strengthen policies and institutions, and at the same time, support vulnerable population and social inclusion. Thank you, Steve. I'll stop from there.
Thank you, Lori. I'm going to, first off, we're running a little short on time, so I'm going to do some quick follow-up questions for each of you. And Lori, I'm going to come back to you first. So you kept talking about the programs, the technical assistance resources, the financing you're providing for renewable energy, for nature projects, what have you. For those who are unfamiliar, can you just very quickly talk about how the SIF resources are distributed internationally? That's one. And then secondly, as you are going forward, because now that a lot of the work you've done in the past, it's been indirect linkages to health. This is an attempt through this particular initiative, the research that you've supported, to actually provide a much more direct linkage. Because the SIF is now growing, how do you expect that health may be woven more systematically into the different climate support windows that you have, that you're going to be opening up very shortly?
Thank you, Steve, for that very good question. So first, I would like to emphasize that all our programs are country-led, and we involve all the stakeholders in all our programs to identify and implement programs and projects that they think would be able to bring them to low carbon and resilient development pathway. And moving forward, the SIF remains committed to help build the understanding about health and climate change linkages. So apart from providing support to develop this COVID-19 report that we have just presented earlier, we will continue to work with the World Bank. First, we will develop a methodology to conduct climate and health vulnerability assessment in countries. And second, we will develop a tool that the Ministries of Finance and the Ministries of Health can use so that they can estimate the health cost of inaction to address climate change. And this tool would also help them analyze the financing implications of policy options and investments related to climate change and health. Now we are in a very opportune time to build from the success of our existing programs. We are now gearing up to launch and implement our new action programs. Although these programs are not specifically focused on health, it provides opportunities to invest in programs and projects that would promote low carbon and climate resilient health system, and at the same time promote good health in vulnerable communities. So one of them is our renewable energy integration program. In that program, we will support first-of-a-kind investments in enabling technologies and other emerging innovations on renewable energy integration solutions. What could involve here are, employment of renewable energy technologies to enable the safe storage and transport of vaccines and medicine, and also promote energy efficiency in hospitals and health facilities. We also have our Nature, People, and Climate Investment Program. In that program, we will also finance integrated landscape solutions to improve health and well-being of rural communities while at the same time conserving our natural resources.
Okay, so Lori, I'm afraid I'm gonna have to cut you short because I want to get to the other two speakers with some follow-up questions. But thank you for helping to clarify and explain some of the thinking about the road going forward. Feng, I want to come back to you. That one of the things that you've made clear in your comments, as did Stephen in the presentation, was that climate and COVID are both multi-sectoral challenges. And that means, again, it's Finance Day at the COP. So the implications for us in a very practical way is that there's no single budget that one must target to ensure that things like this get financed appropriately. So can you talk about the bank's thinking in terms of how you help governments kind of frame the issue or think through in a systematic way how they tackle this, given there are so many potential angles that they need to target this from?
Thank you. That's a great question. My answer would be simply, climate change is one of the greatest challenges facing us, and we will have to really be all hands on deck, use our means. One thing taking into consideration is when we structure different funding modalities, they bring in different advantage and limitations. And more importantly, the incentive which has brought in will have a long-lasting impact. So at the World Bank, we're exploring all the options. For example, the climate co-benefit I mentioned in my earlier comments has really played a key role to mainstream climate agenda in our health projects and health operations, because all sectors, including health sector, at the bank, we have to really figure out to what extent the funding we put in can contribute to climate agenda. So that's incentive has provided greatly to mainstreaming climate into our operation. I also see the opening for the climate funds to play a key role in addressing climate change and health. And SAFE is one great example. I also see there's a space for the traditional health financing to really mainstream this agenda, prioritize the climate agenda in our operations. We talk about adaptation agenda, mitigation, and there's a whole lot we can do to do it effectively to feature climate change in our operation. We have some experience to build on. This is my last minute. We have the GFF like modality, and we have other multi-donor trust fund. We have different modality we can look into. But my point is simply, given the magnitude of the problem, we have to be really explore all those options and have a all hands on deck approach. Over.
Great, thank you very much. And again, one word you kept using over and over again was this notion of mainstreaming. And when you talk about climate co-benefits at the World Bank, that was, fundamental to what the tracking of how we are spending our money and what multiple values you can derive from each of those development projects, both in terms of the original development goals, but also the climate mitigation attributes or the climate adaptation benefits that you also achieve. So for us, a lot of the conversation that we continue to have with clients is how you can achieve this mainstreaming, the role of targets, the role of tracking to actually help move that agenda forward. So Sonia, I'm going to come back to you for the final question. And I want you to kind of step back and think a little bit bigger. That's one of the things your group does all the time, is trying to think about where do we take this and how do we get there. But again, because it's Finance Day, what are you seeing out there in terms of the level of financial support that's coming available to address this issue? Are we seeing things coming together? Is it still relatively, an isolated budget item that people are paying attention to? That's the first in terms of the trends. And then secondly, it's like, if it's not enough, and I'm going to make the assumption that it's not enough, who needs to take action, and what does that action need to look like?
Well, you're right. I'm not going to think it's enough. You're right. Thank you for that. I mean, the reality is that it does need to be mainstreamed, like Feng suggests, but it's absolutely nowhere near that. We're not even starting to do that. So I would say it's still very much at the seed stage. Mm-hmm. And it's still project by project and still very interspersed. So we're just seeing, a few good things happening here and there. And what we really need to do now is to consolidate that into something that's absolutely scaled up at speed. So to me, it does mean that every element of financing should absolutely be focused on integrating health, integrating mitigation, and integrating resilience and equity. Otherwise, we are going to somewhere lose along the line.
So, but specifically, who do we need to be looking at right now to make sure that they are doing it? Is it government? Is it the multilateral development banks? Is it, is
I'm
it
going to say it's everybody.
Okay, all right.
I think it's everybody, because everybody's got to take their responsibility. I mean, the governments that are going to be committing to this, they're going to have to put some up, but actually they will need support. This is not going to just happen without some support and some major thinking through in how to track that and make that happen. I think the other bit is that we should be trying to make sure that it does relate to health outcomes. Ultimately, if we want accessible healthcare for all, that is decarbonised, that is resilient, it's going to have to really push the boundaries everywhere. So I'm just going to say everybody's going to have to put it in. And us as an NGO, we also need to put our thinking into how we can best support that. You helped us with a global roadmap for decarbonisation, and that highlighted some of the things that needed doing. So there's opportunities for governments to, put their money in mainstream, for big agencies to do so, and philanthropy. I mean, we all will need to be pushing for that. And there's not a minute to lose. Health is key, and the climate crisis is a health crisis, just like the pandemic crisis is. So I hope that this day of finance will help spur some health action, as well as some climate action.
Great. Well, thank you very much. We have run out of time, unfortunately. I think our Our technology glitch at the beginning meant that we weren't able to get to audience questions, so I do apologize for that. I would like to again thank the WHO for their support in terms of hosting this event today. I'd like to thank the audience in person and online. Again, this is a first that the WHO has hosted a pavilion like this at the COP. I think it's a fantastic thing that has happened. I've been coming to COPs for several years now, and I was also in the fortunate position to be involved in some of the bank's early climate and health work. And so to have a venue like this, to have events like this that are just going to keep pushing this message, talking about it from different perspectives, whether it's the analytics, whether it's the data, whether it's the case studies, bringing that information together, helping to prove to policymakers and prove to practitioners that there are opportunities, that there are sound methods that you can follow, that there are some crazy ideas that may actually not be so crazy if you think them through in terms of how to get them into your institutional process. So I'm excited that we were able to join you today, and I thank you very much for joining us online. And I hope you'll come back to the WHO Pavilion at the COP and for more events in the coming week and a half. Thanks very much. Have a good day or evening.
Thank you.